Thank you, Mayor.
Hello. Hello.
Hello. So good afternoon. Thank you, audience, for joining us virtual. Thank those that are in the chambers with me today as we call our Tuesday, July 21st meeting to order. At this time, the Pledge of Allegiance will be led by Mr. Carl Persis.
Thank you, Madam Chair. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, Mr. Persis, and I'd like to introduce my colleagues. I have Mr. Carl Persis representing District 4, Mr. Ruben Colon representing District 5, Mr. Ted Doran, our school board attorney, Mrs. Erin Lieben, our agency clerk, Ms. Jamie Haynes representing District 1, Ms. Linda Cuthbert representing District 3, and my vice chairman, and I'm Ida Wright representing District 2 and your chairman for this year. And Dr. Carmen Bagabin, our interim superintendent. Items for approval on this agenda are items 3.01 and 3.02. Times will be provided for public comment on any action item before a board vote is called on the item. For public comments during the virtual meeting, please dial area code 386-734-7190, extension 20236. Again, that number is area code 386-734-719, extension 20236. At this time, we will move down to item 2.01. Dr. Bagabin, do we have any items as we look at the agenda? Have anyone requested any changes to the agenda?
Yes, Madam Chair. We would like to change the order in which the items are presented tonight. We feel that the information presented in item 4.02, discussion of emergency policy concerning face coverings on school property, and 3.02, or academic and work calendars for the 2020-21 school year, it will be helpful for the board and the public while we are presenting items 3.01, which is approval of the fall reopening plan.
Thank you. Colleagues, you've heard the recommendation from the superintendent. Are there any questions? Ms. Cuthbert? You're on mute.
What order? Okay, yes, thank you. What order is it going to be in? Which one are we going to do first?
So we're going to do it in reverse. 4.01.
Reverse order. Okay.
We will take, then we will have our academic calendar, which is 3.02, and our final presentation will be board action item, fall reopening plan.
Okay, thank you very much. Madam Chair, I move that we amend the agenda for this evening.
Is there a second? The motion has been properly moved and moved by Ms. Linda Cuthbert, second by Mr. Ruben Colon. Any other discussion? Hearing none, I'll call for the vote. Mr. Ruben Colon, Ms. Jamie, Mr. Carl Persis.
Yes.
Thank you. Ms. Linda Cuthbert.
Yes.
And Ida Wright, yay. The vote was unanimous. Thank you. Moving down to item 4.01, board discussion item, Superintendent Bagabin.
Thank you, Madam Chair. Madam Chair, at the July 15th special board meeting, the board expressed an interest in discussing an emergency policy concerning face coverings on school board property. Because of tonight's meeting, it is also a special session. We have included a place for the agenda item for that specific discussion. I would like to introduce Mr. Kevin Pendley. Mr. Kevin Pendley is our general counsel. To please come forward and present to us the information to the board on this subject.
Good afternoon, Madam Chair, members of the board. It's my pleasure. As Dr. Balgobin said, in response to last week's reopening plan and the recommendations in that plan, staff is bringing forward tonight emergency rule policy number 503, entitled mandatory face coverings as a matter of health, safety, and welfare on school campuses. The policy was developed consistent with board member direction that we have a simple, direct policy that can be consistently applied across the Volusia County school system. The policy you have before you applies not only to students, faculty, and staff, but also to vendors, visitors, and anyone coming on school property. The policy was developed in collaboration with many departments and stakeholders throughout the district. The Face Coverings Committee consisted of administrators, principals, teachers, staff, and representatives from transportation and Schoolway Cafe were also invited to participate. I would like to thank Assistant Superintendent Patricia Core for spearheading the committee's efforts on very short notice. We had meetings last Thursday and then on Monday, yesterday, to go over this with those stakeholders. Ms. Core is here today to address any additional considerations following my remarks, should you have them. I also want to point out to the board that this policy and the language of the draft is drawn from numerous policies being adopted currently by other districts throughout our state, and our sister districts in particular in Alachua, Broward, and several other districts have shared with me their proposed drafts. So this language is not wholly from this department alone, but draws on those other good work done by other districts across the state. Everyone is facing this issue right now, and it's one of vital concern, not just here in Volusia, but across the state. So the emergency policy brought forward today can really be summarized very simply as all persons shall wear a face covering while on school premises where social distancing cannot be maintained. It's really that simple. And we have tried to keep it as short and sweet as possible. But as you know, anytime you have a committee of any sort, and when a lawyer's involved, you're going to get different opinions and different exceptions to that. But we've tried to narrow those down as much as possible. These are common sense exceptions and flexibility that you will find built into the draft, but the overall goal is to promote reasonable efforts to keep students, staff, and visitors as safe as possible while on school premises. You will find the policy in 6 sections. Section A contains the general rule. Section B defines the types of acceptable face coverings. Section C provides for those limited and reasonable exceptions that I mentioned. Section D provides for the supply of face coverings. Section E outlines the consequences for implementation. And Section F sets forth the effective period for this emergency rule, and I will address that, the context of that a little later. So going to Section A of the emergency rule, you'll see that it can be set forth in really 4 dependent phrases. First, face coverings must be worn by 2, all students, employees, vendors, visitors, or any other persons. 3, while on school property. And 4, where social distancing guidelines from the Centers for Disease Control and Prevention cannot be maintained. The general rule was specifically intended for implementation on school buses, during class changes, in cafeteria lines, in confined spaces, and other places on the school campus where social distancing guidelines cannot be followed. That is the sum and substance of the rule. Section B specifies the options for qualifying face coverings. Of course, as you've seen, cloth masks are preferred. A cloth mask is defined as anything sufficient to cover the nose, mouth, fitting snugly against the sides of the individual's face with no gaps. That's B1. B2, obviously, commercially produced surgical masks and respirators are acceptable, but not required, simply because of a limitation on supply and not to impinge on medical necessity for those. And it also allows.
Excuse me, Mr. Penley, can we
Yes,
just stop you for a moment? Because I really would like to display the document that you're referencing so that those that can view it will have the chance to see it as well.
If it is on board docs, I think we can pull that up. There we are.
Yeah, I think they're working on it. Oh, it's being displayed.
Very good. You would rather see this than my face anyway.
No. I just, I would like for our public to be able to follow along with it as you discuss it, but thank you. Go right ahead.
Absolutely. Point well taken, Madam Chair. Thank you. So as you will see there in section B, we're talking about the types of face coverings that are permissible. We've discussed the cloth face covering, the commercially produced face coverings, and the option for face shields. So a face shield is an acceptable option so long as the shield covers the wearer's face below the chin, wraps around the face. And this language is based on CDC guidelines concerning disposable shields that must only be worn once. And if reusable, it must be cleaned and disinfected after each use. So that is the general rule, and the compliance section C sets forth limited, clear exceptions designed to address individual circumstance and instructional necessities in the classroom and in educational settings. Section C1 permits an individual not to wear a face covering upon medical certification under circumstances where a healthcare provider determines that medical, physical, or psychological reasons contravene the individual's ability to safely wear any of the face covering options. Obviously, that would not be required. Section C2 provides for exceptions in those circumstances so long as and where social distancing will be maintained. So for example, under C2A, strenuous physical activities will be an exception. If a student is obviously participating in PE, outdoors, it's hot, we wouldn't require face covering there. If an employee is working outdoors, so long as social distancing is maintained under physical activity, no face covering is required. An exception for instructional or other district official to permit a student to remove a face covering during an activity. That would be up to the discretion of that district supervising official. Outside of a building or vehicle, so long as social distancing guidelines are maintained, is an exception. Inside or outside of any school district facility while eating. Eating would be an exception to the rule. For purposes of healthcare evaluation or treatment, or when a person cannot remove a face covering without assistance. Obviously, in circumstances where an individual has a health need that requires breathing, being able to access that, or if the person is not able to remove their own face covering, that would be an exception to the rule. There's an exception built in for kindergarten students and those of younger ages who are not used to wearing face coverings. That is something to be, those students will be educated and encouraged to wear face coverings, but not expected to wear a face covering where that inability doesn't exist, or they're not willing to do that. In those circumstances, the absence of a face covering is not to prohibit a young child from participating if they are unable to wear a face covering at all times. And the final exception for participation in extracurricular activities, a face covering would not be practical or may create a health risk, such as during athletics, marching band, etc. Of course, the district will continue, as noted there in the exception, to follow Florida High School Athletic Association guidance for interscholastic sports and activities. Those are the exceptions that are built into the draft rule. Section D discusses and requires that the school district supply cloth masks and other appropriate face coverings and to maintain emergency supplies so that no student will be preventing from having access to a mask and not be in compliance with the rule. Section E specifies that this is a health issue and not disciplinary, requires that compliance not be treated as a disciplinary issue. We can discuss why that is if the board has questions, but essentially this is not just for students, but it is for other individuals, and we are not going to treat all of those as disciplinary issues for failure to comply in absence of something that creates a disturbance or causes another problem on school campus. Section F specifies that this policy may be in effect for a period of 90 days in accordance with the Florida Administrative Procedures Act. The board will establish an effective date based on the dates for reopening of schools, and that this is a temporary emergency rule and is only valid for 90 days. If the policy needs to be extended in the future, the board will have to engage in regular rulemaking procedures under those administrative laws. But this 90-day period for a temporary rule gives you the option to go through rulemaking procedures if it's to be maintained longer than that 90-day period. So, Madam Chair, unless there are any questions of me at this point, Dr. Balgobin, that concludes my remarks.
Thank you, Mr. Penley, but I will open up the floor for my colleagues in the event they have questions or comments. So I will start, let me look at my agenda. I'll start with Ms. Cuthbert.
Good afternoon. I'm looking at it. I have three questions, but I don't want to take anything from my colleagues. So I have a question in C, I have a question in D and E. So if you want me to just do this a little bit at a time, it's fine. C, I see nothing in there about our ESE students who may not be able to wear a mask, especially our EBD students. I'm concerned about, some will just not be able to deal with it. And other students might have allergy issues, as well as others might have material. We had that problem with our uniforms. A certain material would harm them, or their skin would break out. So we need to kind of look at that. D, the district is they've stated that the district is going to provide a mask or appropriate facial coverings. Does this mean it's going to be every day? Or is it just once? And then, because you're going to have students now who won't bring it at all, and it's going to cost us, it could very easily cost us millions of dollars. So I just wanted to have some kind of, some specificity for that one. And then in the discipline, if it's a health issue, what are the ramifications if someone refuses to wear a mask? So compliance would be dealt as a health issue. Well, I would like to have that explained to me, because we're talking about possible exposure to other students. We wear a mask to protect others. So I don't know how that's going. I'd like to know what that means. Compliance will be dealt as a health issue. Thank you, Madam Chair.
Mr. Penley, would you like to address Ms. Cuthbert before I move to Mr. Persis?
Of course. I believe that any ESE or other medical, physical, or psychological contraindication is captured in exception C1. So for example, if a student with sensory issues, a student with a psychological impediment to wearing a face covering were to present on an individualized basis, those types of medical certifications would need to be brought forward on an individual basis and addressed at that time. Exception C1 covers that. In addition, exception C2B for specific district officials supervising an activity, if a student had a condition like that, for example, they would be allowed in the classroom to remove the mask it would be on an individualized basis in which that was addressed. As to the district providing the supply, I understand that there is currently a stock of materials. I believe that the plan is to encourage staff, students, visitors, parents who come onto campus to provide their own mask, but if they aren't able to, they would be provided with one at the time under D. And for the disciplinary issue, it's, again, as I mentioned, it's not just students. So our discipline policies that would require a student to go through the due process of having a disciplinary infraction recorded really doesn't lend itself well to this type of policy, where obviously if a student can't comply, that's covered, and they have an ability under D to provide the supplied face covering. If a student were to be insubordinate or disrespectful, we have other disciplinary policies already in place that would cover those circumstances. And that is the type of discipline that should be imposed for the result of the refusal to wear a mask, not just the wearing of a mask. If it were to apply as a disciplinary infraction for staff, we would have to follow those disciplinary procedures for professional standards. And this really doesn't lend itself well to that circumstance at all. And so that is why it's to be addressed as a health and safety issue rather than disciplinary. For example, those students who have religious objections to vaccines would not be disciplined, but they would be offered alternatives to coming onto campus. For example, using the Volusia Online or the enhanced Volusia Live options that are also in the reopening plan. So there are options for those students who object other than disciplinary proceedings that would handle those questions under the disciplinary issue.
Thank you. Before I move on, Ms. Cuthbert, did he answer your questions?
The first one, yes. I just wanted to make sure that was clarified because ESE was really not mentioned specifically. I just wanted to make sure it was addressed. But we're going to have trouble with D. If we say we're going to supply, then people are going to expect to be supplied. And we're going to have a majority of people not showing up with masks. And in E, I think all of our administrators need to have that clarified. We need to make sure exactly what we expect when someone comes on campus who is not going to comply. What is the alternative? And as a person who was married to a discipline officer, that needs to be established right away. Because putting it in it's nice to have a policy, but what happens if the policy is not being followed? So, and I know there are other venues someone can receive an education. However, everyone needs to know ahead of time what this is clear, because to me, D and E are very unclear. Okay, thank you, Madam Chair.
All right, thank you. Mr. Persis?
Thank you, Madam Chair. Great questions, Ms. Cuthbert. Yes, and Ms. Haynes, I like you modeling the face shield too. That's pretty nice. I wanted to say before I asked a couple of questions, Madam Chair, did we want to ask Mr. Penley if he had any further comments on what Ms. Cuthbert was addressing there on those last two? Maybe just any more clarification he might be able to provide.
Mr. Penley?
Thank you, Madam Chair. I believe that as to the supply issue, Mr. Aiken can address the specifics on exactly what our current stockpile is and how we will go about either through other governmental agencies and getting those stocks replenished and so forth. But there will be an initial supply available. There already is an initial supply available, at least for some period of time. It's very difficult for me, and it's not something that my department has looked into as to how long that supply will last or what that might entail. But operations does have that under control, and they have been addressing it. As to the specifics of the discipline, I can certainly see where we want to include more specifics on that. And of course, all of this will be subject to in-service training for our staff and administrators.
Thank you, Mr. Penley. Go ahead, Mr. Persis.
Yeah, thank you, Madam Chair. And may I ask, Madam Chair, if could we ask Mr. Aiken to comment on this right now about the supply of masks?
Yes.
Can we move?
Oh, I'm sorry.
Okay. Do anyone else have a question relates to the supply of the materials? Either of you, Ms. Haynes, Mr. Cologne? No. Okay. Go ahead, Mr. Akins.
Yes, ma'am. Thank you, Madam Chair. Mr. Persis, yes, we have 7,000 masks currently now for our teachers, and we have masks set aside for our student population. We have masks set aside for our teachers returning to, and shields. We also have masks for all of our students that are coming in to give them masks currently now. We plan on having those stocked in our warehouse, so if more are needed, we have paper masks as well, and we can also go to the county through the health department and get more masks if need be.
Madam Chair, may I ask him a question?
Yes, you have the floor.
Thank you, Madam Chair. Mr. Aiken, thank you so much for that. Could you tell me what the funding source was for these masks?
Yes, sir. So FEMA, so it's a FEMA reimbursement that's 87.5% reimbursement, and the remaining cost is ours. I think we spent nearly $500,000, I think, to date on all of our protective equipment and everything else we've ordered since March.
Is that $500,000 be beyond what we're going to be receiving from FEMA, or will they be, coming back with 87% of that?
They'll be coming back with the 87%. We have to apply for that. And so we've already, I think Deb Muller is the one doing this. She may be able to answer a little bit better. She's the one applying for that. We'd be able to get that reimbursement at 87.5% based on what we spent since March.
I see. And so we have not received any funding for protective equipment from the federal government or from the state?
Not to my knowledge. Ms. Muller might be better to answer that question. I do not have that answer.
Thank you, Mr. Aiken. Ms. Muller, are you on?
Yes, I am, Mr. Persis. Good evening.
Hi.
Yes, I guess I would just start by saying that we did receive some PPE during the early parts and early in the summer from the county, as well as we received a pallet of masks through the state, I believe it was. But we have not been paid or reimbursed for any of the PPE that we have ordered to date. We've incurred numerous different types of items that we've purchased, as well as the items that we've already begun purchasing for the return to school, the reopening. And we're projecting that the cost by the time we get done will be over $3 million.
Thank you, Ms. Muller. Thank you, Madam Chair, board members, for allowing me to pursue this a little bit. My concern here is that I believe that the state and the federal government, they should be the ones paying for these masks. It is the federal government who said that we should open up our schools. It is the governor in our great state who issued the executive order requiring all public schools to open in August 5 days per week. And it just seems to me that if the state is making that requirement and believes that we can do so safely, then they ought to be providing the equipment to keep our teachers, our staff, and our children safe. It's a directive from them, and we don't have any choice but to comply with the brick and mortar opening. Without question, it's gonna put our staff and children in harm's way unless we do protect them or they protect themselves. And I just think that the state is being negligent here in not funding the protective equipment and masks that our staff and our children deserve. My second point, Madam Chair, is the, I forget which number it was, but I think I'm looking at it, children in kindergarten and below, that one. My understanding, Madam Chair, and perhaps someone else would know, don't we have a different set of rules for kindergarten through second grade as it relates to the options? Isn't there something that we're not doing the live option for them, or?
We are. It is just, they will have yes, they will have the live option, and they will have a designated teacher for those students who choose to take the live option.
Okay, so there's not any difference in the three options for K through 2 than 3 through 12, let's say.
Other than the K through 2 would have a dedicated teacher for the live version versus 3 through 12 would be in their class.
That's what it was. That's
yes.
what it was. So the K through 2, thank you, Madam Chair.
You're
so
welcome.
the K through 2 has a dedicated teacher for those students in kindergarten through second grade who are at home.
Correct.
And there's another K through 2 teacher who is in the brick and mortar building with
Correct.
students. Okay.
Correct.
Okay. So I was going to say that just given more research that has come out, the study from Korea now has seemed to support the other study that was done in Europe. I forget the country, but it seems to add more credence to the fact that perhaps children under 9 are not as likely to spread COVID to adults, and obviously are much less likely to become seriously ill from COVID. I was just wondering how the board might feel about, rather than children in kindergarten and below, but I was going to say children in second grade and below would be educated. And I know Ms. Haynes would appreciate this, but as we talked about the necessity, or perhaps how helpful it would be for kindergarten, first, second grade teachers to wear a face shield, a proper face shield, so that the children could hear them clearly and see their mouth as they learn to read and make sounds. I believe it's just as important for the teacher to see the children's faces and so forth as they learn to make sounds and learn how to read. So I just want to get your thoughts on that. And I didn't know whether the thinking was that, well, when children get into the classrooms, that they would be able to take off their mask if they were wearing a mask instead of a face shield, let's say. So I just want to get some thoughts on that, and maybe our district staff can help me. I'm just concerned about our our smallest children, and the uncomfortableness of the mask for them, and their perhaps not understanding, why everyone's wearing the mask, and how important it is to keep the mask on. And I just don't want a lot of inconsistency that may develop, as Ms. Cuthbert spoke about a little earlier. So let me stop, and maybe it can get some further direction.
Madam Chair, if the question goes to an instructor's ability, I believe that the face shield exception, the face shield authorization as a covering would cover the instructor while that teacher or therapist was working with that young child. They could have on the face shield, and the exception in C2B talking about the school official who is supervising the instruction is then able to authorize the student to remove the mask would certainly cover any situation where the teacher was looking to the child to see how they were articulating sounds and that sort of thing. So those two concerns are built into the STRAP policy.
That's good. Thank you. Thank you, Mr. Penley. That helps me out, Madam Chair, so that it sounds like it would be up to the teacher then, Mr. Penley, to determine when the children within the class can take off their mask?
Absolutely. That is an exception built into the rule at C2B.
Okay, then getting kind of piggybacking on what Ms. Cuthbert said about the training that our teachers and principals would need to receive. Again, we wouldn't want to have a kindergarten teacher in one class never allowing the children to take off their mask, and the children in the class right next door in kindergarten, the teacher lets them have the mask off most of the day. How can we resolve that, Dr.?
That's going to happen. There is no way to consistently, require that every teacher do the same thing in every class. That doesn't happen I can tell you from my son's experience last year, geometry, one teacher gives a different test than another. That's all that we can say about this policy is that it's permitted. And then I don't want to steal the thunder of the calendar committee coming up, but as part of the plan, we're talking about building in a number of professional service days so that training on this whole rollout of the reopening plan can take place. That is certainly something over the course of that period of training will be discussed with all of the staff, with the administrators, and we'll have to address on an individual basis if, and we're going to get complaints that one teacher allows one aspect versus another, and that'll just have to be addressed by the building administrator on an individual basis.
And I think, Mr. Persis, we are looking for plexi shields for all of the desks as well. So I think that in itself will help when the students are in the classroom. Not that all teachers will feel comfortable with that, but I think having those shields on the desk will make them feel more comfortable if the students remove their mask.
Yes, thank you. And thank you, Mr. Penley. I know quite well that there is variation between what teachers do at every school. I just wanted to say that as each of us board members, as we go through our 200 emails every day, we see that there is a variety of feelings about masks and who should wear them and when they should wear them, and people are pretty adamant about all of this thing. So I would just say that to our district senior staff, as they train the principals and principals informing their staff that I think as much as possible, if everyone could get on the same page with that, at least within their particular school, I believe that that would help everyone. If we could just do that, I would be greatly appreciative. That's all I'm going to ask and say. Great comments from everyone. Thank you, Madam Chair.
Thank you, Mr. Persis. Ms. Jamie Haynes.
Thank you, Mrs. Wright. So, Mr. Penley, now that I've had a chance to see it and read the entire thing, I would say that you did a very good job on outlining it. And I do thank my colleagues that brought up the additional questions. Under Part B, I see that in Section 3, we do talk about the cleaning of the face shields. However, B1 never mentions anything about the cleaning of the cloth face coverings. And even though I'd like to assume that, you know, people will send them in with clean the cloth face coverings, I didn't know if maybe we needed to put just the same words there. I'm not opposed to it not being a part of that because, as I said, it's very clearly written. I do appreciate the clarification on the expectations. I was assuming, but now that you've clarified it, that yes, under C1, that did include specifically and especially our multi-VE children and our ASD children, because I've heard from a number of those parents that have even been trying to work with their children to wear something, but in certain instances, it's just not even feasible. And as I said in June and at the last board meeting, I will not participate in doing any harm to a child that does not have an understanding or for medical conditions. We would put them in harm by forcing them into a face mask or face shield. I do want to thank Mr. Greg Aiken, especially that he even provided for us the opportunity so we could see what the adult face shields would look like. I will say I've never worn one till now, but it is very lightweight. I will say that. I want the teachers that I've heard from to understand, though, that even mine goes down to this point, so it is covering everything, but I think it's easy to still hear from it, see my mouth moving, because that has been one of my pieces, especially with our primary children or children in speech and language classes, is that, you know, they need to see their teacher's mouth and their teacher needs to see what they're forming. So I think that I may have heard the number wrong, and maybe one of my colleagues can help me out with this. I thought Mr. Aiken said 7,000 masks, but I thought somewhere it was 70,000 that we were purchasing. And so 7,000 does not cover what we would need. Mr. Aiken, can you clarify that?
Yes, ma'am. What I mentioned was a 70,000 for our teacher staff. So we have those already ordered in 70,000 or 7,000, and we ordered masks for students as well. I don't have that number. So we only have 4,100 staff members. We've got more than enough for our staff.
Okay. All right. Thank you for clarifying that, because I didn't think just handing out a single mask per person would be acceptable. And so you do, I'm assuming that the shield you gave us tonight is the adult one and that the student ones are just a little bit smaller to fit their faces. When ordering masks, did we also order ones that would fit the smaller children because there is a difference in size?
Yes, so I have one displayed on your the dais there up front that can be adjustable one, if you can see it up there. And we have some that are a little bit smaller than that too. If you remember a picture from last week, I showed you 2 different size ones. So we have those.
Okay. I think we're gonna have somebody hold it up. Okay, so I have it here in front of me. And it has, so this is one for smaller children, and it has a nice foam insert so that it's comfortable around their head. Is that correct? And it's adjustable.
Yes, ma'am.
Okay. All right. And I think that's really nice. But I will say this. So the one that you gave us is for adults or say older students that could possibly be in a multi-VE room that may need this and could wear this over the fabric mask. Is that correct?
Ma'am, what we have, we also have, yes, the answer to your question is yes. We also ordered mini gloves and those suits for our multi-VE paras and others. We've ordered a multitude of supplies. I can send you the PPE inventory that we currently have tomorrow, and I can send it to all board members of what we're ordering for each individual groups, including supplies.
Okay, so for all the teachers and parents that are out there listening, and especially for all of the teachers and paraprofessionals that work with our even older ESE kids, what I'd like you to know about this is it has an insert, so it does sit gently on their nose, and it's almost like putting on a pair of sunglasses. And so it is very comfortable. It is not restricting in any way, but it does cover the entire area. And I feel that that is a good piece. Huh? Oh, all right. So I do want them to see that. And so I do thank you for providing that for us. And this has been passed to me as I've been talking. I guess I'm supposed to show it also. This is some of the decals that have been ordered that are going to be placed around our schools so we can encourage our students on the 6-foot social distancing piece. So for Mr. Persis and Ms. Cuthbert, this is also for you to have an opportunity to see some of the things that they brought in this evening for us to see. So I do want to thank you, Mr. Penley. I feel that the policy has taken into account a lot of the concerns that I had. I appreciate that teachers are given an opportunity to give kids a mask break. I want to say this though, because I've had emails, you know, where people want to demand that students, even if they're doing the face shield, have to have a face mask. I apologize, but we're in the business of teaching children and making sure that we can teach children. And, you know, my thought is to you as an adult, if you wish to put on a face shield and a face mask, that's going to be provided. But if I'm working with a child and I need to see their face so that I can know what they're doing, I think this is perfectly acceptable. I don't think they need to have both, because I've had emails about that. I don't know how the rest of the board feels. That's just my opinion, because this is pretty sturdy, and it's going to cover pretty much anything as long as it's put on correctly. So Mr. Penley, thank you. I appreciate the fact that you did put in there some exemptions that if they're out at PE and they're running, I don't want a child overheated. I don't want them to be able to catch their breath. I also, so I appreciated the exemptions. And I'm going to give a shout out to a few people that I've heard from, a few principals and even teachers. They thought about how to keep masks clean at lunchtime, because, you know, kids will lay their mask on the table, they'll drop it on the floor. And so I'm giving a shout out to some of the people that I've heard from that are, and especially some principals, they have looked at investing in a lanyard that would allow them to clip their cloth mask to the lanyard while they're at lunch, so that they still keep their same cloth mask. And that cloth mask is now not on the floor in the middle of the food or changing it with their friends. So thank you for everybody that has been working on this to come up with ways. And I appreciate definitely that we added that, at least for kindergarten and down, we would work on teaching them that. I want to say this very clearly. I appreciate the fact that you put in there about this being a health thing and, you know, discipline, because I've had people telling me they need to be disciplined. And I'm sorry, you know, when I ask, well, how are you going to discipline them? You know, it's about education, it's about communication, but I'm not going to do harm to kids, and that's where I stand on this. So I would like for those of you that on Facebook have written about disciplining children if they take their mask off even for a moment, I need you to stop and think about how you would feel and what would the consequences of disciplining you if you chose to do that. But that's all I have to say. I think it's a well-written policy. I think it takes into account everything. There'll be something. Somebody will come up with some piece and we may have to revisit it, but I feel that you did a great job and you covered some of the concerns that I had. So thank you very much.
Our pleasure. Thank you.
Mr. Cologne?
All right. So first of all, I'd like to thank you for this well-written policy. As I go through it and the thought process that went through, I want to go back and reflect on the document provided to us on the safe opening of school from the Florida Department of Education. And so what their recommendations are that of the CDC, and basically they're saying when social distancing cannot be accomplished, students as feasible should be wearing a cloth covering because it is an important mitigation tools for all individuals. And so it mentions busing, transportation events, meetings, anytime kids are going to be in close proximity, medically vulnerable students. It goes on to address the Florida Department of Health's advisory that students under 2 or anybody who has trouble breathing. So I think we've addressed that well. I believe that there are circumstances where this is a non-negotiable and should be, for example, the school bus. When we're going to put 60 kids on a school bus, and mind you, we have not been given 1 penny to not put 60 kids on a school bus. I am of the belief that the masks should be required in order to ensure that all the students are safe. As we go through this, I did a little bit of research, and we had a lot of folks that have reached out to us regarding the whole mask decision. And I just want to name a few folks that have advocated and are in favor of masks being worn when social distancing is not possible. And so I would hate for anybody to think that I am sitting up here as a medical professional who knows everything about masks. However, these are the groups who are highly suggesting that we have cloth coverings. So that includes the American Academy of Pediatrics, the Florida Academy of Pediatrics, the American Medical Association, the American Hospital Association, American Nurses Association, U.S. Centers for Disease Control and Prevention, National Institute of Health, World Health Organization, Florida Department of Education, U.S. Surgeon General, Florida Surgeon General. Even our president made mention of it being patriotic. In addition to that, due to lack of response, we've even had private companies, American Eagle, Apple, Best Buy, Costco, CVS, Dollar Tree, Home Depot, Kohl's, Lowe's, Starbucks. So this is not just a Volusia County. They are trying to put something on us. We are in a pandemic, okay? And so while I will say that I am encouraged to follow what all of those bodies are suggesting keeps our students safe. Now, with that being said, I can easily sleep at night knowing that I have looked to the professionals. I have spent hours reading what their recommendations were, and we understand that that is best practice. And so in that sense, I am very supportive of this. I will say that I appreciate the exemptions. A lot of folks have reached out and said, well, what about, when we have students who are ESE or cannot tolerate wearing the masks? And my response to them has been, then you need to protect yourself. Because the reality is that if the students are not physically able to do so, then all we can really do is protect ourselves. Where I do differ with my colleagues is the part of the discipline. Again, there are times when, as provided in the guidance from the state that masks should be worn. And for me to not, as someone that wears a mask a lot, it is not uncommon for me to walk out of my car saying, oh man, let me go back and get my mask out of the car. And so when a child leaves home, that child's going to say, oh man, I don't have my mask. And so it's important that we ensure that the masks be available to that student before they get on the bus. And so I personally, again, I think there are scenarios where there could be some movement and some, as mentioned, if the teacher decides that they don't have to wear it at that moment, then that may be appropriate. But there are times where this is a non-negotiable, whether it is a wear a face shield, whether it is a wear a mask, whichever the option may be. One of the things that was mentioned last week is that the face shield and the mask are equally as effective. I would probably argue that. However, I do believe that there are instances where that mask is going to be better. So, this policy, to be quite honest with you, it's sort of like our cities who have passed a resolution rather than a mandate. In other words, it's a feel-good policy. However, without any teeth in the discipline, seeing that we have provided all of the exemptions for the student who may not physically or emotionally or physically be able to wear a mask. I think this, without any discipline tied to it, this is a feel-good policy, but I think it's going to be not by any fault of, just someone getting to school and not having a mask. And so I think we're putting ourselves in a situation where, despite our best efforts, we are going to put our children's lives at stake. And so those are my thoughts on this. And thank you.
So, Mr. Cologne, since you offered your thoughts, then what is your recommendation?
So my recommendation is that they be required, and we could look at the places where they can be required. If I go back here, I'm looking at the guidance that was provided to us. It talks about during busing and transportation, and that's probably the biggest one for me. I think the rest of them, can be managed, because once the kid gets to school, we can offer them a mask. However, there are going to be times where, the bus, for me, the bus is really just a non-negotiable. Again, that's just me. The other part of this too, and you mentioned that, and I thought about it was, Greg mentioned having so many masks available. And so we are going to be providing every student with one washable mask. However, we have to make sure we have that PPE available for those kids when they get on the bus and, oh man, I forgot my mask. And so that bus driver should have an ample supply of masks to be able to, because, that bus is going to have 60 kids sitting, very, very close. So at the very least, during busing and transportation, unless, again, there's lots of exemptions in here, and I feel comfortable that if a student can't tolerate wearing a mask, they can file for those exemptions, inform the school, communicate, and we can ensure that they're accommodated. However, the bus for me, I can't imagine what that would look like. So that's really the big one. And of course, anytime social distancing is not possible, and it is, I think we're being very generous in offering the face shield as a alternative.
Thank you.
Thank you.
Okay. Ms. Haynes, and then Mr. Penley, if you want to interject, I will. Go ahead, Ms. Haynes.
So, Mr. Cologne, I'm not against, I have not ever once said that kids shouldn't wear them on the bus, okay? But you said the word discipline. So I appreciated Mrs. Wright asking you to explain what you were saying, because I don't think any of us have ever said in high traffic areas or in congested areas that they shouldn't be worn. But I want to explain discipline to me, because we've got a lot of people throwing around the word discipline. So what does discipline mean? Because discipline to me is when you do something to someone when they don't follow the rule. Now, them arriving at the bus and, it's a second grader and they don't have the mask. I do agree that, yes, let's have the bus driver have some, maybe the paper mask or whatever for them to get into school. I'm not opposed to that, but what's discipline?
And so, Madam Chair, if I can answer, I sort of equate this to our uniform policy. And so and I was surprised that we're actually doing an emergency policy rather than amending our uniform policy to reflect accordingly, which again, I'm okay with. I like the 90-day mark, but, we currently, if a child's not wearing a collared shirt, there is discipline that can take place. And so arguably you're saying that, okay, well, if they're not wearing a collared shirt, we should discipline them or shouldn't discipline them. And so I think it falls under that same thing. And actually I feel slightly guilty about the whole dress code thing because, my question really comes down to, do we have the right to deny a child an education because they won't wear a mask? And so I think the same way we have the ability to send a child right now because they don't have a collared shirt would be the same thing if they're not wearing a mask. And so again, I just think there are circumstances that don't lean themselves to, and again, the bus, every student on the bus must wear a mask unless they have an exemption and have been, or mask or a face shield. Otherwise, that bus is going to be just lit with, germs and that whole bit, as we know that the transmission is through. And so those barriers actually help, but I think we're putting ourselves in a place where our teachers are not going to have that protection because a child can simply say, I don't want to wear it. And so I'm going to breathe on you because I don't have to. And they can do that. There's nothing here that is going to stop a kid from saying, I just don't want to wear it. And so I think that's going to put our staff in a bad position. That's just my thought.
Okay. Mr. Penley, would you like to interject just a minute, Ms. Haynes?
Sure. Let me just point out a couple of things. This is not a discipline policy, and it's not a policy brought under dress code because it applies across the board. If this were just relating to students and dress code, that would be appropriate, but it isn't. This is brought forward as a health, safety, and welfare policy across all school campuses, across teachers, staff, students, visitors, and vendors. So it applies to more than just students. So that's why it's not an amendment to the dress code policy. And as to discipline, if a student is willfully disobedient, disruptive, intentionally taking an action, breathing on someone because they think that it's going to make them catch COVID, we have other disciplinary routes that we can take for those types of insubordination, disturbance, those kinds of things beyond what we're talking about with this limited policy. Keep in mind, we're talking about where social distancing can't be maintained. So you have to wear a mask. And if you look at the second paragraph there, riding on the school bus is specifically addressed as one of those confined areas where the mask must be worn, subject to these other exceptions, of course, for those limited reasons. But we're trying to strike a balance, a reasonable balance here between the gamut of those emails that Ms. Haynes has seen, but between those emails that Dr. Balgobin has seen over the weekend from those people who absolutely want to require a mask versus those who absolutely don't want anybody to wear one at all. Somewhere in the middle there, we have to come up with a policy that addresses legitimate concerns, but still creates the most safe environment that we can offer when school starts back.
And so, Mr. Penley, staying right there, so this includes, but is not limited to, school buses, class changes. Those are places where it's mandatory for them to wear a face covering. Am I correct?
It is correct. If you look at the title, mandatory face coverings, and as I said, these are mandatory in those places where social distancing cannot be maintained.
And for our guests and visitors, if they refuse to wear a mask, then we just refuse them to enter our property. Am I correct?
Absolutely. Just like any other trespasser, if you do not follow our visitor policies when you come into a building and sign in, show your ID and so forth, just like we have other safety measures to prevent people from coming onto campus, this just adds to that safety, health, and welfare policy that we're asking the board to consider.
Okay, and Mr. Cologne, I'm sorry, Ms. Haynes, but I want to ask, because I think Ms. Cuthbert and Mr. Cologne had a similar concern. So did we address that, or are you asking for some more teeth? That's what I'm asking, because this is in draft, so we need to let them know.
I am of the opinion that there is no teeth to this. And so that's just my thought. And I think that as we draft this and our principals can weigh in, and those folks who are going to be in the position to figure out what teeth there are and which teeth they're not. Because right now with our uniforms, I mean, there's no teeth at all. And depending on which school you're talking about and what day of the week it is. And so I just think with something as important as this, there has to be, we're talking about the safety and well-being of everybody here. So that's just my thought.
Okay, Ms. Haynes and Mr. Persis. I saw you, Mr. Persis. Go ahead, Ms. Haynes.
Okay, so actually when I look at section E that says discipline, and it says the wearing of a mask is a health issue, compliance will be dealt with as a health issue, not as a disciplinary issue. All right. I wasn't going to talk uniforms tonight, but if we're talking uniforms, there are schools that have their clinics staffed full of shirts and things like that, so that if a child, or a student comes on campus with a t-shirt with something that is inappropriate on it, they are sent there to change out and put on a shirt, because the idea is we don't want them to lose instruction. All right. So when I look at E and you're claiming it has no teeth in it, I still go back to what is discipline, because I'm not going to do harm to a child. So if that second grader is climbing on a bus and they have forgotten their mask and there is no adult there to go get one, that's where I think we need to have paper masks. What's the discipline? I don't call it discipline. I call it they left their mask, and the consequence is we hand them a paper mask to put on as they arrive on the bus. So no different than if all of a sudden they've climbed out of their car at parent pickup, or they're walking, which we have a lot of students that walk, and they walked and they're outside walking and they didn't put it on as they left the house, and they get there and they find that it's not in their backpack. I don't see this as a discipline issue. I see this as where we have something to issue to them, just as we would issue a shirt, or kids for years, even before we went to polo shirts, sometimes came into school campuses with something not appropriate on. And what did we do? We issued them something to wear as long as we had it. If we didn't, then we made a phone call to a parent. So I'm not, because the word discipline to me must mean a different connotation than you, but my thing is just about that we have the materials and supplies there, that in the event they don't show up. Now, if they're high school students and it's a repeated thing, then it's time to then make further steps. It may be time to make a phone call home, all right, to have a conversation with those parents, and maybe there could be some consequences. But in all reality, to me, it's just handing them what they need and saying, here it is, put it on. But, I'm 1/5 of the board, but I just really don't like I appreciated the way it was written here, that the mask is a health issue and compliance with it is a health issue, not a disciplinary. But, if they cause a disturbance, as Mr. Penley said, then it's going to fall under the student code of conduct, where if there is a disturbance or they're yelling, screaming, take it to another level, it's going to fall under that. And there are consequences there of what would happen. But that's my thought.
I see you, Mr. Cologne. Mr. Persis, I saw you.
Thank you, Madam Chair. Mr. Cologne makes a good point, though, and I understand it very clearly. When when students are not doing what we ask them to do. And sometimes it's just like Miss Haynes said, innocent, I forgot it, no big deal. Let's get them another mask. I agree with Miss Haynes on that. I think the issue is going to come in when the teacher says to the student, "Oh, you need to get a mask," and the student says, "My father says I don't have to wear one." Okay, so now you got a kind of a ticklish situation for the teacher, and let's face it, on the first day, weeks of school, how will teachers, bus drivers know who the students are that are in those exempt categories? I didn't know, Mr. Penley, whether for those students who do qualify under those various exemptions, are we going to create a form of some sort for the parent to fill out that says something about, because of these reasons, my child will not be wearing a mask, and can present that to the principal? Or can you walk me through how we're going to know who it is that qualifies for the exemptions, other than the child just saying,
Sure,
I don't want to wear a mask?
well, in those situations where there's a medical certificate provided under C1, there's going to be whatever the doctors know. Typically, it's going to come in the form of a prescription pad. Johnny has sensory issues and can't wear a mask. That would be up to the principal then to communicate, or to staff, that there's an exception for that student based on medical certificate. I suspect doctors are going to be pretty busy in the next few months if this policy were to be implemented. But as to those students who have individualized education plans or 504 plans, the teams will be meeting anyway to address any particular needs on an individual basis. So the accommodations page of the IEP or the 504 plan will contain any medical or psychological, physical accommodation as it relates to the mask policy, the face covering policy. There are obviously logistical issues, but there are logistical issues with students who have other accommodations, and communicating those throughout the staff so that individuals know not to approach students in an aggressive manner or things like that. If there are individual bases to take extra precautions toward a student, we'll have to follow those same types of protocols. And we have to rely on staff to do that with fidelity in the educational setting, because quite frankly, that's what they do every day, all the time, and do it remarkably well, in my opinion.
Yes. Well, then I think I hear what you're saying is that parents will need to take the first steps in documenting how their child qualifies under one of the exemptions in the policy. Is that correct?
They will, yes.
Okay. One of the issues that Mr. Cologne brought up, the students on the bus. One of the hardest jobs everyone knows is being a bus driver and having to try to discipline 60 students when they're all behind you. And you're trying to concentrate on driving and getting those children to where they need to be safely. I don't see how we can expect bus drivers to also be cognizant of students behind them wearing masks, taking off their mask, playing with their mask, doing all things that students are going to do. Because they're young and that's what they do. So I get the point of, and you made a good point about when they're getting on the bus, they should have their mask on. And this is something that bus drivers and everyone can help teach them. before you get on the bus, when you're at the bus stop, you see the bus coming, make sure your mask is on. I would hope they have their mask on at the bus stop, which they should. Then when they get on the bus, they have their mask and they go sit down. And I'm sure part of the orientation that bus drivers do, as they all do, part of that this year will be make sure you have your mask on when you get on the bus. Make sure you keep it on the whole time and that you're on the bus. And but you know what I'm saying. It is going to be hard. And as we've been saying, we don't want children to get in trouble. And by that, usually that means when you get in trouble on the bus, you get suspended from riding the bus. And often when you get suspended from riding the bus, you don't come to school. So we don't want those things to happen just because of the mask. However, the mask wearing is serious. And I'm just saying that it's going to take everyone to support the bus drivers in this, so that parents, we need your help with this one, principals, everybody, let's all help the bus drivers and help these children understand how important it is to wear their mask. That's all I'm saying regarding that.
And I agree with you, Mr. Persis. We're always trying and encouraging, relying on parental assistance and getting kids ready and prepared to come to school. Being on time for the bus, being on the bus is part of that. And certainly, to go back to Mr. Cologne's point about discipline, if a student is creating a disturbance on the bus, using the mask to, be disruptive, to,
Sure.
Flick kids in the ear, that sort of thing. Those, again, we have disciplinary bus riding policies, and if the student can't be maintained appropriately with the mask on the bus or off on the bus, we have other policies that cover those bus riding situations.
Yeah,
But the
great.
expectation-
Sure, and just as the principals and who's ever having bus duty those first days will be training the children when they're leaving school to get on the bus, to have their mask on and to keep it on all the way, home, and you should keep it on and until you get home. Okay, I just wanted to bring that up. Then the last thing I had was the policy. You mentioned something about this in its connection to the uniform policy, the dress code policy, or however we want to call it. Right. Do you think, Mr. Penley, then that we need to insert this into the dress code policy somewhere in there? Is that what you're suggesting? Maybe sometime between now and the start of school?
No, sir, not at all. I think that this, again, is a health, safety, and welfare policy that applies across the board, not just to students. If you wanted to make it part of the dress code policy, you would eliminate others coming onto campus, visitors, vendors, and so forth. I don't believe that that's what this is designed to do. I wouldn't want to narrowly tailor it to a dress code policy. I think that defeats your point.
Okay, but could we add it though to the dress code policy as part of it?
If it is the board's pleasure to add a mask provision in the dress code policy, we can amend it and follow our policy amendment rules to do that in the next 90 days. Yes, sir.
Well, I wanted to kind of follow up on Mr. Cologne's, I think this is where you may have been headed, in that we may want to take another look. Gosh, I can't believe I'm saying this, but take another look at our dress code policy to absolutely determine, given we have this added burden of a mask, to maybe think about making some changes to that policy. Of course, I'll leave that up to the chair and the board, but I do think we have ample time, since today is only the 25th. 1st. And with school probably starting a little bit later, we could get that information before the board and in a timely way so that parents and students would know before the first day of school. I'll leave that up to you, Madam Chair, to see if that's what the board and you would like to do.
Thank you, Mr. Persis. And actually, I'll leave that up to the board. I'm not in favor of addressing the dress code policy. I think we have enough issues to deal with. And I'm gonna say this in love, and you all may not agree with me. The problem is not the dress code policy. The problem is the board. We've been the problem with this dress code policy. And so we have not held administrators to the feet to the fire. And we wanna say teachers, but really and truly, it comes down to leadership, guys. And right now, with so many other things, this is not a fight, and surprising enough, because I am very pro uniforms, but this is not a fight I'm willing to have at this time. I like the mask policy as is, and as we progress, if we see it becomes part of who we are, then yes, we will need to address it, but I'm hoping that this will not be a permanent thing in our lives forever, where the uniform, I believe, should be a permanent part of who we are. So for me, I can only speak for me. I'm not willing to address, well, I said not address, I'm not trying to make us enforce, change, or do anything for this upcoming year as it relates to uniforms. But I am, again, one person, and so I would like to hear from each of you. But I do want us to keep in mind right now we are referencing just the mask, so the audience should know we're not getting off on uniforms.
Oh no.
But,
No,
yeah.
Madam Chair, if I could just add one other thing,
Sure.
I was going to say it. I'm so sorry. I know this is in effect, I guess, for 90 days, but let's just hope a miracle happens and 45 days from now, we get our positivity rate down to 3% for 3 weeks, and man, things are good. Is it possible then for us to rescind this and say, children no longer are required to wear masks, and how does that work, Mr. Penley?
Yes, since this is an emergency health, safety, and welfare rule, once that health, safety, and welfare cause dissipates, just like with a hurricane, you might have circumstances that would require you to have an emergency rule regarding evacuations and so forth. Once that emergency passes, the board would then just expire the rule at that time. It doesn't require that you maintain it for the full 90-day period. That only gives you an opportunity, if you wanted to and saw a need to make it permanent, to have the rulemaking provisions of the administrative code followed as to workshopping, announcing the body of the rule, having public comment on the rule body itself, and then adopting it as a permanent rule. And those timelines that attach to that, this is simply for an emergency basis for a short period of time. And that's why it has the 90-day sunset automatically, but you could always terminate it earlier if that emergency passes.
Got it. Then there'd be a collective hallelujah out there.
Yes, sir.
Yes, all righty. All right, thank you so much. And thank you, Madam Chair. Thank you, board members. Appreciate it.
You're welcome, Mr. Persis. Go ahead, Mr. Cologne.
And so in listening to what you all have shared, here is what I anticipate is going to happen, which I think will actually hurt our students more. And so if I am Ruben and I am in class and I'm not wearing my mask and my teacher says, Ruben, you need to wear your mask, and I say, sorry, ma'am, with all due respect, I would not like to wear my mask. You now can write me up for insubordination. And so that degree of punishment is actually higher than saying first time, second time, third time, because now it's going to be insubordination day 1, insubordination day 2, because it's all subjective to that teacher and how she takes little Ruben's saying, ma'am, with all due respect, I do not want to wear a mask. And so I think that's actually going to hurt our students, and it's going to make it more subjective than objective. And that's and so that's what we're alluding is still in the form of teeth, but that's going to be so subjective that I think it will put our students at harm. So that's all I've got on that. Thank you.
Thank you. Um, Ms. Cuthbert, Ms. Lord, Ms. Cuthbert or Ms. Haynes?
Thank you, Madam Chair. I don't know if we could. Do you think we could add a sentence at the end? Because you might have faculty or staff refuse to wear a mask. At the end of, the end of E, excuse me. If there's a willful desire not to wear a mask, might result in a disciplinary issue. So, and that could be anybody. That could be a faculty member, could be a visitor, it could be a student, because disciplinary result would be, thank you for coming on our campus, but you're now going to have to leave if it's a visitor. So maybe just adding a sentence that if one refuses to wear a mask, a disciplinary issue will result, something to that effect. And that would take care of it, because then it refers back over to our discipline issues, our discipline policies. And then in D, it needs to be more specific, because the district will provide students and staff with a supply of cloth masks. So we don't have the funding. And what is the supply of cloth masks? Is it a crate? Is it two? And we don't have the funding and the money or the energies to constantly give people masks, because we will have students show up and say, if you want me to wear a mask, then you're going to have to give me one. And then we're going to be out of supplies in the first week. So that needs to be a little more specific. District will provide students and staff with a first cloth mask. And if emergency occurs, we'll replace that one. Something to that effect. But otherwise, it's too vague. And that I just would like it a little more specific, so that we don't have the problems later that would encourage some people to say, well, it says in the policy you have to give it to me. So thank you, Madam Chair.
Thank you, Ms. Cuthbert. Ms. Haynes? No comments? Okay. So, Mr. Penley, you've heard from my colleagues, and if you can go back, maybe send something to us. I know we will be bringing this forward next week. One of my, and hearing all of that, it tells me that number one, we're going to have to make sure our transportation specialists actually have some masks on hand on each of the buses. Potentially, depending on which option parents go with, we may be able to give them some aids to ride on the bus to help ensure not only their safety, but the student safety, because you're correct. They cannot drive and mandate all of that, what we're going to ask. So there are some things that as a board and Mr. Akins and Dr. Bagabin will have to look at it to make sure that those items are addressed. Great points, colleagues. Any other discussion as relates to item 4.01?
Yes, Madam Chair, excuse me. We could get masks that are sensitive to faces. If there's materials that are in our uniforms or clothing that are less sensitive to skin, maybe there are masks less sensitive to skin. And also a lot of secondary students wear lanyards, maybe, and I've been in, getting my picture ID taken, and then they have the all the codes on the back, if it's yellow, green, or red, all the different codes you have on drills. You could always add any kind of like medical exemption on that same lanyard. And if it's registered with the school, if the medical exemption is registered with the school, that can just go right onto a lanyard.
That's a great idea. And you're right, I'm sure we probably will. And Mr. Aiken and Dr. Bagabin, if you look into some of the sensory masks. But again, I think the policy as written, I like the sentence that you added, Mrs. Cuthbert. I think it's fine. We know where we could potentially have some gaps, so we just need to make sure that those gaps are filled, and we are ready. Any other discussion? Go ahead, Ms. Haynes.
So I have to bring this up because it was leaked like 2 weeks ago on social media, and a message went out saying that we were already going to mandate masks and that they had to be solid in color. So what I've done is I've reread this, and I have not seen any documentation in this, it doesn't spell anything out, but I do have to ask, so are we leaving it as it's stated with cloth face coverings and they're acceptable, for compliance? Because we've not spelled it out in here, anything about solid colors, because I'd like to go, I know that went out from some of the schools to the families, and there was an issue with that. I had in my notes, I'd forgotten that I was expecting to see tonight something about that, or really what I think it should say is just a mask should not have anything inappropriate on it. And inappropriate to me is anything to do with weapons, sexual language that, is not appropriate language we allow, or anything political. I mean, that's more of what I was looking, or racial. You're correct. I was trying to go down the list because those are the things. But as far as, I'm not here to say it has to be orange or blue or green or paisley or flowers. If SpongeBob on the mask will get the 5-year-old to wear it, or, Minnie Mouse or whatever, I'm good with that. It's just, I had looked back in my notes and realized, that was something that had gone out where it was stated that they would have to be solid in color. And I know a lot of parents have already invested in face masks for their children, and they're not solid in color. So would anyone else like to have any input on that piece?
So I haven't given that any thought. I'm really, the ones I wear are not solid in color. So it's, colleagues, do you all have a preference, or go ahead, Mr. Cologne?
I have no preference whatsoever. If folks want to wear flowers, let them wear flowers. If you want to wear just a regular surgical mask like I do, not fancy, I don't care what they wear as long as, and I think our dress code would probably even still cover the inappropriate, because that part is still there. And arguably, I think that's probably already addressed, but I have no desire to mandate what color, shape, whether they're paisley. Is that a color?
Colors.
It's a design.
It's a
With
design.
many colors.
Sorry, I didn't. That wasn't the day in school I was at. So I have no desire on that. I think I'm just glad they're going to wear them. So thank you.
I agree, Madam Chair, with Ms. Haynes. As long as it follows the policy of not offending anyone or any entity, it should be fine. I do want to do a shout out for the land student who had a company, a cloth company. He has now turned them into masks. It's this one. And he donates a cloth mask to our frontline workers for every mask that he makes. And I've been wearing these. And mine is the map of Kennedy Space Center. I don't know if it's upside down or not, but it covers.
It's on the West Coast.
Yes. Well, I had it upside down. Yes. East Coast. So, but this is, the landing facility. So there's all kinds. Thank you, Madam Chair.
Welcome. Mr. Persis?
Yes, I agree with what everyone said. Yes, whatever it takes to get your child to wear a mask, let them wear it. And I agree with everyone. And the only other comment I would make is that, if everyone in our county would just wear a mask now, if we would all just do this for the next 6 weeks, we're not going to have a lot of issues when school opens. So if everybody who's out there and they're worried about schools and they're worried about wearing masks and not wearing masks, wear a mask now. Just everyone get out there and do it now, and we can get this spread down and stop it and get that positivity rate low. So when August 31st or Labor Day rolls around, we're in good shape everywhere.
Thank you, Mr. Persis. Any other comments? Go ahead, Dr. Balgobin.
Thank you, Madam Chair. I just wanted to just clarify a few points. Mr. Colon, you had asked about the mask, if a student were to arrive to get ready to board the bus and they don't have their mask. We have ordered paper masks, and our bus drivers will have those for those students that may not be prepared with a mask for that particular day. Also want you to know that there will be several orientation sessions for our parents who chooses the traditional setting to talk about expectations and safety measures that will need to be in place. Mrs. Haynes, you had mentioned at our last board meeting regarding almost something like a compact agreement. We will have that because obviously there will be certain responsibilities that the parents will have to ensure that are in place, that we will have to ensure that are in place, and we will make sure that we're very specific and clear in terms of what those responsibilities will be and who will be responsible for. So there will be a compact agreement. Additionally, there will be several trainings and videos, because this is about reframing our thinking model of how to be successful in dealing with the crisis in which we are currently experiencing. So there will be training and videos. Additionally, there was another question regarding students with exceptionalities. How will we know this in advance? So as we collect the data from our survey, if this our plan were to be approved tonight, we will pull the roster of all the students that are enrolled by school level, grade level, and then almost like an IEP team will convene and look at the list of those students that will be attending traditional setting, and being able to have a particular list of all those students with some exceptionalities, where we will have to convene and discuss and make sure that those provisions are in place. So there's a lot of planning that will be taking place beforehand, and the topic of a mask and the safety and security of all of our students will be paramount to what we do moving forward. Just wanted to kind of clarify that. Thank you, Madam Chair.
Thank you. And any other discussion? Okay, so we're going to move on to agenda item 3.02. But before we do, the calendar committee, you can get yourself together. We're going to take a 15-minute break, and we'll be back at 6:25. Thank you. Thank you. Oops, I'll take off my mask. Thank you, colleagues. We're going to resume our meeting. We're going to move down to item 3.02, the academic and work calendar for 2020-2021. Dr. Balgobin?
Yes, Madam Chair. Madam Chair, you brought up the topic of a delayed start on behalf of our board. Can everyone hear me? Okay. You brought up the topic of a delayed start on behalf of our board several, at least two weeks ago. And we've initiated this conversation regarding this topic. At our last school board meeting, the board has already asked us to meet for the calendar committee to convene. And since then to now, I want you to know that Mrs. Hazel and Mr. West were tasked with that, with convening the calendar committee, which transpired yesterday at 6 o'clock. The two options presented at our last board meeting on July 15th, which were to examine August 24th and August 31st, and to discuss those two possible options with the committee. And also to look into a third option, which is to consider what would be the possibility of a September 8th if we were to choose that as an option moving forward. So at this time, I would like to call Mrs. Hazel, our Director of Human Resources, to provide further information about the meeting that transpired yesterday and to answer any questions that we may have. Mrs. Hazel?
Good evening, everyone. Good evening, Chairwoman Wright, board members, and Dr. Balgobin. As Dr. Balgobin stated, on July 15th, the board did direct the calendar committee to reconvene and consider options for a delayed start. As you know, each year a new calendar committee is appointed per school board policy. The decision was made to reconvene the same committee that met previously in June to make recommendations for this calendar year, as we had briefly discussed the issues to be considered, and this particular calendar committee was familiar with those issues. Options considered for the presentation included the original start date of August 17th, August 24th, August 31st, and September dates, including any dates that could have been suggested by the calendar committee. It was determined that dates beyond August 31st would not be in compliance with the emergency order to begin schools in August and would impact employee pay dates significantly. The presentation that I'm going to share with you tonight is the presentation that was given to the committee, and I will talk through their final recommendation with you. If we can have the next slide, Aaron. This is the agenda that was used for our committee. We started, of course, with a welcome. We did show the original calendar, which included the August 17th date. We stated our purpose and some considerations up front, which I will share with you. And then we presented two options, had time for discussion and time for votes, as well as voting on whether or not a third option should be considered. And then we had a final vote. The next slide, please. This is the current calendar that was adopted by the school board and approved by the calendar committee in April of 2019. It included an August 17th start date, a June 4th ending date, and you can see that the semesters ended at 80 days and 100 days respectively. Our next slide, please. I did point out from the beginning, of course, we recapped why the calendar committee was reconvening, but also wanted to make sure that everyone understood school board policy 322, that the recommendation of the calendar committee would be presented tonight at a special school board meeting. And per policy, the school board has the ultimate authority and responsibility to make the final decisions regarding the annual calendar. We know that you take recommendations very seriously and look at them. However, I did want to make sure that the committee was aware of that important fact. Also, I do want to point out the committee did convene and respond within days of an invite. I did invite them on the evening of the 15th, and we were able to meet just yesterday on the 20th. So I do want to thank them for their time and short turnaround. Okay, the next slide, please. This slide demonstrates several considerations that we always go over every year when we're convening the calendar committee. This includes things such as the legislative mandate that school cannot start any sooner than August 10th. We also always want to remember that hurricane season is June 1st through November 30th, and that we want to include makeup days, and that within the calendar. Sometimes we only need to make up one day, other times we need to make up several days. And again, the calendar committee is reconvened anytime there's a change in the academic calendar. The 3 ISA days that are typically, or teacher duty days as they're known, spread throughout the year, are usually at the end of the first, second, and third grading periods, and those are specifically for teachers to finalize grades. Religious holidays are not considered for student holiday, or religious holidays are not a consideration for student holidays or spring break. Decisions are based on what's best for our students academically. We also ask that students return at least 1 week prior to state testing for spring break purposes. We need to keep in mind that FTE weeks in October and February it's imperative for students to be in school in those weeks. And most importantly, at this meeting, we do discuss that we're going to come to a consensus as a group, but we may not 100% agree. And the next slide, please. Now, particular considerations for this calendar committee when we're looking at a delayed start is to ensure that we have adequate time for funding purposes and adequate time for credits. The required time for funding purposes is 900 hours for grades 3 through 12. That is 900 hours of instructional time for those grades. Required time for graduation credit is a different statute, which requires that any course being taken for graduation credit must have 67.5 hours per semester. So that's an important thing to consider when we look at where we are spacing out the semester breaks. For employee considerations, our teacher contract is 196 days. The first pay date scheduled for our teachers and for those employees that would be returning on August 11th is August 31st. Our first pay period ends August 14th. Next slide. Some of the options that are available for makeup time include holidays, Professional Development Day, which is in September. Our early release days, we have 34 of those per year at 1 hour each. I do want you to note that it takes 7 early release days to make 1 school day. Teacher duty days are also a consideration, or a combination of any of these. And the next slide, please. Just as a comparison, I did share with the committee some of our surrounding districts and the decisions that they have made to delay. Seminole County, for instance, was originally scheduled to start August 10th. Their new start date would be August 17th. Many of the surrounding counties have selected August 24th as a new start date. And although we were also one of the later starts to begin with, an August 31st start date would put us later than most of our surrounding counties, which would give us an opportunity for a week of lessons learned, and it would put us later than all of our surrounding counties. All right. Having said that, the next slide shows option 1, which was presented, and I do want to talk through the considerations with this. I sent in a separate email so that you have the handouts of this. I know it might be a little difficult to see on the screen, but this was the option that was shared. A teacher start date of August 11th, which is no change to what the original start date was. A student start date of August 24th, which would give us 9 days of pre-planning. Contractually, up to half of the time of pre-planning can be used for training. And when we've talked about the different trainings that are necessary in front-loading those trainings for our teachers, we would include things such as safety protocols in these unusual times, technology training, mental health training, distance learning training, curriculum training, and any other training to support the safe opening of our schools. The pay date for teachers would not be affected. It would remain August 31st. However, I do feel obligated to let you know we would have certain employees who may have, should we decide to adjust the student calendar and change their start date, they may be impacted by the timing of their first paycheck. However, we would negotiate those within their bargaining units. The student calendar for this option would mean that students would attend 176 days of school. The reason for 176 and not 175 is although we would be starting school 5 days later, we would have that September professional development date, which would convert to a regular school day. So that would actually have our students missing 4 days from the 180-day calendar. All of the minutes from that could be absorbed without impacting the last day of school, any of our holidays, early release days, or teacher duty days. The semester would end after winter break. It would end that second week in January, and the semester split would be almost even at 86 days and 90 days. That was option 1. Option 2 is on the next slide. The teacher start date for option 2 would be August 11th, so there would be no change for the teacher start date. Student start date would be August 31st. And again, that's the latest date to be in compliance with the emergency order. Pre-planning would be 14 days. Up to half of that time contractually could be used for the same training as discussed before. It does not have to be half days. It can be, if we have 14 days, it would be up to 7 days, and we could space that out however however would be the best to support our teachers for training. The pay date for teachers would remain August 31st. However, I do want to mention we would still have that group of employees who may have their first pay date impacted. The student calendar, students would attend 171 days of school. We could still absorb the 5 days, but to make up those additional 5 days, we would need the September professional development day, which would revert to a regular school day, and 28 early release days would make up the days that we would need. The semester would end after winter break. The semesters would be almost even at 85 days and 86 days, respectively. After we went through these options with the committee, we took some time to answer questions, to have some discussion, and also to take a vote on whether there was a third option that they would like to present. And at that time, we voted on whether or not to explore a third option, and overwhelmingly, the committee voted that they did not want to explore any other options, because while we wanted to give them guidance and support, especially when you're conducting a Teams meeting as a committee meeting, I didn't want to limit them to just these 2 options, and overwhelmingly, they voted no, that they would like to choose between these 2 options. And the slide that is displayed now shows you the outcome of the votes. We had 4 votes for option 1, 20 votes for option 2. So that's 83% and 17%. For a final recommendation of the calendar committee recommends option 2, a student start date of August 31st with calendar, and then I need to talk to you about some calendar adjustments. The calendar committee, a few members of the calendar committee have contacted me today that while we did select option 2, I do want to point out that there was one thing that was not discussed by the calendar committee, but that we do want to point out to our board. And that is that November 3rd election date. The way the calendar committee's recommendation was that the semester would end on October 30th, which would give 44 days in that semester, or that 9 weeks. It's not a semester, 9 weeks. If we moved the end of the 9 weeks to Monday, that would mean students would come to school on Monday, November 2nd, and move the teacher duty day to November 3rd, that may be more conducive to the election, to using our schools as polling places. Again, that was not something that was discussed at the calendar committee. However, I have been contacted by calendar committees and asked if I would mention that as the board considers the calendar. And that is all for our presentation. I'll take any questions that you have.
Thank you, Ms. Hazel. I do want to say we really appreciate you and Mr. West for getting your team together to look at this. And did most of your committee members participate?
Yes, ma'am. We had about 24 out of 30.
Okay, great. Okay. So I will open up the floor. Mr. Cologne, since I saw your face first, I'm going to call you last. Go ahead, Mr. Cologne. Go ahead.
And so I am supportive of the calendar committee's recommendation with the added change to ensure that our teachers are have that duty day on the 3rd. And so that's all I have to say. I think this is good. This will give society an opportunity to change our habits and turn this around, and we'll have an extra week even beyond most districts in the county and doing the right thing and hoping that we turn this tide. So thank you.
So Madam Chair, if that's in the form of a motion, I second it.
Okay. So we have received a motion from Mr. Cologne. Am I correct? Is that your motion?
That is accurate.
That we accept option 2 with the caveat of the election day as the teacher duty day. Second by Mr. Persis, Ms. Haynes, and then Ms. Cuthbert.
I too want to thank the calendar committee for all of the work that they've done and for laying this out so clearly. I agree with the change from the November 2nd to November 3rd for the teacher duty day. And I do like the fact that we're going to give our teachers and all of ourselves a little extra time by going to August 31st, because when you look at the other dates that the surrounding counties have selected, Seminole's going to start back when we were originally going to go, and the others have selected August 24th. So at this point, we're coming in with the latest start date, and I appreciate that. Thank you.
Okay. Ms. Cuthbert?
I think it's a great idea. I too am in favor of the option 2 with the correction, the option for option 2. And that Monday is always good because it gives the kids a weekend to get their work finished of that first quarter. And a lot of times it's on a Friday and they don't have that extra weekend. So it's a real good plus for kids. Now, because of all the professional development being done in the front of this quarter, will those teachers be left alone on that Tuesday so they can get work done and plans for the second quarter, no matter where we are in the school year? Do you think, because if that's an awful lot of work coming in, they've already done a lot of professional development, and I know this is somewhat negotiable, sometimes principals can require them for a half day to be in meetings and only a half day, but they're not going to have that much time to get grades in. So I just want to bring that out there to help our faculties to have the entire day to wrap up and plan for the next quarter, because it's kind of midweek.
So you're talking about Tuesday, November the 3rd? Is that what you're referencing? Okay.
Yes. If that's a teacher duty day, then let them have the whole day to do what they need to do to prepare, for grades as well as for the next quarter, because they won't have the weekend to do that. The kids will have the weekend, but not them. Okay. So thank you.
Thank you. Any other comments?
I do have a question. So who are the folks that we're saying are going to be impacted by pay? So would the teachers' pay schedule be the same?
The teachers would remain the same because they would start at the normal start time. I believe it's our paraprofessionals or our VESA, and some of you members. Go ahead.
Actually, our bus drivers are the ones that we've had our conversations about, our bus drivers in our school way cafe.
So that's AXME.
Yes.
Correct?
Yes.
Okay.
And so, Madam Chair, I think we are talking about more so the start of students, but, I would also beg us to entertain the fact that they are also going to have a significant amount of training and workflow changing that they're going to have. I know we don't have a big a bucket full of extra money to do a lot of these things, but I do believe there's going to be a significant amount of training, so it's just something we should consider. But I know today we're only speaking about the student start schedule. And so so the only folks that at this point would be affected if we don't bring them in are the bus drivers. And how about Schoolway Cafe? Is that?
Schoolway Cafe would be impacted. There are some other units that would be impacted, but we know we would have to go back to the table to negotiate that.
Okay, very good.
But thank you for that. We can put a bullet there because you're correct. That's something that's not a part of this, but it will impact them. So thank you. Right now, any other comments, colleagues? If not, do we have any public participation for this agenda item?
Yes, Ms. Wright, we do. We have
Okay.
4 people that have signed up right now. I see one in the lobby. It's with Albert.
Ms. Schultz, I don't understand you. I'm sorry.
I apologize. I think the computer was not working well. I had to disconnect. Can you hear me?
I can hear you better,
Can you
yes.
hear? Okay, I'm sorry. Exchange speakers. We have 4 people that want to speak on this topic. We have one in the lobby right now. It's Miss Elizabeth Albert.
Okay. Go ahead, Ms. Albert.
Really? Okay, hang on.
Okay, good afternoon. How's that? Thank you, Mr.
We
Cologne.
can hear you.
How's that? Got it? All right. Thank you, Mr. Cologne, for sharing with me. I truly appreciate that. Madam Chair, good afternoon, board members, Dr. Balgobin, and members of the audience. So first of all, I'd like to start very quickly by just thanking all of the members of the calendar committee, thanking them for their time and their dedication and their energy and spirit for putting this together. I particularly would like to send a thank you to Miss Precious Johnson, a very young, articulate, bright, intelligent young lady. And if she is the future of our community, along with Mr. Cabeza, we are in good shape. So I want to just shout out to those two. I want to provide some points of clarification, if I could, respective to the pay. I have done my research with the payroll department, and I've learned that if one day is worked within the pay period, then a full check on August 31st will be provided to employees. And so respective to bus drivers and Schoolway Cafe workers, there are some resources that we can absolutely explore to ensure that those folks don't miss a paycheck. Members of the instructional bargaining unit and support staff, office specialists, and paraprofessionals, the conversation was bringing them back at their originally scheduled start date, so they also would be secure. One thing that I would like to point out is this is a great step in the right direction to move to August 31st for the student start date. We are grateful for that opportunity, and we of course, are supporting a return to school only when it is safe to do so, following the lead of the Florida chapter of American Academy of Pediatrics, who are recommending 14 consecutive days with COVID cases of 5% or less. We can always recover from a learning loss, but we can never recover from a loss of one of our own. So I am just suggesting that as you consider this motion that's been made so appropriately, that we perhaps revisit this August 31st brick and mortar start as we get closer and take a look at the cases. So with that, again, Mr. Cologne, I want to thank you for your gentlemanly offer of your microphone and everyone's time.
Thank you, Ms. Albert. Our next caller.
We now have Miss Amy Hawkins.
Hi, Ms. Hawkins. You have 3 minutes. Please introduce yourself. Go right ahead. Ms. Hawkins? Ms. Hawkins? Ms. Hawkins? You may have to, is it *6, Ms. Schultz?
Yes, if you hit *6, you can unmute your phone, Ms. Hawkins.
I apologize.
That's okay. Go
Can you
right
hear me
ahead.
now?
I can hear you now.
I just wanted to have a conversation with you guys quickly. I know that there certainly has been a lot of information that has been presented this evening, and I wanted to make sure that I shared with you something that I've done in the last 2 weeks. I completed recently my will for the first time at 39 years old because I'm concerned about my health and safety as I return to work in the largest employer in Volusia County. And I wanted to read to you this evening Section 18 of my will, Special Wishes and Directives. I'm going to read to you directly from what I've written that is notarized and signed. I declare, in addition to the statements in this last will and testament, the following special wishes and directives. It is my desire that my children, Ryan and Logan, continue to visit regularly with their maternal grandparents on a schedule that is agreed upon by their father and maternal grandparents collectively. It is my desire that should I die as a direct result or due to complications of the COVID-19 virus associated with my return to work in Volusia County Schools, that my personal representative's direction for my local teachers union, Volusia United Educators for 1605 at 1381 Educators Road, Daytona Beach, Florida, 32124, to retain counsel and file any and all lawsuits recommended by them and or their representatives, including but not limited to wrongful death, and naming any and all persons or parties as defendants as recommended by counsel and or their representatives, including but not limited to the Volusia County School District, the State of Florida, the Florida Department of Education, ABM Industries, the Superintendent of Volusia County Schools, Ronald Scott Fritz, the Deputy Superintendent of Volusia County Schools, Dr. Carmen Balgobin, the Chief Operating Officer of Volusia County Schools, Greg Aiken, any Volusia County School Board member or members who voted in favor of reopening schools, the Governor of the State of Florida, Ronald DeSantis, the Commissioner of Education of the State of Florida, Richard Corcoran, the President of the United States, Donald Trump, the Secretary of Education of the United States, Betsy DeVos, and any other person, entity, organization, or party that acted in favor of reopening schools during the COVID-19 pandemic, despite the overwhelming evidence that it may directly result in the death of teachers like myself. It is my desire that this lawsuit or lawsuits be filed to the fullest extent of any and all associated laws and seek the highest level of financial compensation available with any monies acquired as a result of any and all lawsuits be used for the care and post-secondary education of my children at the joint discretion of my mother and the father of my children. I want to let you know that if I die because you reopen schools, I will hold you personally accountable because I'm scared to go back because our schools aren't clean and we don't have the resources that we need. And I am frightened for my life.
Thank you, Amy. We appreciate that very much.
We now have Miss Heather Woods.
Okay. Ms. Woods?
Hello, this is Heather Woods. Carl, I can't see you online, but I'm hoping that you can hear me. I have talked to you guys before about my son, Ben, and I wanted to let you know a little bit about what had happened over the last couple of weeks or months. Ben was in the hospital for over a month for a disease that only 10 other kids in the world have. And because of that, before that, his immune system was compromised. Now it's extremely compromised. I haven't seen Ben in over 4 weeks because he is in neurological rehab and we can't go in because of COVID. The law prevents us from going in and seeing him. Now, luckily, he is coming home on Monday but we know that he is extremely, extremely compromised. I have to make the decision. Do I go to school where my heart is because I want to take care of my kids, my students? Do I go to school and do that and risk bringing that home to Ben? Do I send Ben to school and risk him catching it at school? I don't have anyone who will be able to take care of them if I go back to school. I don't want him to die. I don't want him to die. We've worked really hard to get him to not die over this summer, and it would be really horrible. I want you guys to think about that for a second. I want you to think about what is an acceptable risk. Is one teacher, one student, is that an acceptable risk? Am I an acceptable risk? Is Ben an acceptable risk? I mean, these are things we really need to think about. And I'm glad that Amy talked about her will, because I've had a lot of teachers call me and ask me as union steward, is the county going to provide us for a will? Will they give us a lawyer so we can make wills? Do we have to pay for them ourselves? What do we do about this? This is just something that I wanted you all to think about as we go into this time. And I know it's a tough, tough, tough decision, and I don't want to be the one to make it. And I'm sorry that you have to make it, but I want you just to think about that and think about what is that acceptable risk. Thank you.
Thank you. Our next caller.
Right, we have a dozen or so people in the lobby, but they are signed up to speak about the reopening. I have 2 others on my list that are scheduled to speak about the calendar, but they have not called in. So I believe that the others that are waiting in the lobby need to wait to speak on the reopening.
Okay, all right. If they call in, Ms. Schultz, we can come back to them, but by then we would have already cast our votes.
Thank you.
Okay, thank you. Any other conversation, colleagues?
Yes, Madam Chair. Is it possible, I think what Ms. Albert said about August revisiting our school calendar, is it possible? We had originally scheduled a meeting to evaluate Dr. Fritz's contract on the 4th of August. And it is before, it's a week before teachers come back. Is it possible we could come back? And that is, let's see, today is the 20th, that's 2 weeks, just to check to see if our curve is beginning to flatten. Because right now it's not. It's going up. The positivity rates are increasing. We still have a lot of issues. The Surgeon General has changed. Now he's advised, just as of last night, that school should not reopen. And I know that's the plan, but we have set a calendar, which I think is appropriate for our employees to be paid. And how do we distinguish our calendar from our reopening plan? Because that was directed from the DOE to our superintendents. But if we do have this new calendar, can we come back and relook at it to decide whether or not it is safe or is it not safe to reopen?
Great question, but I'm gonna state it this way. One of the reasons I asked the calendar committee to really consider a third option for this reason, this very reason why we wouldn't have to have this conversation. One of the things I asked from the calendar committee per the last meeting was even looking at after Labor Day. And it appears to me that the ones that were there, the majority, decided they did not want to look at another option. Now, with that said, quite naturally we can, but then we would have to ask for a waiver. And one of the things that I wanted us to consider doing while we were submitting our plan was to include, if within 10 straight days, I'll use that for an example, we did not see our numbers decline, then we would like to automatically institute the request for this waiver. Yes, we would have to change the calendar again, but from what I gather, just based on the comments, and Ms. Hazel, correct me if I'm wrong, that was not something they wanted to entertain. And on that committee, we have our representatives, teachers, administrators, everybody. So at this point, I really don't know what to say other than we do have a vote on the floor, but am I willing to? It's really up to you all. That's really up to the board. If we want to give a directive that we look at something else in addition to, because I think the 31st, we have to have a 31st, but we would have to ask for a waiver for anything after the 31st. Am I correct, Dr. Bagabin?
Yes, ma'am, you are.
Okay. Mr. Cologne?
And so I definitely have a lot of comments on that. However, I felt that would fall under the reopening agenda item. And so
I agree with you. I agree with you.
Yeah, I think we can discuss exactly what you said on that other agenda item. I mean, we do need to have a schedule on the books and submitted to the state. So, you know, this is all, you know, as the superintendent says, fluid.
Okay, I just wanted to make sure everything was clear and we knew what we were voting on. So we're voting on, yeah.
Yeah, we knew what we're very, I think all of us understand what we're voting on. Again, I was going to come back. I'm like you, Mr. Cologne, after this vote to have that conversation because I was kind of surprised that they didn't look at any of the options, but they did not. And so right now, are we going to take their recommendation and go with option 2 with having the teacher duty day on Tuesday, November 3rd? We do have a motion and a second on the floor. Any other comments, questions? Okay, I'll call for the vote. Mr. Ruben Cologne.
Yay.
Ms. Jamie Haynes.
Yay.
Mr. Carl Persis.
Yeah, it's the only option.
Ms. Linda Cuthbert.
Yes.
And I, yes, thank you. The vote passed unanimous. Now, as you stated, Mr. Cologne, that is something, hopefully, we will address that, not hopefully, we will address that during our reopening. And so we will move to agenda item 3.01, Fall Reopening Plan. Dr. Bagabin, you're on deck.
Yes, ma'am. Madam Chair, school board members, and members of our community. As I stated to you last week during the presentation of our plan, the effectiveness of any plan lies in the details of its implementation. So we are in the business of educating children, we know that, and we cannot do this job without our dedicated teachers. Without a doubt, we know that being a teacher is perhaps one of the most noble professions. And teaching is a profession that comes with a great deal of passion and dedication. So I do want to thank all of our teachers who have chosen this profession to be one that where they have chosen to serve the students in our community. Because like I said before, it really requires a great deal of passion and dedication. As a district and a school board, we have the charge, obviously, to execute, and we will be very mindful and intentional with our efforts because we have to ensure the safety of all of our teachers, staff, and students. And this is something that's on everyone's mind, and I want you to know that it's on our minds as well. So I may not have all the answers for you tonight, but here's what I want you to know, and to be frank with you, I don't think anyone has all the answers. But what I will share with you tonight are the measures that we will take to ensure a smooth transition into the upcoming year as it relates to our reopening plan. Last week, we have presented to the board 3 options for reopening of our schools in Volusia County. 2 of the 3 options, as we all know, do not require approval. Our traditional classroom setting and the enhanced Volusia online learning are already approved learning models. However, our Volusia Live option does require approval from you as a board and the Department of Education prior to implementation. So we have developed our district plan to submit to the state, and upon approval from the board tonight, if that approval is given, we will be submitting our plan tomorrow to Florida DOE to receive their feedback and input if needed so that we can achieve that approval process and have that in place. I did want to note that within our plan, we're also indicating a delayed start, as you have mentioned, to the school year, which will give us more time, and the time that we really do need to ensure that we are maximizing in providing all of the training opportunities that will be required for support to support our teachers and staff for the upcoming year. As we plan for the upcoming year, it's important to note that retraining our thought processes of how we should do business will be essential. May I say absolutely essential. So for all of us, and I do mean for all of us on a daily basis, this is a constant conversation that I have almost on a daily basis with my own daughter, who's a K-8 mental health counselor. We can no longer say this is how we've done it in the past. So with that in mind, I wanted to talk a little bit tonight about the next steps for our fall reopening plan. What will transpire if this plan were to be approved tonight and submitted to DOE tomorrow? What is it that the board and our community can expect from us to ensure that the details are there in place as it relates to implementation? So let's take a few minutes to explore this in greater detail with you this evening. When we look at the next steps, we know it's imperative to work closely with our school-based leaders, with our administrators, with the administrative teams at each school to ensure that the proper supports and resources are in place to adequately prepare for the reopening of school. That is important. After we've had a chance last week at our last board meeting to share our reopening plan, I want you to know that we held meetings with each division, elementary, middle, and high. Our assistant superintendent, directors, and district staff immediately met with all divisions. And what they've done is that they've shared the plan that was presented to the board. And they've shared our plan in greater detail with each division, with our principals. Most importantly, the teams discussed the safety plan that district and school-based staff will be working on. And this work, I want you to know, they will be hand in hand, that will be transpiring with their school-based leaders and their leadership teams to ensure that we meet the specific needs of our individual schools, their campuses, and also for our student population. These will be planned for in greater detail during the several workshops and sessions that we will be setting up with our school-based leadership teams. I can tell you that administrators are working really hard to examine their spaces to determine how to put the best safeguards in place for faculty and staff during these workshops. That will be our primary intent and outcome that we will be looking for. Our principals and our administrative teams, as we know, they're very dedicated to the mission of safety, whether it's their first day or their last day as Volusia County students. Safety will be our #1 priority moving forward. A pre-registration, we're looking at a pre-registration form. It will be essential that we work with families to complete a pre-registration form. For each of their students, we need our students and families to carefully consider their options and to determine what best meets the needs of their family. The results of the pre-registration process will help us to determine how to align and allocate resources for each model. The registration form is scheduled to be released on Wednesday, which will be tomorrow, and close next Tuesday. And again, that will be contingent upon the approval of this plan tonight. We will need one registration form to be completed per student. So let's take a peek at some of the questions that parents should be prepared to answer. Open a sample of pre-registration form, please. We will need to know your student's alpha code, their name, grade level, the school that they are scheduled to attend, which option you will be selecting for the school year, and any special considerations along, if they're bus riders, we will ask all those questions in that survey. And that will assist us, provide us with the details that we would need for specific school-based, site-specific planning for our school, but also for the other 2 options that will be offered. Additionally, we'll be sending out a survey also to all of our teachers. and instructional staff. Why? Because we want to determine their preferred instructional option for delivery for next year. As I've stated, there's 3, so they will be able to indicate through that survey what is their preferred option for delivery, for teaching for next year. The results of these survey will provide individual school principals and our leadership teams with the teacher's preference for instructional delivery. In addition to that, the survey will also list options to our teachers who choose not to return to the traditional setting. And any extenuating circumstances will be discussed through our human resources representative. We know that students, parents, and community members have more questions than ever before. We are prioritizing our communication through a dedicated website with many, many, many resources. So let's take a closer look at that website and the content that will be there and that will be launched once approved by this board. There is a menu of options, including the reopening presentation, an overview of the learning options, a frequently asked questions section, a place to ask questions that are not presented yet, and resources to share safety precautions for our schools and classrooms. The frequently asked questions section will be updated weekly. And the reason why we need to update this weekly, because as you post those questions for which we will be providing answers for, we will have a stream of all those questions there for you, so anyone can go at any given point in time and be able to access that document. And maybe their answer might be right there for them. We will also have, board and Madam Chair and board members, we will have a series of videos on that dedicated website. This website and this resource we encourage everyone to utilize. It will be user friendly. Chances are, if you have the question, someone might have already asked it. So we will include informational videos with captioning and guides and all the resources that we need to really provide the timely answers to our community and for the safe reopening of our schools. We are also working on an online submission form for staff to submit concerns related to the cleanliness of their classrooms. We had quite a few discussions around this topic. So within the submission process, there will be automations put in place to notify the school administrator and district specialist, which will be assigned to each school, overseeing the implementation of the cleaning of schools. This process will allow us to pull data related to concerns that are submitted, identify trends, and hopefully remedy those concerns in a timely manner. We will launch this resource when teachers return to school, and we will incorporate the submission process into our training offerings. And I think as we've indicated before, we're extremely pleased for the committee for convening and for us to have the additional 2 weeks for those trainings that will be very, very much needed. We will continue to update this website, board, and information as they become available with pertinent information as they become available. If you have questions, you will see that, again, our parents will be able to access most of their questions by going to this website. It will be almost like a one-stop shop workshop for our reopening of schools. So let's talk a little bit more about workshops. We are going to be rolling up our sleeves and diving into the work that will be necessary for the reopening of our schools. There will be a series of workshops that we will be scheduling with our school-based teams, focused on safe and innovative practices for our staff and students. We have several sessions already under the way to prepare for the many layers of reopening. As we work with our district support staff, principals, and school-based leaders and teachers who would like to volunteer, scenario-specific situations will come up. And as those scenario-specific situations do come up, we will address those as needed. For example, Ms. Cutberg, I know that last week you had mentioned in our board meeting about the NARA hallways at Spruce Creek High School. That would be one of those scenario-specific based situations for which we will need to look at the prototype of that school, and based on the prototype of that school, number of enrollees and where their classrooms are located and the transitions that will be taking place throughout the day, we will come up with a plan for that. So those unique considerations will be planned for accordingly. Additionally, trainings will be important, very, very important. This is another very important component to our reopening plan for our teachers, for our administrators, and also for our staff. Again, with the delayed start, we will have the additional time needed to accomplish this very, very important task. I cannot emphasize enough to you, board, tonight, the important role training will play in our reopening plan. We are laser focused into ensuring that we create role-specific trainings opportunities that are also job embedded. So for example, we're going to be looking at trainings for protocols that we will follow as we prepare for students' return, regardless of which option they select. There will be many training offerings for staff on safety measures. This is a hot topic and a very important one. And processes that will be in place. The social and emotional learning, technology integration to support Volusia Live. And we will use constant feedback cycles to refine that message and to strengthen our support for our staff and our families. Weekly updates. Let's discuss that a little bit. We know that there continues to be a lot of questions and wonderings as a community. And to better assist our parents and families, we will be hosting orientation sessions to share in greater detail the reopening plan, share the updated resources located on our website, and work collaboratively with families to clarify any questions and provide the guidance that they may need. These sessions will be offered, if this plan is approved tonight, starting this Thursday, Friday, and also on Monday. We will have a session for parents in the mornings and also in the afternoons for elementary, middle, and high. So there will be a series of orientations for our parents on these models and any questions that they may have and the guidance that they're seeking. Please note that these session offerings will be identical. So if you're interested in attending, it will only be necessary to attend a session per level. We want to continually update our community with the most relevant information in a timely manner for informed decision making. Weekly updates. From the beginning, we have discussed that our plan will have to remain fluid. This is a necessity. We see even today with our delayed start that we have conversations that maybe we need to come back at some point and revisit that, because there are many, many fluctuations in our environment that needs to be taken into consideration. So again, this is a very fluid plan. It's a very adaptive plan, and we will continue to provide weekly updates on ongoing workshops to staff, students, parents, and the community. We want to be able to provide as much clarity as possible during these ever-changing times. So to go back and explain a little bit, since we're going to be setting up all these workshops to work with our school-based leaders on all the specifics that will need to be in place for our safe reopening moving forward, on a weekly basis, we will keep our community also updated of what's transpiring, how the plan for implementation is coming along, so that they feel they're a part of the process as we move forward. And last but not least, it's important, and I am going to say this, as a school district, we cannot operate independent from a community, from our community, and consider that we're successful, because that's not going to happen. That's not a reality. And as a community also, we cannot operate independently from a school system and be successful. So I believe that understanding and showing appreciation for the value of this relationship will help us to become much stronger as a community and as a whole. And to our students, staff, parents, let's always remember that coming together and working together will make us stronger. So this is the time, board, for us to come together and work together for the safe reopening and to ensure that our students and staff have what they need to be successful despite our current circumstances. I want to thank all of you. Again, tonight, I did not want to go back and present a plan, the 3 options that were presented last week. I think it was presented in a very detailed manner, but I wanted to kind of offer insights in terms of if this plan were to be approved tonight, that this is not one of those plans that will be given to our school-based leader and say, here you go, implement. This will become a very collaborative process, and the district team will be heavily involved. I plan to be there in those work sessions. We will have our cabinet members in those work sessions. We will have our health department in those work sessions. I have spoken to Mr. Cologne and several representatives from Advent Health would be in those work sessions. It will become a community approach in getting our schools and our children back to a safe reopening with these 3 models that's been presented. Thank you very much.
Would we like to take callers and then have a discussion?
Yes.
Good with that.
Linda and Carl?
I do
Yes,
not have
ma'am.
any questions. I'm sorry.
Yes, ma'am. Go ahead with the callers. I think their input is very important at this time.
Thank you. Ms. Schultz, we'll start taking callers. We will take a break at 8 o'clock and come back, but we'll start taking callers now.
Okay, first up we have Mr. Edward Baldoff.
Thank you. Mr. Boldoff? Good evening, Mr. Boldoff. Mr. Boldoff? Oh, Mr. Boldoff, you are muted. Can you please push *6 to unmute your phone?
Hello?
Mr. Boldoff?
Yes? Can you
Hi.
hear me?
I can hear you now. Yes, sir. Please state your name and you have 3 minutes to address the board. Thank you for calling.
Okay, thanks. My name is Michael Baldoff, and I'm a teacher at University High School. I want to thank the school board and everyone for their work on this planning. We are in the middle of an incurable world pandemic. Many in this country do not understand the severity of the COVID-19 situation due to bad press and downplaying the situation, especially in Florida. I think today was a great start, and we've selected our start date. But to me, the school board has answered its own question whether it is safe to return to school in the traditional face-to-face learning at this time. There are too many open issues. You cannot require masks and have maskless exceptions, putting others at risk. I understand the exceptions and why, but we cannot protect everyone with the exception to the mask wearing being so vast. To contrary belief, we cannot even enforce a very simple dress code that was discussed, let alone a world pandemic protocol. If we cannot provide a safe, complete, detailed plan and are not completely ready, an online program with structure and organization will be just as effective as teachers standing in front of the room full of students who may be wearing PPE or not until this COVID-19 subsides. What is the acceptable limit of 6 students or teachers before school closes? It's going to happen, so what is the district's number? Or do we have to wait for death? What is an acceptable amount of deaths the school board considers until schools are shut down again? Is it 1 teacher? Then we close the schools. Is it 5 teachers? What is the district's number? I don't even want to discuss students. As an industrial engineer, I have a We have logistical nightmare at each school on our hands, from changing classes to getting on and off buses, eating, and much more. If you do not do this right the first time, the risk of contracting the virus increases. Our superintendent's only policy was to return to brick and mortar. We could have used precious time this summer to create an alternate effective protective plan for Volusia County schools. It is much too early to simply return to the traditional way with the current health crisis in Florida without further planning and development of our staff. Cleaning and disinfecting rooms. Our past cleaning crew has never cleaned our classrooms properly. It has been addressed multiple times with administration. Dr. Jones was very adamant with getting this problem solved, but it was never completed. I had to sweep my own floor, wipe the student desk at least 2 or 3 times a week. How am I going to feel confident that magically this year my classroom will be sanitized for me and my students?
Mr. Baldoff,
Mr.
Baldoff, I'm gonna need you to end your last sentence because you exceeded your 3 minutes.
Oh, okay. What I just want to say is we're all in this together. I think today was a great start, but I don't think that we're prepared to fully return to a traditional face-to-face model.
Thank you.
Thank you.
Our next caller.
Next, we have Carrie Davis.
Good evening.
Hello, I'm got my TV muted, so I don't know if I'm ready, if I'm on or not.
Yes, I can hear you now, Ms. Davis. State your name if you have 3 minutes. Thank you.
My name is Carrie Davis. I'm a resident, parent, and teacher at in the Deltona community. And one of the things, I was also a member of the calendar committee. We were not given an option to begin after Labor Day. There was a statement made that there was an option 3, but option 3 was for us to not use early release days and use holidays to make up those additional, instructional hours. So we were told that September was off the table per the FLDOE executive order, that we needed to begin by the 31st. So I just want to make that clear that that September date was never presented to us to vote on. That was not something that we could discuss at all. Those options 1 and 2 in your PowerPoint is the same thing we saw last night. The other thing is I am concerned about a mask opt-out, for medical reasons. And I am concerned about that because masks are not meant to protect us. They're meant to protect everyone else. If you had a parent who wanted to say, you know what, I don't believe in the effectiveness of masks, so I don't want my child to wear it or something like that, if it was only them taking that assumed risk for their own child, or for us as teachers taking that assumed risk for us, but you're putting everyone else in that enclosed area at risk. That's where my problem lies within that. We're looking at our recirculated air. We're in those closed rooms. I've been in 2 classrooms where we've had to evacuate my class and go to another room because of dust in the air filter that started burning off. When they do the testing to switch over from AC to heat, and all that accumulated dust burns up. And so we've had smoke and things, that burning smells that took over the classroom. You could smell it all the way down the hall. So, that the air circulates throughout our buildings, and who are we to say that, okay, you can put this person at risk because of this condition?
Thank you, Ms. Davis.
That's my feeling.
Thank you. We appreciate your call. Thank you so much.
Thank you.
Ms. Schultz, our next caller.
Next up, we have Say Aula. I hope I'm saying that right. It's S-E-Y-I is the first name.
Okay. Good evening.
Good evening.
Go right ahead. And can you pronounce your name, state your name, please? And you have 3 minutes.
My name is Shay Olula.
Shay, okay. Thank you. Go. Go right ahead.
I'm a nurse here in Volusia County. And I'm entering this forum not as a parent, I'm entering this forum as a nurse. I've seen the increased COVID rates of the positive COVID rates of patients increase greatly since the second wave of the surge, and more so than the first wave we had. I've also seen patients actually die from COVID who didn't contract it from outside in public from poor protection practices, but from younger people, and most of their children. The rate of the pandemic is too high to start school, in my opinion. Our future and our children are at stake. Many of our local hospitals do not have facilities to treat the critically ill children, not our local hospitals at least. I know that children need to get back to school, and I'm all for it. I know they've been home for a long time, and they're ready to get back to learn, but I don't think it's time. I don't think we're ready. And while our numbers are still high, and I applaud the county for pushing back the dates to August 31st, but I would implore the county to push it back until the numbers support a safe return for our children to re-enter school. Our numbers are too high, so at least let them get lower before we take children in and put them back in that environment. So thank you very much for listening.
Thank you. Thank you for the call. Our next caller.
Our next caller is Ms. Courtney Rumbaugh.
Good evening, Mrs. Rumbaugh. Good evening, Mrs. Rumbaugh. Good evening, Mrs. Rumbaugh.
Hello, can you hear me now?
I can hear you now. Please state your name, and you have 3 minutes.
Thank you. Thank you very much. My name is Courtney Rumbaugh. I am from New Smyrna Beach, Florida, and I am a Volusia County Schools teacher. I thank you for the steps you are taking during this unprecedented time. I know you've worked tirelessly, and I have enjoyed watching last week's meeting and this one as well. I am an elementary specials teacher, and as anxious as I have felt this summer, I imagine you are even more so. I have stayed home this summer for the sake of the 3 members of my household over age 70, as well as to lessen community spread. If we must return to brick and mortar teaching with cases on the rise, I implore you to follow the guidelines provided by the CDC with respect to social distancing, face covering, and cleanliness. After hearing your discussion tonight, I am pleased exceptions will be recognized for the kindergarten, pre-K, and ESE students on our campus. I too see issue with a lack of teeth in the mask proposal. As Mr. Colon stated, many health organizations promote the use of face coverings, even though it's less likely for children to be affected. My students are not returning to classrooms void of adults. I don't think we need to strongly suggest them. I think we need to mandate them. Teachers have all had the cycle of colds, strep throat, etc. Germs pass very easily. I was confused about the 7,000 masks for 63,000 students attending 5 days a week. I hope that we can acquire more PPE because that doesn't really add up to me. I think a lot of parents are going to depend on us to provide those things. In the case of social distancing, I'm worried you're relying on parents to choose options 2 and 3 to only make possible desk spacing if they opt out. I think more parents want to come back than we realize, so we need to pay attention. I'm concerned, finally, about the cleanliness, about being able to disinfect supplies, especially materials and instruments commonly used in special area classes. I believe the best solution for that is individual supplies, and would like you to consider where the funding will come from. We already don't get very much and teach often upwards of 700 students. I thank you very much for your time. Please consider that today's infection rate is 18.9%, and it is unacceptable for all of us to return. Thank you very much.
Thank you.
Up next, we have Miss Amanda Kaplan.
Good evening, Mrs. Kaplan. Good evening, Mrs. Kaplan. Ms. Schultz, can you remind everyone to hit *6? If maybe, can we put that in a little message so that when they are called, they'll know that they're probably on mute so that we
Yes,
can?
yes,
Okay.
it was mentioned when they called originally, and they can hear you right now.
Okay. Ms. Kaplan?
Yes.
Is this Ms. Kaplan?
Yes.
Good evening, Ms. Kaplan. Please state your name, and you have 3 minutes to address the board.
My name is Amanda Kaplan. I am a ESC teacher at Deltona High School. And my question is for students who are ESC, I'm fine with the fact that they're not wearing masks when they have a disability, but my main concern is for ESC students who are pulling masks off from other students, teachers, or paras. That's my concern, and what procedures the school board would take when a student is doing that repeatedly.
I imagine you are even more so. I have stayed home this summer for the sake of
Okay.
over age 7.
I can't hear you because I hear some feedback. Sound like I hear Mrs. Rumbo?
On the rise. I implore you to follow the guidelines.
I think you're getting my iPad. Let me go someplace quieter.
Thank
Sorry
you.
about that. My question is it okay now?
Yes.
Okay, my question is I'm an ESC teacher at a high school, Deltona High School, and my question is when you have a student who has a disability, and I'm okay with them not wearing a face mask if their disability keeps them from doing so. But my question is that particular student or other students are pulling masks off from other students or teachers or paras, and they're doing it repeatedly, continuously throughout their time being on the campus, what procedures and protocols would the school board take?
That is a good question, Ms. Kaplan, and I can't answer that, but we have recorded that question, so we'll make sure that question is addressed.
Okay.
Okay.
Is there anything else that I can add to this?
Yes, ma'am, you have about 30 more seconds.
Okay, and that would expose their peers, teachers, and paras and make it to where that they could potentially be exposed to the virus. Okay, and thank you very much.
Thank you, Ms. Kaplan, and we've noted your question. Good question. Thank you.
Do I hang up?
Yes, ma'am.
Up next, we have Miss Francesca Rector.
Did you say Recker?
Rector, R-E-C-T-O-R.
Okay.
That would be Mrs. Rector. Yes, ma'am.
Good evening, Mrs. Rector. Please state your full name, and you have 3 minutes to address the board. Go right ahead.
Hi, my name is Mrs. Rector, Francesca Rector, and I'm concerned actually about a couple of things. Specifically, when we go back to the brick and mortar school, and we have, the students in the classroom, keeping them 6 feet apart and or with masks, and then from class change to class change, who's going to be doing the cleaning of all of those class seats? Because I normally have like 35 to 40 seats in my classroom, and I don't think I can get all of those clean myself in the 6 minutes and of change. And in order to, you've got masks on and everything, but you still have their hands that are dealing with either papers or with their hands on the desks. So there's a concern there. And also regarding the Volusia Live, I don't know if that's supposed to be done at the same time as, for example, I'm teaching in high school in my classroom at the same time that the students in front of me are learning, but my laptop and many other teachers' laptops don't have cameras. so they wouldn't be able to see me that way. And if you have a stationary camera in the back of the room, then I would only be able to actually teach in front of a 2-foot area or so, maybe 3 or 4 foot area. I wouldn't be able to use all of my blackboards or my projection booth, the projector, etc. So little things like that are a concern for the Volusia Live. And when we were doing the 4th 9 weeks this past year, so many of the platforms crashed when the students were trying to get on, because so many students were trying to be on them at the same time, that I feel that that's going to be another problem that you guys might not be aware of.
Okay.
Those are my concerns with the with everything that I've heard so far today.
Thank you so much, Ms. Rector. Again, we have duly noted your concerns and we will be addressing them.
Thank you so much. You guys have a wonderful day, and I do appreciate what you've done regarding everything up to now.
Well, thank you so much.
Mm-hmm.
Have a good evening. Bye-bye.
You too. Bye-bye.
Our next caller.
Up next is Michelle Macklin.
Good evening, Mrs. Macklin.
Good evening. My name is Dr. Michelle Macklin. I am a resident of DeLand, Florida. I would like to thank our board members and district personnel for the time they have spent grappling with the reopening process and mandate. I recognize the importance of coming up with a plan and for submission, but based on last week and tonight's presentation, it appears that several of the logistical components to make the plan successful have not been worked out, which is concerning. Ms. Wright, you noted last week that we should consider families that might struggle with childcare, access to technology, and food insecurity. I think that those issues are better addressed by changing the racist policies that perpetuate such disparities. And I feel strongly that by opening schools prematurely, instead of relieving a burden, we would actually be exacerbating it, because we all know that those most impacted by schools reopening are at greater risk of exposure, thus placing families in more of a precarious position financially due to increased time off work to care for ill children or family members, medical bills, or funeral expenses incurred due to the district's inability to ensure or provide appropriate and required safety protocols and equipment within the learning environment. I also agree that it is important for students to have social-emotional support. However, teachers will be responsible for maintaining social distancing protocols and mask enforcement, which alludes to isolation because it limits social interaction, not to mention the psychological strain and trauma students will experience when one of their classmates or a teacher becomes ill or, God forbid, dies. Regarding Team Volusia, we're looking to recruit and retain certified teachers. We currently have approximately 100 open instructional positions, with current teachers in the face of a rising crisis grappling with the decision of whether to leave the profession they love or risk their lives and health, returning to the classroom, business as usual, in a few weeks without adequate safeguards in place. If teachers choose their lives and health, they could potentially significantly increase the number of classrooms without a certified teacher to provide instruction. Then what? I'm grateful for the leadership demonstrated last week and this week by Ms. Colbert and Mr. Cologne, because they seem to have reflected on this situation from multiple vantage points, such as parents, employees, teachers, health officials, to ensure that the decision that they make is in the best interest of all stakeholders. If this board approves the reopening of brick and mortar at this time in any capacity without at least a 14-day decrease in numbers, not only do I invite you to come and model teacher expectations the first few weeks of school in each variation of the learning environment to ensure we get it right, but also to remember your vote as the list of deaths rise because we weren't able to avoid the 3 C's in our underfunded classrooms. Lastly, if we are serious about doing what is best for students and families, let's diligently prioritize changing the policies that make the need for these debates regarding equity obsolete. Thank you.
Thank you, Dr. Macklin. Next caller.
Up next, we have Janice Sokolowski.
Good evening, Mrs. Did you say Fokalowski?
I believe it's Sokolowski.
Sokolowski, okay. Good evening, Ms. Sokolowski.
Oh, can you hear me again?
I can hear you now, yes.
Okay.
Please state your name, and you have 3 minutes to address the board. Hello?
Oh.
Ms. Schultz, do you know what happened?
It looks like that phone was disconnected. We're admitting now 2 callers from one line who would like to both speak. Ann Lester and Amber Lester.
Okay. And both Ms. Lesters, you have a total of 3 minutes. Miss Lester? Hello? Good evening.
Hello?
Good evening, go right ahead.
Yes, can you hear me?
Yes, can you please state your name, and you have 3 minutes.
Yes, I'm Amber Lester, and I'm a paraprofessional at Spruce Creek. High
Hello?
School. Hi.
Can you turn down your computer or whatever you have, because we hear the feedback?
Can you hear me now?
Yes.
Yes, my name's Amber Lester, and I live in Daytona Beach, Florida. I'm a para at Spruce Creek High School, and I work with special needs children. Specifically, I work with one-on-ones, which means I could be anywhere on a campus on any given day. My concern with the reopening of the schools is not just the narrowness of the hallways, which we've talked about today, but also the cleaning chemicals. I'm somebody who has a cleaning chemical allergy, and if the environments are supposed to be sterilized, I know that myself that's an issue being around that, and that's something that concerns me coming back with the health and safety issues. But also my other concern is I have students that are runners. What are the protocols, NCI or otherwise, if we have a student that's a runner, that is a student that also doesn't wear a mask because of sensory issues or whatnot? How do we take care of that situation and keep them and ourselves safe?
Thank you, Ms. Lester. We've noted your question, and we will respond. We don't respond during this time, so we have noted your question.
Okay, and I will pass off the phone to the other Miss Lester.
Okay.
Yes, I too work at Spruce Creek High School, and I am a paraprofessional, and I also work one-on-one, and I work in a portable, and in our portable we have very little room that we won't be able to spread the students out. And the student I work with will not wear a mask, we know, and the students want to run around the room, and it will not be safe. And what I don't understand is in March, when things weren't so bad, we closed everything down and didn't go back to school. Now, when things are so high and out of control, the numbers, now we're being asked to go back to work and risk our lives. I'm a first-time grandmother, and I've been doing this work for 35 years. I dearly love my job, but I really would not want to lose any of my family members, and I have a cousin that is just barely, after 4 months, slowly recovering from this virus, and it is deadly. I hope that we could not open up the schools so we can all be safe. Thank you.
Thank you.
Miss Vanessa Benz Kiera.
Thank you. Good evening, Miss Vanessa. Good evening. Good evening.
Can you hear me?
I can hear you now. Please state your name and
Okay.
you have 3 minutes to address the board.
Hello, my name is Vanessa Sturbins. I'm considering enrolling my son in Volusia Live, but I have a few questions. Will Volusia Live students be able to participate in clubs? It seems Enhanced Volusia Online as well as in classroom can join, but not Volusia Live. And also, am I correct in understanding that Volusia Live students will not be having one teacher, but they will have many? How will you ensure that the students will have continuity in their lessons? And as far as PPE is concerned, for those not wearing a mask, will a doctor's note be required? Will masks be mandatory in class? As prior, it was stated that in areas that cannot be social distance, masks will be required, but it didn't state in classrooms, which I assume is a given. How will you ensure social distancing during PE without masks being required? Understandably, they'll be outside, but they'll also have contact. Are they considering the certain activities that they have in PE, for an example? Thank you so much for your time, and thank you for everything that you're doing.
Thank you so much.
We have
Our next caller.
Yep, Caitlin Smith.
Good evening, Mrs. Smith. Good evening, Mrs. Smith.
Hello?
Yes, good evening, Mrs. Smith. Please state your name and you have 3 minutes.
Oh, hi there. Okay, I'm trying to mute my TV. I'm sorry.
Thank you.
No, it's not working. Okay. So I'm Miss Smith. I'm a primary teacher in Volusia County Schools. And I'm very scared to go back. I'm taking this very seriously. My brother was diagnosed, tested positive. He had a very rough battle with it. And even though he is testing negative now, he's dealing with serious complications with inflammation around his heart. So we need to be looking at, okay, sure, maybe some people won't die, but what's going to happen to the people who just test positive? I think that if safety really was your number one priority, we wouldn't even be entertaining the idea of going back to school at all, as all of the precautions created were risk reduction and not risk elimination. People will still get sick and die or have complications. And if we can keep those numbers low enough, there's still going to be lives lost. Learning gaps just do not outweigh the risk of even one life lost. In Model 1, the precautions are just not practical, they're not enforceable, and they're not effective. And I think anyone who spends all of their days in the classroom from all day would agree with me. Model 2, I think, is great because it gives students a choice for where they're comfortable, but it offers no options for the teachers who are uncomfortable or high risk. And I don't believe anybody should be forced to choose between their passions and their income that, supports their life and their life. I don't think it's appropriate to ask teachers to try to juggle both an in-class set of students and an online class of students. Those are two completely separate jobs, and the contracted work hours for teachers would not support that. Volusia Online is a great program, but, and I could be wrong, but my understanding of it is if we lose attendance to the students choosing that program, won't their home schools lose funding? And again, I think this is another great option for students, but what options are being offered to the teachers employed in those schools? Risk your life or forfeit your paycheck? The safest option is that we all stay home and pursue a rigorous distance learning model that involves related materials, technology, and internet provided for all students who need it. A full 7:30 to 2:30 school day that simulates brick and mortar as much as possible, and that uses the curriculum we already have in place. Lessons should be taught exactly the way we teach small group lessons in person, just through a webcam instead, not a click-through program on Canvas that can be ignored. I think the program we had in the spring is what's scaring people away from it,
not realizing that that was thrown together very quickly. Again, I am taking this very seriously. I'm also immunocompromised myself. I'm asthmatic. I've been hospitalized 9 times in the last 5 years due to a virus that interfered with my asthma. I've had pneumonia. I've had the flu, which was because somebody sent their child to school sick.
Ms. Smith, you've exceeded your 3 minutes, but thank you, and your comments have been noted.
Okay.
Thank you.
I just want to finish one more thing. I really think we should be fighting alongside the Florida Education Association and suing the state.
Thank you, Ms. Smith.
We should be demanding that.
Thank you, Ms. Smith.
We should be demanding.
Ms. Schultz, next caller, please.
We have Miss Mary Comiskey.
Good evening, Ms. Kaminsky. Ms. Kaminsky?
Can you hear me?
I can hear you now.
Okay.
Yes, ma'am. Go right ahead.
Oh, hello. Hello. Miss Wright, can you hear me? This is Mary Comiskey.
Yes, ma'am. I can hear you.
Edgewater, Florida. Thank you. I'm going to zip through my points. I left messages for each of the 5 of you yesterday with my points, so I'm going to skip over those because I have something else to say, of course. Lockdowns. Code Red 2s, not drills. How are you going to protect teachers and students in those closets and hardened corners? Fights. Do educators just let them duke it out until they knock each other unconscious to stay safe from COVID? You may smile, but these are serious concerns. Option 2, pedophiles. What about pedophiles in the room at home with a child who is piping into the classroom, and my grandson is sitting in that classroom and they get his name or even, God forbid, see his face? Okay, I am going to read my next section off of an article I published last week. I recently sat through a school board meeting that went a while. The local health authority, head of the County Department of Health, discussed mitigation measures if a student or staff member tests positive for COVID. Much was made of how the school will deal with cleansing the areas the individual was in, supporting those who've come in contact with 2 weeks of isolation, welcoming the person back only after they've tested negative or been asymptomatic for a set period of time. The fact of the current 20% false negative rapid test, the fact of spread by asymptomatic individuals, and the fact that current research shows people can be sick with COVID-19 in a near chronic way which lasts for months. None of this was addressed. My guess is the Department of Health and the board aren't dealing with these simple facts because there is no way to do so in open schools. For me, this effectively nullifies the plan presented, as well as any input from the Department of Health. And Dr. Balbin, your trainings, workshops, work sessions, representatives, community approaches will mean nothing if a family member of mine dies of COVID due to your decisions. I will sue each of you by name, and I will be alive to do it. I am the daughter of the guy who came up with the space shuttle. Logic and science are my guiding principles, not passion. Linda knew my father. She can verify. Anyone who sat in an IEP meeting with me can verify too. All your policies and white papers, by the way, they're still using some of mine, won't be a defense. I will sue you, and you, and you, and you, and you, and you. Not all my family members who work in VCS bear the Comiskey name. I learned at the feet of Bill Cuthbert. He taught me you're known by the class of your enemies. Don't be my enemy. Don't kill my family members. Children do better when they graduate later, start school later, slow down, do the research.
Thank you, Ms. Kaminsky.
This isn't about them, it's about you.
You have exceeded your 3 minutes, Ms. Kaminsky, but thank you so much for your comments. Ms. Schultz, your next caller. And after this call.
Yep, after this we'll do break?
Yes.
Okay. Up next we have Miss Wanda Cortez on the line.
Mrs. Cortez. Good evening, Mrs. Cortez. Ms. Cortez. Ms. Cortez, you may have to push *6 to unmute your phone. Ms. Cortez? Ms. Cortez?
It appears she does not have a good connection. Would you like me to admit someone else?
Yes.
Hello?
Oh,
Ms.
there we go.
Cortez?
Can you hear me now?
I can hear you now. Yes, please state your name, and you have 3 minutes to address the board.
Okay, my name is Wanda Cortez, and I'm a parent in Deltona. Can you hear me now? I can hear you now. Yes, please state your name.
Can you turn your computer or your other device down or off, please, ma'am?
Okay, my name is Wanda Cortez, and I'm a parent in Deltona. And I pretty much don't agree with the schools starting. I don't think our kids should be, the schools should be opened at this time. But I think that the ship has kind of sailed with the powers that be, and it's like beating a dead horse right now unless governor and president do something different. But what I want to say is I want a safe alternative to sending my child to a classroom. I don't feel like, I don't think we have enough information about anything on this virus. We don't even know what it's capable of yet. And being an RN, I know this. But I don't feel like I'm willing to risk my child going back to school and in person to find out further about it. So what I ask is that the board does approve the Volusia Live to give us at least a safer option than, to me, it's a safer option for our children, the teachers, and the staff than going there in person. Hopefully, yes, you have to open the doors to the brick and mortar and traditional school. Hopefully nobody sends their kids into it, though, if you give us a safer option. It may not be the best, but I think as it goes, the kinks can be worked out. The end of last school year, it might have started off rough. It was abruptly, but it ended up being a good experience, and my child did very well at it. In this world of where we're mostly a virtual, we can work remote, we were virtual world and technology, I think Volusia Live is a good alternative to sending them in person. So please consider approving it. Thank you.
Thank you and have a good evening. And listening audience, we are going to reconvene at 8:15. Thank you. Okay, we're going to start back in about a minute. Mr. Persis, are you there? Ms. Haynes will be right with us.
I am here. I'm here.
Okay, we're all back and we will resume our meeting. Mrs. Schultz, I'm ready for our next caller.
Okay, we have Miss Tressa Meyer, and please I wanted to remind everyone to hit *6 to unmute your phone. Tressa Meyer.
Before Ms. Meyer start, I believe Dr. Balgobin would like to make an announcement. So just a moment, Ms. Meyer.
Okay. Thank you, Madam Chair. Board members and to all of our callers here tonight, I would like to make a point of clarification to our callers. Option 1 and option 3. Option 1, the traditional setting, and option 3 are Volusia Online. These are not two options that are here tonight for vote and approval. And the reason for that is that these two options were part of the emergency order that we received from our governor on July the 6th. Tonight, the only option that are here on our agenda item for vote and approval tonight is the option 2, which is Volusia Live model. So we would like to listen to your concerns as it relates to this option tonight.
Thank you, Dr. Balgobin. Mrs. Myers, please state your name. You have 3 minutes.
My name is Tressa Meyer. I'm a resident of Port Orange.
Okay, you have 3 minutes.
My concern is with our deaf and hard of hearing students. I do have one that is a child. And if everybody goes back to school and the teachers are wearing masks, they cannot read their lips and use the facial expressions for their cues. Online learning for option 3, they don't receive all of their extras and their help that they would need. Option 2, teachers would still be wearing masks. Why don't we have an option like we did back in March for these special needs students? That is my concern. They will struggle so much more not being able to see the faces and the lips, being able to read them. I think it needs to be addressed.
Thank you, Ms. Myers. We appreciate that, and we don't respond, but we are taking notes, and we will be addressing the questions that we receive. But thank you very much.
Thank you, guys. Have a great evening.
You do the same. Next caller.
We have Miss Andrea Cochran.
Good evening, Mrs. Cochran. Please state your name, and you have 3 minutes to address the board. Ms. Cochran, push *6 to unmute your phone.
Can you hear me?
I can hear you now.
Okay. You know, it takes a moment to mute your television and do your *6. But given that, thank you for your patience. And thank you for allowing me to speak to you. Although Dr. Balgobin did just clarify that we're only looking at option 2, I want to continue to speak to those other options because I understand from our Florida Constitution that the school board can make an exception. So given that, as someone who's 50 plus, 60 plus, I'm very concerned about the risk involved in face-to-face class requirement. We, Madam Chair, you had mentioned your own concern for training for the teachers with online instruction, to which I agree. It's come to my attention that in 3 counties, Miami-Dade, Broward, and Palm Beach, they provided paid training for their faculty in June in preparation for 100% virtual school in the fall for the first quarter. A move I believe we in Volusia County should consider in light of our area's risk. Someone else has mentioned this evening that our numbers are at 18%. I understand that we are behind the power curve in terms of a plan and the necessary steps to implement that. I, like you, Ms. Wright, are very concerned as we would look at a virtual model for students from disadvantaged economies and or neighborhoods. Not having ready access to Wi-Fi and technology, as well as parents who must attend work, therefore needing childcare. However, teachers at this point are being asked to bear the brunt of this reality and its associated responsibility, whereby the responsibility belongs to the entire community. It is the school board's responsibility, not the teachers, to make sure that everyone has the technology and the computers that they need. The community, for instance, government and businesses, to shoulder and to help. One example, Spectrum had stepped forward during our previous measure in March to offer Wi-Fi for $6.99 per month. And our government agencies, along maybe with community centers and even churches, may need to step up to provide child care for children or a safe place for them to receive and to be able to work on virtual instruction until we have 14 days of no cases or a lower percentage. A couple of questions I have before I end to consider. What percentage, and someone posed this earlier, what percentage of our faculty staff are 50 plus or 60 plus years old, that we should consider the very real life and death risk of them returning to brick and mortar? Another question, should we continue in this move to brick and mortar? What numbers would indicate we oopsed and should have gone virtually? That now we would need to move into a virtual environment and step away from face-to-face. What's that threshold? And then finally, what's the plan should a student contract COVID-19 from that or while in that brick and mortar and needs to be quarantined for those 14 to 20 days? How will that student receive instruction? Would that not be from a virtual module, and who would deliver that? I want to thank you very much for giving me a few minutes to speak, and look forward to us figuring this out.
Thank you so much, Ms. Cochran. Have a good evening. Next caller, Ms. Schultz.
Up next, we have Mr. Dylan Emmerich Brown.
Good evening, Mr. Brown.
Hello,
Callers,
can you hear me?
Yes, I can, Mr. Brown. Please state your name, and you have 3 minutes.
Thank you. My name is Dylan Emmerich Brown, and I teach English at Deltona High School. We need a clarification in writing on when a refusal to wear a face mask or shield devolves from a health issue to a disciplinary one, and what the proper protocol should be. There's a stark difference between a student experiencing an asthma attack and a student exercising misplaced protest. One is a medical issue, the other is insubordination that puts the safety of those in the room at risk. This is a public health concern regarding the worst viral pandemic in American history, and the protocol for a health exemption in an emergency scenario needs to be separated from insubordination, which threatens the safety of those in the classroom. This needs to be more explicit in writing for uniform protocol across the county. So thank you, board members, for your tenacious pursuit of this clarification earlier. Additionally, while medical exemptions to face masks are absolutely a real scenario which should be accommodated, no medical exemption should expose a student without a face mask or a shield in a poorly ventilated classroom with 25 plus students in close proximity for an hour at a time during a viral pandemic. Those accommodations need to include alternative services that do not put the student or others at risk while still providing an optimal education. So I would hope that these appropriate accommodations will be in place by the start of the school year. I've also heard the words paper masks repeated tonight as an option for students provided by the district. Traditional paper masks are designed to protect from dust and pollen, but not small particles such as viruses. So I believe clarification needs to be made regarding the face masks we are providing our students to ensure they are up to the standards of protecting them from the virus for which they are mandated to wear them. And lastly, according to the district proposal tonight, the face covering mandate proposal would go into effect for 90 days. I would like to know what the criteria will be for establishing whether or not the emergency plan will be continued. Teachers and students are evaluated based on various data points by professionals, and I'm sure the same would apply here. It is essential that we not only make sound decisions based on medical science in the interest of the health and safety of our students, faculty, staff, and families, but that we stay the course unless it is deemed safe to do so by the same criteria used to implement the emergency plan to begin with. So I would humbly ask that clarification be made on the renewal criteria for this necessary plan. Thank you very much to the board and district for all the effort you are all putting into this. It is not going unappreciated.
Thank you. Have a great evening, Mr. Brown. Next caller.
Thank you.
Next up, we have Ms. Kim Short.
Good evening, Mrs. Short. Please state your name and you have 3 minutes. Ms. Short?
Hello.
Hi, Ms. Short. State your name and you have 3 minutes.
Kim Short. I wanted to call in tonight to discuss the Volusia Live option, but I also wanted to call in tonight to thank you all for extending the start date to 8/31. I can only imagine that this is a very difficult time for everybody, and I know that you want the best for everyone and that you're taking everything into consideration, regardless of what the phone calls might be sounding like tonight. I trust that, you have to find a way to move forward. And I'm also going to call in tonight to say that I think there's a group of people that you're not hearing from, and that's the people that actually do want to return to school and don't have a choice but to return to school. So I feel for everybody involved in having to make choices, but as adults, sometimes we don't have perfect choices. We just have to make them. And I don't envy your position, but that doesn't mean that we can't, we can sit here and not take everybody into account. And that includes those who actually want to go back to school but aren't going to call in to say anything tonight. So I guess I'm going to call in. I'm going to kind of speak up for them. And I know this live option, it has a lot of concerns behind it. And I've got a lot of teachers who've asked me questions I don't have any of the answers to. And I appreciate that there's workshops planned and trainings planned. I also think there might be a need for perhaps some optional meetings, some communication with the staff that, maybe we could be putting out to people right now. Not that it would be mandatory, because I know that that's outside, what their work requirements are. But I can tell you there's a lot of teachers who aren't taking trips right now who would feel a lot better if they had, that as an option. So I guess that's something else I think we should be considering. And then the other thing on top of that I do believe this Volusia Live option is something we should be exploring, because we really, really shouldn't be thinking about going back to doing anything like we did last year. And having a teacher teach all, during that time, during the school day would be the best option for a lot of us parents. If we, do have to stop school. I guess the other thing that we really do need to have clarified as parents is not only who's going to be returning to school, but if somebody could also maybe go into a little bit of some detail on point of contact a little bit more, and how that's going to affect teachers and students, and who would be required to be out of school and for how long. I'm not even sure how much more time I have, but that's basically what I wanted to say. I don't think you're in an easy position, but I would ask that we have to continue to look at every piece of data that comes before you all the time and make the best decisions that you can. And just because it's hard doesn't mean we can't do it. Thank you, Ms.
Yes, thank you, Ms. Short. And we are taking notes, like I'm telling each caller of the questions that we're receiving. We're not responding right now, but we are taking the notes, and thank you so much.
Yeah, thank you.
Next caller.
The next caller is Miss Amanda Serta.
Good morning, good evening, Ms. Serta. Good evening, Mrs. Serta.
Can you hear me?
Yes, good evening, Mrs. Serta. I can hear you. Thank you. Please state your full name, and you have 3 minutes to address the board.
Thank you. My name is Amanda Serta from Port Orange, Florida. Good evening. I wanted to thank you all for providing the Volusia virtual option. As a mother to an IB student who's worked so hard to be eligible for this program, this allows me to keep her home because I do not feel that schools are going to be safe in August. Online, I'm so sad to keep reading teachers being labeled as disgruntled, not team players, or told to find a new job. Or it's being suggested that we will grudge teach students, whatever that means. It's sad, unfair, and unjustified, all because we want to be protected and to protect our students from the virus. I keep reading posts on social media and hearing in various news outlets that this virus only has a 10 to 20% positivity rate and that it's fatal in less than 1% of the time. But the faulty thinking with that is that it confirms that some people will become infected and some people will die from it. I also keep reading how children do not really acquire the virus, nor do they spread it very much, which we now know from medical professionals that that's not correct. But let's use those numbers in a different way to put it into a different type of perspective. In a typical classroom of, say, 20 students, what if a teacher were to say, I have 80 to 90% of my students in the class passing, so I'm not going to worry about the 2 to 4 students, that 10 to 20% who are failing. After all, less than 1% of students will die from failing a class. And if they don't like it, they can switch to a different teacher. They can homeschool them themselves, or they can switch schools. That's what teachers are being told by parents online. Of course, teachers would never, ever say anything like this. We would never leave any student behind because it's immoral, unethical, and because we care about every single student and their success. Why then are we okay with endangering even 10 to 20% of teachers, students, and staff by opening up too early? For the safety and health of all, the best option is to use Volusia Virtual for all students, at least for the first quarter or until numbers are declining for more than 2 weeks. At minimum, though, we need to mandate masks. No other profession asks the employees to be in close, sustained contact with 18 to 20 others in a 30 by 30 box for 6.5 continuous hours every single day, let alone without everyone in the room wearing PPE. Shields are good, but only in conjunction with a face mask. They're not standalone. I'm asking that you please strongly, strongly consider opening with Volusia Virtual for the health and safety of all until the numbers decline. Thank you.
Thank you, Ms. Serta. Now, next caller.
We have Miss Elizabeth Albert on the line.
Good evening, Mrs. Albert. State your full name, and you have 3 minutes.
You can't hear me again?
We can hear you now.
Now you can? Thank the Lord. Okay. Goodness gracious. Well, good evening again, Madam Chair, board members, Dr. Balgobin, and members of the audience. I would like to begin by stating that it's our desire as the exclusive bargaining agent for both the support and instructional bargaining units to work collaboratively with the district and to find solutions. However, it is difficult to achieve this goal when the district continues to attempt to usurp the process by which we must do business. I will remind you again that the decisions made here tonight must be bargained, and that if implemented without bargaining will result in formal action. I am concerned about the meetings that have already been scheduled to begin the work of planning the implementation of this plan prior to convening this very meeting tonight, and the outcome of the vote. Quite presumptuous. For complete transparency, I have shared these same concerns with Dr. Balgobin earlier today, and as our conversation continued, I also shared the following. With the exception of the pre-K through second grade plan, Volusia County Schools is not truly offering 3 options. Any parent in grades 3 through 12 with a student in grades 3 through 12 who believes that they are enrolling their child in a brick and mortar setting where little Johnny will be afforded 100% of the teacher's attention is mistaken. Currently, in grades 3 through 12, the plan offers only 2 options, Volusia Live and VOL. Currently, students who go to our schools, the physical building will be sitting in a classroom where the teacher will be tasked with teaching 2 classes simultaneously, one face-to-face and one through Teams or Zooms. As you know, we cannot serve 2 masters. To simultaneously tend to, support, or devote oneself to 2 different and competing groups does not work. As teachers and support professionals work to fill the learning gaps that most certainly exist due to the unconventional manner in which last year ended and still attempt to teach the current grade level content, you know that this is not going to work. It is, and you know also that the assessments are still coming. The solution is simple. The plan needs to be reworked. I ask you to consider sending the district back to work to refine this option and to truly provide 3 plans for parents, students, and our educational professionals to select from. Of course, only reconvening in a brick and mortar setting when we have had 14 consecutive days of positive cases under 5%. Thank you.
Thank you, Ms. Albert. Next caller, please.
We have Miss Vernell Spar on the phone.
Good evening, Mrs. Spar. Ms. Spar? Good evening, Mrs. Spar.
Hello.
Ms. Spar, can you turn down your either your computer or your iPad in the background, please?
Is that better?
Yes. Please state your name and you have 3 minutes.
Good evening, Madam Chair, members of the board, and Dr. Balgobin. My name is Vernell Spar, and I am a music teacher at Cherokee Small Elementary. My 3 minutes, I will take my 3 minutes just for a few comments. We as teachers are asking for the district to ensure certain protocols are in place, such as sanitizer, wipes, soap, and for ABM to clean all surfaces in the classroom. In their contract, from my understanding, it just says that they will spot clean the desks. That is not acceptable. The district's homepage has the saying, all in and we are stronger together. If this is true, my ask is for managerial, non-bargaining employees to be housed at specified schools to help support the schools in taking temperatures, getting the students on and off campuses safely in the afternoons. If we want all boots on the ground, we need all boots on the ground. And we need your support in getting this done to help support the faculty, staff, students, and parents at our schools here in Volusia County. Thank you.
Thank you, Ms. Spar. Next caller.
Valerie Jessup is our next caller.
Good evening, Ms. Jessup.
Can you hear me now?
I can hear you now, Mrs. Jessup. Please state your full name and you have 3 minutes to address the board.
Hi, my name is Valerie Jessup, and I would like to thank you for what you guys have been doing for us in this last couple board meetings. But I would like to start off by saying that with what happened in the last board meeting, the health department said that the cases are rising with just people doing family get-togethers. How are we going to protect the students and staff going back 100% capacity at schools? And while we're speaking of 100% capacity at schools, restaurants are at 50% capacity and they're having to close down because staff and customers are getting infected and they're having to close down and clean as well. If ABM can't do basic cleaning before COVID, how are we supposed to expect them to do absolute disinfecting after COVID? I would also like to know, how are we going to control when people get sick? In my school, each classroom does not have their own AC. We share ACs between multiple classrooms. So with this virus, if one classroom gets sick, what does the other classroom have to do? And if you're sharing a bathroom in your pods, how are we supposed to keep everybody safe with 2 bathrooms being used by 4 classrooms? It's absurd to me. I would also like to know how I'm supposed to get my pre-K kids onto the changing table without using masks. You guys say that you're going to be able to provide masks and appropriate PPE for all of your staff, but as of last year, before any of this even happened, we were having a shortage of gloves, and I was running out of gloves while changing my pre-K students. So I see this as being a real problem in the future with being able to provide appropriate PPE and enough for everybody. And also talking about when people are out, what about subs? Subs go to different schools. How are we going to control where they're going and what classrooms they've been in, who they've been around? Because then all of those classrooms have to be quarantined for 14 days. They were contacts with this sub. There are a lot of questions that need to be answered, and I would like to know when they will be answered, since they won't be answered in the meeting.
Thank you, Ms. Jessup.
When do we receive our answer?
Ms. Jessup, they will be addressing your questions, but thank you, and we have written them down.
Thank you.
Have a great evening. Next caller.
Ms. Wright, we have 2897 as the last 4 digits. The name dropped out.
Okay.
2847, phone number.
Caller, please state your name, your full name. Good evening. Good evening. Ms. Schultz, can we go to the next caller? And if they call back, can you, or can you try to reach them?
Yes.
Thank you. Can you bring in the next caller?
Can you hear me? Hello?
Yes. Yes.
I
And
gotcha.
can you state your full name, please?
I can. My name is Dorothy Featherston. I am an elementary teacher at Volusia County Title I School. You still hear me okay?
I can hear you okay. You have 3 minutes. Go right ahead.
Okay. I love teaching, and I really desperately want to get back in the classroom as soon as possible. And I'm not afraid to return to a traditional classroom environment. But unfortunately, your Plan 1 takes away every art and music classroom throughout the county by stating that specials will have to travel to students' homeroom classrooms. Art and music have had to fight for years just to get into a classroom. And with one poorly thought out rule, you took that all away. Show me the scientific evidence that supports the theory that traveling from classroom to classroom is safer and healthier for everyone. There isn't any. And I understand everyone is trying to come up with the best plan we can to get back to some level of normalcy, but please don't strip art and music of their classrooms. This is a temporary problem that you're going to be making into a bigger one down the road. I understand, I took a simple online survey of some art teachers. 90% of them believed a dedicated classroom is the best and safest way to effectively teach our kids. Somebody has been ignoring our curriculum directors in art and music because they have told you that this is not a good idea for special areas. because they have been pushing back on moving and art on a cart is what it's called. So what you're really wanting us to do is put all our time and effort into running across campus every hour, pushing a cart full of partially clean and dirty supplies into multiple classrooms. You want us to rely on the supplies that the students probably won't have to do the assignments. Watch the clock closely because it's going to take more than 2 minutes to clean up. Collect and store dripping wet artwork before we have to race to the next class. In my own classroom, we can manage student spacing and cleaning of used materials and supplies. We are masters at this because we want the kids to engage in the lesson as long as possible. I was having my students perform clean-out duty within the classroom long before this pandemic came out. And that requirement is going to continue long after this is gone. Students need to be able to move, spend some time outside of their classroom. Moving to special area gives the students the much needed fresh air and break from the classroom. With proper face covering and hand washing, students and teachers will be reasonably safe. There is no need to drastically rearrange our kids' entire school system for something that has less than a 1% infection rate. You are not expecting core teachers to give up their classrooms to be on a cart, so why do you expect special area teachers to do so? It's not healthier, safer, or equitable for everyone. Just because a few other schools are doing it doesn't mean it's right for our kids or teachers. Thank you very much.
Thank you very much. Next caller.
Up next, we have Scott Thielen. Scott Thielen.
Are you saying V or?
Or it might be Thalen. Thelan.
Oh, Thalen. Okay. Thank you. Mr. Thalen. Good evening, Mr. Thalen. You may have to push *6 to unmute your phone. Mr. Thalen?
Hello, hi, how are you?
Fine, how are you?
I'm doing well, thank you so much. I want to just take a quick moment, thank you all for your time. I really appreciate the dedication you guys have had. I sat through all 6.5 hours of that wonderful meeting last week, and I was beaten to the point of exhaustion, so I don't know how you all do what you're doing, but I do want to thank you for the options you guys have put together. Certainly, for me as a parent of a high school and elementary student, I've been having to go back and forth as far as deciding which option is going to be best for the kids to attend. I have two kids that both want to go back to school. One is not a fan of wearing a mask. The other one can't wait for the opportunity to run around in a mask. So I'm going back and forth, and I'm thinking I have tough decisions. And obviously, what you guys are deciding here tonight is a very tough decision. The only thing I'd like to ask, obviously, I think the Volusia Live is a fantastic option, given the best of both worlds, because my younger child in elementary school struggled last year. Even though she did really well with grades, her attention was really far away, other than the fact of when her teacher did some online Zoom meetings towards the end of the last school year. She was really dialed in, so I think the Volusia Live option will be fantastic. But what I'm hoping can be clarified going forward is, first off, if for some reason the Brain Trust in Tallahassee didn't approve the Volusia Live option, what would be the option parents are faced with? Would they automatically be enrolled in either Volusia, the Volusia Learning, or the brick and mortar, or will we have an option to choose? And then the other question is really how fluid, as I know we've been saying with how fluid this whole situation is, how fluid will a transition back and forth if you do Volusia Live and the brick and mortar be? Could a child switch on a week-to-week basis, again, depending on if health situations warrant, or even with childcare, if perhaps I can only get childcare for a couple of days, would you be able to have them go to both brick and mortar maybe a few days a week and then do the Volusia Live the rest of the week? So those are really the only issues I have that hopefully you guys can address in the plan moving forward. But again, thank you so much for all you guys are doing. God bless. Have a good night.
Thank you. You do the same.
Bye-bye.
Bye-bye. Next caller.
David Manning is our next caller.
Good evening. Good evening. You may have to push star 6.
Can you hear me?
Yes, I can. Can you please state your full name? And you have 3 minutes.
Yes. Hi, my name is David Manning, and I'm a teacher in Volusia County and a parent of 2 elementary-age children. I teach a CTE classroom that typically has over 30 students packed into a confined space, using equipment that 6 other classes worth of students will be using during the school day. The live broadcast from the classroom model I think that's being discussed tonight is too incomplete. It sounds like you'd expect a teacher to stand in a single spot all day while teaching to make sure that the virtual students can see the teacher while they talk. How are teachers supposed to split their attention during a lesson? 50-50? Is it 25-75? What about students that don't have the required equipment to take part in a lesson from home for a class like CTE? Do you feel that in a low-income area where parents need daycare, that enough parents will opt to keep their kids safe at home to allow for social distancing in a classroom like mine? I honestly don't think that would happen. And what about substitute teachers? Will they be rushing into our schools and potentially infecting themselves with no provided health care? Will a substitute teacher be expected to teach the broadcast students and in-class students at the same time? Or will the broadcast students be told that they're not having class that day? Will these classes be recorded? Can they be used to discipline a student after the school day has ended? What about discipline a teacher? Can they be used in teacher reviews? And then I also wanted to speak regarding the masks use. I want to know what happens when a student wears a mask with a release valve on it that has been proven not to protect others from their breathing. I want to know what happens if a student wears a mask that they cut holes into. What happens when a student will only wear a mask over their mouth but not their nose? What happens when a student wants to take off their mask to kiss each other in the courtyard between classes every single day? Every time they get asked to put their mask on, and every day they comply, but every day they do it again. And what if a colleague decides during a professional development meeting that they want to wear a mask, or they don't want to wear a mask, or they want to wear a mask but they don't want to cover their nose, or they want to wear one to the vent that doesn't protect others? What if that person is in a position of authority over you? If school administration decides that they don't really want to enforce masks in the same way some schools don't really enforce dress code, what is a teacher to do? Would you be okay with a loved one going in for surgery where the surgeon has decided to opt out of wearing a mask? Why are we asking teachers to work in that environment? If a student is allowed to not wear a mask due to medical excuse, will that teacher be provided hazardous material gear? Basically, it contains suits so that they don't get infected. What about all the other students in the class? Will they be provided all that gear so they don't get infected by the one student who has some sort of medical exemption? And I've heard this school board say that they will not vote on anything that could harm a child. And putting students in an environment where there's almost a near
Mr. Manning,
Yes.
I hate to cut you off, but you have exceeded your 3 minutes. So do you have
Thank
one
you very
last
much for your
statement?
time.
Thank you.
Thank you. Bye.
Our next caller.
Miss Valerie Fernandez Pardo.
Good evening.
They're there.
Good evening. Can you please state your name?
Hello?
And you have 3 minutes to address the board.
Hi, my name is Valerie Fernandez Pardo. I am a resident of Deltona. I am a teacher in Deltona, and I have a granddaughter who goes to school in Deltona. Where do I start? I guess I start with 1.5 hours of discussion about mask wearing. I am appalled that that much time was taken for something that seems to be very basic as far as the criteria for us returning. We need to wear masks. We need to have distance between each student, which I'm not sure we can have depending on the numbers returning. And we need to have cleanliness. And I think we've already discussed that, how that is not there. All 3 of the criteria for returning to school, it seems like our district will not be able to attend to. I, too, have created a will, a living trust, an advance directive, as well as a financial power of attorney because of my fear of returning to school. I applaud Ms. Hawkins for putting a caveat inside of her will. I will be updating mine to include that as well. I know that the decisions that you have right now before you are unbelievably difficult, but the health and safety of our community is in your hands. Please make this decision wisely, and please consider all of us. As far as the mask that you have, it's just a suggestion for Volusia Live. Maybe having dedicated teachers from K through 12 to do the Volusia virtual, not Volusia virtual, the hybrid model. Having dedicated teachers to do it from K to 12 might be helpful so that they have some continuity throughout. Thank you for your time, and keep us in mind when you are making this decision, please.
Thank you. Have a good evening. Next caller.
Next is Mr. Alan Green.
Good evening, Mr. Green.
Hello.
Yes, good evening, Mr. Green.
Hi. I'm Dr. Alan Green, an economics professor at Stetson. I have 3 children in school in Volusia County, and my wife works in the district. I'm speaking today to urge you to make the best choice for our community. I'm an expert in public policy and economics. It is evident at this point in Florida that our policies to contain COVID-19 have failed. When we compare policies across countries, it's clear that we cannot keep our community safe, restore our economy, and return to some kind of normal activity until the virus is contained. As the leaders of our school district, you are now responsible for aspects of public health as well. And the simple fact is that opening schools will spread COVID-19 further in our community and in our state. If cases were low and decreasing, that risk might be worth taking because we all want to return to school in person. But the reality now is that cases are high and increasing. Reopening schools will simply result in preventable sickness and death among our students, teachers, counselors, and staff. What steps are you taking to allow our incredible teachers, counselors, and staff to work remotely for their own safety? Additionally, attempts to reopen in a month are likely to fail. If one student comes to school with COVID-19, they can expose and potentially infect hundreds of other people. After a few weeks at most, schools will be forced to shut down anyway. Please do not set them up to fail. I know our state leaders are urging us to return to school in person in the fall, ostensibly to save the economy. But increasing the spread of COVID-19 will simply worsen the economy, and a failed reopening will be worse for all students and teachers than beginning school with distance learning. Thankfully, our state leaders do not have the final say on what our district does. You do. Please make the most responsible choice for our students, faculty, and staff. Thank you very much.
Thank you. Next caller.
Mr. Ronald Junk.
Good evening, Mr. Ronald. Good evening.
Hello, can you hear me?
Yes, I can. Can
Hello.
you please state your whole name, and you have 3 minutes?
All right, my name is Ronald Junk. I'm a resident of Deltona, Florida, and I'm actually a candidate for Volusia County School Board District 5. One thing that I do want to tell you is I personally believe mandating a mask for students, I don't personally agree is okay. What I believe is we need to give the students the options. If the students are willing to wear a mask, that is up to them, because at the end of the day, we can't force that onto somebody. The city of DeLand has had issues with that already. They've already had a lawsuit filed against the city of DeLand, and I'd hate to see that happen to Volusia County schools. I don't think that we should be able to discipline students either for not wearing a mask, because how do we know for sure if they do not have a medical problem? How do we know if like they don't have a problem where covering a mask can make it worse? And how are we going to enforce it if they just tell us, hey, I have a medical problem, I can't wear this? Legally, under the HIPAA law, we don't have the right to ask them that question. So how do we go about that to make things happen that way? The only way that I really think that we need to do is we need to make it recommended. We need to recommend, yes, you can wear a mask, but we can't force that mask mandate onto somebody. And that's all I really have to say. Thank you all.
Thank you, Mr. Junk.
Yeah, thank you.
Thank you. Next caller.
Caller is Miss Cindy Rosso.
Thank you. Good evening, Ms. Rosso. Good evening, Ms. Rosso. Ms. Rosso, you may have to hit *6. Ms. Rosso?
It looks like we lost her.
Okay. Next caller.
Next caller is Mr. Kenneth Ashby.
Thank you. Mr. Ashby? Good evening, Mr. Ashby. Mr. Ashby, you may have to push *6.
Can you hear
Good
me?
evening. Yes, I can hear you now, Mr. Ashby. Please state your full name and you have 3 minutes.
Hello, my name is Kenneth Ashby. I am one of the members of Volusia Teachers for a Safe Reopening. I want to say thank you for advocating for the students of the district, and for the extra energy you have recently put into your positions. I hope today you choose to advocate as voraciously for the teachers and staff of VCS by refusing to send our students back to campus until we have 14 days with a COVID-19 infection rate below 5%. This is the standard set forth by the Florida chapter of the AAP. In the best of times, I'm sure it's difficult to be a public official, and today, during a global pandemic that has placed our local officials in the unfair position of being the arbiters of the best way to protect the public, the federal government and the governor of Florida have put you in a horrible position that I do not envy. Please don't follow suit and do the most politically expedient thing. Don't blame the person above you and push the problem down to administrators, teachers, and staff. Mr. Persis, time and time again, our members have received emails from you stating that you believe we should not return until either 1, there is a vaccine, or 2, there are 14 days with an infection rate below 5%. You are obviously a man who uses science and data to make decisions. Please act on this today. You also noted during the last meeting that, quote, it is hard enough to just be a teacher, day to day, without the added pressures of Volusia Live. Please add amendments referenced in our most recent email to the board. I'll be sending that again following our call. Mr. Colon, during the last board meeting, you said, quote, I personally don't believe schools are safe to open. You turned to the Volusia Health Department to answer if it is safe to return. The director refused, essentially saying she had been silenced by the governor's office. This should tell you all you need to know about the safety of returning. Mrs. Cuthbert, you noted during the previous meeting that you are not comfortable returning to brick and mortar until we have 14 days of declining cases with a much lower positivity rate. Once again, thank you for thinking of sound science, and please act on this today. You also mentioned that without a mask requirement, compliance to that recommendation would disappear. Our members overwhelmingly believe a mask requirement is needed, including in the classrooms when students will be next to each other continuously. Your teachers want to work. However, they want to feel safe doing so. And at this time, many of them do not. From your words, it is obvious that many of you feel the same. Please give your teachers the protections that will allow them to continue coming home to their own families. There's already a Pasco County teacher that no longer can be afforded this right. Please
Mr.
don't let that
Ashby.
be the story of Volusia teachers and your students. Thank you.
Thank you. Next caller.
Next up, we have Miss Karen Weinrich.
Good evening, Mrs. Weinrich. Mrs. Weinrich.
Hello.
Good evening. Please state your full name, and you have 3 minutes.
Good evening. This is Karen Weinrich. I've talked to you before, so today I just want to take a minute to tell you a story of something that happened to me today. I went to the Y this morning to work out wearing my mask and socially distanced from all the other people working out. And I noticed that there were some children there for the summer program, so I walked over because I know one of my students goes there. And so I went over and I found him. And at the minute he saw me, his eyes got so wide, and he gave me a huge smile, and he ran over, and what do you think he did? Well, you can guess, of course, he gave me a huge hug, because that's what children do. And I, of course, gave him a huge hug back, because that's just what teachers do. And just imagine what would have happened if I had stopped him. And I couldn't bear to see that letdown. Then he proceeded to proudly show me his loose tooth, sticking his finger in his mouth and wiggling it back and forth for me. Now, this boy I'm talking about is a high-achieving child. He is a rule follower. So I'm telling you the story just to help you understand what is going to happen when we open schools. It doesn't matter if it's August 31st, January, I mean, it's when we go back to brick and mortar. Kids are kids, and it is going to be extremely difficult for them to consistently follow the CDC guidelines. And this is a child who is as good at following the rules. Imagine what some of the other children who struggle more are going to do. Teachers like me, we're going to be forced to make the choice between keeping these children 6 feet away or servicing their social and emotional needs, and that is very difficult. So as you make your decision today, I want you to keep this in mind. We cannot count on students to follow the guidelines consistently. As much as we'd like to, we know what children are like. And so when you open the schools, just remember that these kind of encounters are going to happen all over Volusia County schools at every grade level. And I also really quickly wanted to comment on the special area teacher who talked and asked for the students to be able to go to her room. As a classroom teacher, I would agree, and the reason is when they come to our room for special area, then we as teachers during our planning time need a place to go. And there is no place for my entire grade level to go that we can remain socially distanced from each other. If we are able to have our classrooms, we can have all 6 of us in one room, spread apart. We just don't have the facilities. I don't know where I will go during special area time if the special area teachers come to my room. So I'd like you to keep that in consideration when you make that rule. Thank you very much.
Thank you. Have a good evening. Our
Thank
next
you.
caller.
Our next caller is Miss Leslie Sparks.
Good evening, Mrs. Sparks. Good evening, Ms. Sparks.
Good evening.
Good evening. Please
thank
state
you.
your full name, and you have 3 minutes. Go right ahead.
Thank you. Leslie Sparks, Port Orange. Good evening, school board members, superintendent, and Madam Chair. Thank you for giving me the opportunity to speak this evening. I wanted to voice my opinion on the traditional classroom setting face-to-face option. Anyone who knows me knows I love being with my students. I enjoy teaching and learning right beside them every day. But it has to be safe for everyone of our school family. The face-to-face choice needs to have an amendment that we should not go back until the positive case numbers are going down in Volusia County for 14 days. We need to keep students, families, and teachers safe. Teachers should teach virtually from their classrooms until it is safe for face-to-face learning. This way, we could start the year off with our class list and have virtual meet the teacher and see our new students. Then we can work virtually until it's safe to go face-to-face with our students. Also, I'm in favor of the August 31st start date for students. With this date, the teachers will now have time to learn these resources and training. We could set our classrooms for virtual learning and be prepared for face-to-face when it's safe. Also, with this later start date, hopefully, the number of positive cases will decrease in Volusia County, or the executive order will be changed. Thank you all for your dedication to Volusia County and the opportunity to voice my concerns. Please put the safety of students, teachers, and families first.
Thank you so much, Ms. Sparks. Have a good evening.
Thank you, Ms. Wright. You too.
Our next caller.
Next caller is Mr. Scott Cleary.
Good evening, Mr. Cleary. Mr. Cleary, you may have to push *6 so you can unmute your phone.
Yes, Madam Chair. There's a slight delay.
That's okay.
Madam Chair and board members, my name is Scott Cleary. Presently, you're going to be voting on the fall reopening plan. While I fully support the submission of the Volusia Live to the state, it must be done so explicitly with the direction to the superintendent that this is a work in progress. Further, in ongoing discussions, it must be the direction of this board to direct the superintendent to seek out and resolve criticisms rather than falling into the trap of toxic positivity that dooms so many district initiatives to failure. We must be mindful of what it will take for this plan to be successful at the elementary and secondary level. With respect to other comments, Madam Chair, as constitutional officers, you do have the right to vote not to return to brick and mortar, and citizens have a right to advocate for the same. As a father and teacher, I wish we could return to face-to-face and move forward, but that's not where we are now. We must heed the words of the Florida chapter of the American Academy of Pediatrics, admonishing us not to reopen yet. We must heed the CDC guidelines call for a positivity rate below 5% for 14 days before opening schools. You must take Ms. Boswell's refusal to say schools are safe to open as an answer in the negative. And most importantly, you need to trust your feelings that opening brick and mortar is a mistake. While the governor is attempting to bully boards across the state, you have the authority and an obligation to do what is right. And most importantly, what you know is right. If you move to reopen, especially with the mask suggestion as proposed, it won't be if, but a matter of how many children and adults will be lost to COVID, and of those who survive, how many will be afflicted with long-lasting effects. If you fail to protect the children of this district now, when will you? Please vote against any brick and mortar option until it's safe to do so, and be the leaders I believe you to be, and the leaders you claim to be. If you choose not to stand up for our children, nor protect your employees, may God have mercy on your souls.
Thank you, Mr. Cleary. Have a good evening.
Thank you. You too.
Next caller.
Next caller is Miss Laura Pyle.
Good evening, Mrs. Pyle.
Hi, can you hear me?
Yes, I can, Mrs. Powell. If you please state your full name, you have 3 minutes.
Yes, of course. Good evening, everyone. My name is Lauren Peel, and I am an elementary school teacher. I would like to thank you all for putting the effort into trying to find a plan that is safe for students and employees of Volusia County. I am regretful in saying that this plan that has been created is not safe enough. There is crucial information that is uncertain and undefined throughout the plan. With brick and mortar, I urge you to consider the following flaws. The CDC recommends a minimum of 6 feet distance at all times, and masks when not possible. Your plan recommends 3 to 6 feet and only when possible, despite the risk it poses. If only an estimated 20% of students enroll in line, how will social distancing even be possible in previously overloaded classrooms? At most, you are adjusting classroom sizes to their normal recommended size, not limiting enrollment as described. And then, how will you handle when so many teachers leave their profession and that small decrease in class sizes is now inconsequential due to a lack of staffing? What details can you provide about which students for each level of schooling will be required to quarantine due to exposure? And what actions will be taken when or if someone dies due to contracting COVID at school? And with PPE, assuming you have correct numbers of what to order, hospitals are experiencing shortages of these materials. What assurances do you have that you won't run into the same issues with limited supply? On the other hand, in regards to online learning, is the plan going to be adjusted, especially for elementary levels through 5th grade, to have an assigned teacher for online learning? When teachers take the survey about their preference, is that preference guaranteed? What happens when all teachers are forced to virtual after a few weeks due to an outbreak? Those that opted for in-person teaching will be transitioning in a small amount of time with limited training and knowledge for how to proceed. And what are the options for offering support in the evenings for those students that want to stay with their school but may not be able to log in during the morning? As much as I would love to be in my classroom daily with my kids, I understand that we have a responsibility first and foremost to the safety of those children. This is why we interrupt learning with safety drills on a regular basis. However, instead of interrupting learning for this, we could create a plan that is a compromise for teachers, students, and parents without risking lives and continuing learning without weekly interruptions due to quarantine. I urge you, instead of—
Thank you, Ms. Peel. Ms. Peel, thank you. You have exceeded your 3 minutes, but thank you so much. Have a good evening.
You too.
Our next caller.
Next caller is Miss Melissa Herban.
Good evening, Mrs. Herman. Good evening, Mrs. Herman.
I'm calling in tonight.
Can you please state your name? You have 3 minutes.
Yes, this is Melissa Herbine. I'm a parent of DeBerry, and right now I am working from home, and my work consists of productivity, and I do have a child that goes to elementary school that's going into the 3rd grade. Now, mind you, he did the distance learning at the end of last year, and his daycare was open, and they were trying to help him in doing the distance learning, but it didn't really work. So I had him home a few days while I was trying to work from home, and it didn't work also because he was also bothering me a lot of different times. So with the online learning, it doesn't really work out for me. I would like him to be in the brick and mortar. Yes, he is already wearing a mask. I am trying to teach him to keep on wearing the mask wherever we go. That is up to the parents' responsibilities to teach the kids on this. I work in actually healthcare. I'm a clerical person that works for a cardiologist office. So I am also in the healthcare. I understand that it is very important on keeping everybody healthy and safe. I am also trying to do that whenever we go out somewhere. But understand I don't have anybody to help me as far as the child care. I do have that daycare, but I am also worried about that daycare also when school starts. But I am trying to keep everything in perspective. I do like to have the art and music in a separate room. I think that is very healthy for the kids to go to another room than being stuck in one room. I think that is very helpful to get the kids up and walking. He is a child that cannot sit still, so that is very helpful. And if the child hugged the teachers, then they should just hug them lightly, and that is it. They don't need to get down to their level, and if they have a covering over themselves, then that should be good. I think that is it. Thank you very much for your time.
Thank you, and have a great evening.
You too.
Our next caller.
Caller is Miss Christy Grant.
Good evening, Mrs. Grant. Good evening, Mrs. Grant. Good evening, Mrs. Grant. Ms. Grant, can you push *6? Maybe.
Okay.
Good
Can you
evening.
hear
Please
me
state
now?
your. I can, Mrs. Grant. Please state your name and we'll start. You have 3 minutes.
Okay, thank you. My name is Christy Grant, and first of all, I'd like to say that would like to say that the school should not be open face-to-face until it's absolutely safe to do so. With that being said, I'm a pre-K special education teacher, and I haven't heard very much about the plan for these students. My thought is the special needs students who are 3 to 5 years of age should not be held under the same umbrella as the K through 12 reopening plan. We know that social distancing and wearing masks is going to be impossible with these students. The teachers hold these students. There's constant touching throughout the day between the students and teachers. When you have 3 to 4 year old students playing in the classroom, sneezing and touching everything, the teachers and the paras in these pre-K classes are at a much higher safety risk than others are. So if and when we do go back to the classroom, there are a few things that I'd just like to address. First of all, the students are not bound by attendance rules and are taught based on their individual IEP plans. My hope is that with these special needs students, we could be able to make their instructional decisions individualized. One example possibly be like have the teacher, principal, and the parent meet to decide what is the best method for their child, whether it be rotational scheduling, where the students alternate days and they're provided lessons with manipulatives and iPads with apps for their specialized needs on the days they're not in school. There's just so much more that needs to be addressed with these students before anything's finalized. Last year, when we went to the virtual teaching, my students weren't allowed to have iPads from the school. I thought that was very unfair, especially since they could have been benefited from special apps used for their academic, language, and social needs. And so if we do have to go to the virtual, I really think that the pre-K students need to have the iPads as well. And that's all. Thank you.
Thank you so much, Ms. Grant, for that. Have a good evening.
You too. Thank you so much. Bye-bye.
You're very welcome. Our next caller.
caller is Mr. Mateus Gabeza.
Good evening, Mr. Cabeza.
Hello, can you hear me?
Yes, I can.
Good afternoon, school board members. My name is Matthias Cabeza, and I'm a student at Subaru's High School. I have heard the superintendent's clarification. However, the description of this item from board doc states, district staff are seeking approval of the fall reopening plan. Considering that option 1, the brick and mortar approach, is addressed in this plan, I'll continue to speak on it. I would also like to say that the district's approach to the brick and mortar reopening by saying we have no choice is simply an excuse used by you all to pass off responsibility for the negative repercussions that are to come from a traditional reopening. Today, Volusia County has set a grim record for the highest amount of new daily cases. In the past, many of you have stated that you would only support reopening schools if the cases declined ahead of the reopening. Newsflash, the curve isn't flattening, it's rising. Where does this end? When do you all say the spread of COVID-19 in our community is too widespread to reopen schools? When does the health and safety of your stakeholders become more important than the funding that the state is threatening to withhold? Using a COVID-19 risk assessment tool from Georgia Tech, it's estimated that the risk of a 25-person gathering in Volusia County, much like a classroom, has a 66% chance of containing an infected individual. That means that under the current circumstances, it is more likely for a positive individual to be present than for one to not be present. What we need to reopen safely is a consistent decline in cases locally and an ensuing decrease in risk for us to return. The elements of this plan will not work. Social distancing is only being enforced when appropriate. Masks are hopefully going to be mandated. However, enforcement will only add on to the workload of instructional personnel. Temperature checks won't keep out asymptomatic or pre-symptomatic carriers. Custodial services won't be able to sanitize and disinfect classrooms when they can hardly even clean them normally. I've repeated these issues over and over, and none of them have been solved. The fact is that VCS does not have the capacity to fix many of these holes in the plan, and this will result in a lack of safety for everyone present on campus. This will simply lead to schools being shut down soon after the reopening of schools and infection of students and staff. Rather than focusing on this brick and mortar reopening, which will fail within weeks, why not harness and focus our energy and attention on creating a meaningful distance learning program for the fall and coming up with solutions to atone for the underprivileged students who may be affected most by this decision. I understand and value that the choice is being given to families. I will exercise my choice to utilize Volusia Live in the fall. As great as choice is, you have a duty to only offer options that are safe as set in the state constitutions. It is not safe for us to return, and that should be reflected in your vote. I'd like to finish by referring to an earlier speaker who talked about the acceptable risk. I'd like to know, what is that acceptable risk? Are a few lost lives worth it for tens of thousands of students to return? You all sat there heedlessly thinking about petty decisions like the school start date while people are fearing for the impact that your decision will have on their health and safety. I would rather see the right decision made here today, but if you make the wrong decision, I will be glad to see action that holds you all accountable for that mistake. Thank you.
Thank you very much, Mr. Cabeza. Next caller.
Next caller is Miss Kelly Cahill.
Ms. Cahill. Good evening, Ms. Cahill. Can you please push *6, Mrs. Cahill? Good evening, Ms. Cahill. Can we come back to Ms. Cahill? Can we bring on the next caller?
Yes, the next caller is Miss Jill Ciccarelli. I'm not sure if I'm saying that right.
Can you spell it for me?
It's Cicciarelli.
Okay.
Ciccarelli. Oh, good.
Thank you. Ms. Ciccarelli, good evening.
Good evening.
Hi, Mrs. Ciccarelli. Can you state your whole name, and you have 3 minutes?
Hello, thank you. My name is Jill Ciccarelli, and I live in Port Orange. First, I want to thank you all for all your work you've been doing during this unprecedented times and replying to the emails. I'm speaking not only as a 15-year Volusia County teacher, but I'm a wife of a teacher and a parent of a soon-to-be kindergartner and fourth grader, and the only child of an elderly, immunocompromised father. As we know, nothing about this is normal, and nothing moving forward will be normal until collectively we bring the numbers down and a vaccine is administered. If the community at large does not want to take the individual responsibility and sacrifice their behaviors to stop the spread, we should not be the sacrificial lambs. So how do we move forward? We have to make informed decisions based on the facts at hand. I thank you for making the decision today to delay the start for students and to offering training for students and teachers and staff. As you stated, you are documenting all of our questions to find answers that will be posted on the Q&A site. I would like to add the following, as requested in addressing Volusia Live. Will training for teachers at the pre-planning be virtual, or will entire faculties be expected to meet in large groups? We do know adults spread the disease to other adults, so bringing us together is probably not in our best interest. As previously discussed in meetings, has ABM been given the new standards for daily sanitation? Please clarify your mask mandate requiring students. Is this also in the classroom? Will your mandate support teachers in determining for their own well-being that students wear masks in their classrooms? If students qualify for a mask exemption, will teachers be permitted to refuse those students enrolled in their class if they don't feel safe? Will parents be permitted to request a different class if students or their teacher does not wear a mask? Will face shields be permitted instead of masks in all situations in all areas, and is this supported by the science? Are there any specific metrics that you're following to determine if it's safe to return or not to return to school, or is that a decision only being made per the governor? Yesterday, did you know DeSantis said that he did not give the executive order regarding schools opening? It was a political chess move. So why don't you put in a request to the DOE to get local control to determine what is best for our community? In theory, I think virtual live seems an easy option. Kids sit at home and they're in your class, but for teachers, we're going to be teaching two separate formats simultaneously and facing a multitude of problems. Therefore, moving forward, I would encourage looking at having a dedicated virtual live teachers for elementary at all grade levels. At secondary levels, have dedicated Volusia Live class periods. Teachers would have less exposure. In-person classes would definitely be smaller, and both cohorts of students would get a focused teacher providing an experience proper of their chosen format. And when the home cohort returns to the school, they're already in their class. The facts today tell us the CDC guidelines recommend wearing masks, social distancing, and only being in enclosed spaces for short periods of time. The state's actually using the marketing campaign to avoid the 3 C's, closed spaces, crowded places, and close contact settings. Sound familiar? We do know the state released a statement that makes you feel absolved to not fight for what is right, but rather feel your hands are tied. You have the authority to defy the order. Call their bluff. Wear your mask and stop the spread.
Thank you. Have a good evening. Next caller, please.
Next is Miss Jane Corlett.
Good evening, Mrs. Corlett. Good evening, Mrs. Corlett. Mrs. Corlett? Good evening, Mrs. Corlett. Please push *6 to unmute your phone. Mrs. Schultz, can we go to the next caller and we can come back to Mrs. Corlett? Mrs. Schultz?
Yes, I'm just trying to let the next person in. The last 4 digits are 2949. The caller's name is not attached.
Okay. Good evening. Good evening. Good evening, caller. Can you push *6? Good evening, caller. Can we move to the next caller, Mrs. Schultz?
Yes, I'm cross-referencing names with numbers, and I have a lot of numbers that have no names. So I'm looking to see. Here we go. We have Miss Alicia Severson.
Okay. Good evening, Mrs. Severson or Severson. Good evening.
It's Severson. Can you hear
Good
me?
evening, Mrs. Severson. Yes, I can. Please state your full name. You have 3 minutes.
Hi, my name is Alicia Severson. I am a graduate of Mainland High School. I've taught in Volusia County for 15 years, and I have a student with special needs. I want to thank you first for extending the start date of our school. I also want to say that everyone I know wants to return to school. Only a few seem to want to risk it and do it now. Frankly, I couldn't believe that our district came back here again talking about a traditional brick and mortar reopening of schools. When person after person and fact after fact is evidence that we should not open our schools. This conversation is premature. It's like the 6.5-hour discussion last week never happened. Frankly, I feel like our district should have come here this week with a plan to get laptops and internet service to every student in Volusia County. They should streamline that process. In the spring, I had to get information out to parents who had no internet, and I just feel like that should be a little bit easier for the parents who need it. As I noted, I have a student with special needs. He hates virtual school, but I've accepted that he's going to have to do it. He may fall behind, he may not, but he will be alive to learn. I am asking you all to ask our district for a phased reopening using CDC guidelines. Frankly, I'm not sure a later start date is even going to help us. Here in Volusia County, we have weekend concerts, full beaches, and other planned events next month, so I don't see our numbers improving. If we open in a month, we will close in a month. I also want to say something tonight about our economically disadvantaged students. As most people know, the numbers for COVID are worse for those at the lower end of the economic spectrum, and we can see why when we look at the district's plan. They are the students that will be crammed 60 kids at a time onto our school buses twice a day. These students will suffer the brunt of a poor reopening policy more than others. Learning should be safe for them too. Students in more privileged positions will be driven, or they can drive themselves to school. They also won't be eating in the cafeteria. Reopening brick and mortar puts at-risk students at the most risk for their health. Many of these students are persons of color, certainly not all. However, I don't hear anybody speaking to this problem with our buses. It's unacceptable. Finally, on a very personal and intimate note, I belong to a group that no parent wants to join, parents who experienced the death of their child. When I hear some comments that flippantly disregard loss of life, it hits me in my gut. I guess for some reason that this is such a distant idea, it's inconceivable to parents, but it happens. Children can die. And their parents spend every birthday that never happened, every first day of school that never happens, grieving that loss. It never goes away. The choices you make as our school board will determine whether or not other parents join me in this awful group, not due to a medical issue or an accident, but due to poor public policy. It is unacceptable. Clearly, the lawsuits are waiting. I implore you to ask our district for a phased reopening model using science and CDC guidelines. I implore you to use 2020 solutions to a 2020 pandemic. It's not 1918. We can and we should do better by our kids and our parents. Our schools should go to a phased reopening. Thank you so much for the work you do. Good night.
Thank you, Ms. Severson. Have a good evening. Our next caller.
Caller is Miss Amy Spies.
Good evening, Ms. Spies.
Good evening. This is Amy Spees. I'm a Port Orange resident, and I teach in Daytona Beach. I want to first thank you for passing the calendar committee's recommendation, pushing back the start to the 31st. But with respect to the opening plans, I still have grave concerns regarding Volusia Live. Under no circumstances should an elementary teacher be expected to perform the duties of 2 full-time jobs simultaneously. This option might work for the most mature, responsible secondary students, but to expect 8- and 9-year-old students to sit at a screen for at least 6 hours a day, monitor their own activity, and complete any work with fidelity is just not possible. While school board meetings have been virtual, I have yet to observe a participant maintaining their cameras on for the duration. I don't see how we can expect elementary students to do that, which adults find too daunting. There is no way for an elementary teacher working alone to adequately teach, monitor, and engage students within a classroom, especially with new safety measures in place, and somehow ensure students sitting at home are participating and learning. Just look at all the challenges of getting folks on the calls tonight. Class activities and materials are vastly different in these 2 settings, and to think this can happen with just a few hours of training undermines the very nature of our profession. The face-to-face plan absolutely frightens me. While Home Depot and Walmart are able to implement the CDC guidelines, limit capacity, and have the resources to maintain clean environments, I have yet to see any evidence to ensure the safety of our students, faculty, and staff. Just the other night while walking in my neighborhood, like Karen Weinrich just mentioned, I ran into one of my students from last year, and the first thing he did was run to give me a giant hug and did not want to let go. I have socially distanced myself while out in public, but I cannot envision a classroom where that is the followed norm. While I applaud the efforts to ensure families are provided with options and choice for the plans, nowhere have I seen the same for staff and teachers. This must be addressed. Those who are willing and able to take the risks and return face-to-face should be able to do so. Those who have underlying conditions and want to continue to follow the CDC guidelines and the state's 3 Cs should be able to do so. Please require this consideration be added to the opening plans. And while face coverings have become a polarizing and politicized topic, I defer to science and evidence, which have clearly stated face coverings reduce the spread of COVID. The draft face covering policy provides choice, either masks or shields, and acknowledges those unique and minority exceptions. While there will still be a need to address all the procedures of PE, recess, lunch, and compliance, this policy is a move that will help protect anyone on a school campus. If we as a district can implement and enforce the school uniform policy, then surely we can do the same for face covering that has the potential to save lives. Thank you again for your continued dedication during these very difficult times.
Thank you. Next caller.
This is Miss Shannon Hauser. She's the one whose call dropped from the number 2949 number. Shannon Hauser.
Hauser, okay. Good evening, Ms. Hauser. Mrs. Hauser. Good evening, Ms. Hauser.
Hello?
Hello, Ms. Hauser. Please state your full name, and you have 3 minutes.
My name is Shannon Hauser, and I live in Deltona 32738. Thank you, Madam Chair, board members, faculty, staff, students, and families. I am a Volusia County teacher and part of Volusia Teachers for a Safe Reopening, a solutions-oriented group for responsible return. Our group strongly believes the best way to proceed forward is to ask, what is the most equitable way to educate our youth while keeping them, as well as faculty and staff, safe? We, like the Florida chapter of the American Academy of Pediatrics, strongly believe we should not return to brick and mortar until infection rates are 5% or lower for 14 consecutive days. We strongly support and thank you for the delayed start to the school year. We strongly believe teachers willing to serve the growing demand of Volusia Online should be guaranteed a position back at their home school post-COVID. We strongly support creative out-of-the-box learning options. However, while a true option for parents and students, Volusia Live in its current form does little to address the concerns of teachers. Therefore, we propose the following amendments for your considerations. 1. Consider reviewing and addressing the numerous privacy and safety concerns associated with Volusia Live for teachers, students, and parents. 2. Consider scheduling Volusia Live as a separate class period so teachers are able to focus on one platform at a time, not simultaneously or synchronously. 3, consider creating a cohort of virtual-only teachers, accommodating those who are immunocompromised, have underlying conditions, or have significant concerns teaching face-to-face. 4, consider providing Volusia Live teachers flexibility to teach live from their classroom and or home pending safety and health concerns. 5, consider ensuring that a teacher's planning time be deemed sacred to accommodate for lesson creation, planning, facilitation, and communication. And finally, any plan that is put forth must include supervisory options for pre-K through 6th grade, students at risk, and students with special learning needs, not because schools are babysitters, but because our society lags behind in child care options and schools have inherited that responsibility. This disproportionately affects working women like many societal failures often do. We will not be able to fix this overnight. Please do not mistake our questions or suggestions as adversarial in nature. We are simply on a search for clarity. Choice is essential in the array of options being provided to families, so please value the choice of teachers as well. I am confident the board will agree a little extra consideration to show you value your employees and care for those that may be the most vulnerable to the virus is a critical component of any responsible reopening plan. Thank you for your time and your considerations. Have a great evening.
Thank you, and you do the same. Next caller.
Up next is Ms. Kimberly Isabel.
Good evening, Mrs. Isabel. Good evening, Ms. Isabel.
Can you hear me?
I can hear you now, Ms. Isabel. Can you please state your complete name, and you have 3 minutes.
Yes. My name is Kimberly Isbell, and I am a Volusia County parent to a student that attends Port Orange Elementary. I wanted to voice some concerns regarding the Volusia Live option. So please, first of all, understand I am not advocating for a return to brick and mortar schools. I want to ask for consideration on some of the unknowns with Volusia Live, the impacts of teachers trying to cater to 2 different learning platforms at once, and the educational disruptions that I anticipate. I want my son to remain connected to his school, but I will not send him back under these conditions, under these circumstances. Volusia Live is currently my only potential alternative option. True online schools like Volusia Online Learning and K-12 do not keep my son connected to his school. They replace it. What if a teacher with a student or students participating in Volusia Live want to give a pop quiz? Do they email that to the Volusia Live students? Is there a separate platform that things like tests will be given on? And does this require teachers to create 2 models for all curriculum, adding to the huge workload they already have? If the teacher wants to use a visual that's not located where the camera for Volusia Live is directed, how do online students see it? Will the cameras be mobile or are they going to be mounted? I have a lot of concerns with this model. I put forth the idea of Volusia Live being the only option besides online schools like Volusia Online Learning. Teachers with this model could teach via the same video feed that is currently intended for Volusia Live, yet with all students attending virtually. Teachers would remain distanced from students, students from other students, and so on. Curriculum would be one format, minimizing teacher workload, as opposed to needing to create both hard copies of content and tests, etc., in online versions. Classes could be recorded for those who miss instruction due to technical difficulties, and importantly, there'd be no chaotic closing of schools due to an outbreak, no disruption to learning like last school year when COVID hit. These extreme circumstances require extreme solutions, and I don't feel that the current model of Volusia Live is extreme enough. I don't see it as a model conducive to disruption-free learning. Teachers, can see student cameras on online learning methods and can hide them from the view of other students, but with the proposed Volusia Live, that camera screen is going to be visible at all times. How do you discipline a student on Volusia Live if they're being disruptive to class when the teacher's back is turned? There are so many unknowns.
Ms. Isabel, thank you. You have exceeded your 3 minutes, and thank you so much.
Okay,
we have
thank
noted
you.
your concerns. Thank you. Have a great
Thank
evening.
you.
Next
You too.
caller.
Next up, we have Miss Helena Jones.
Good evening, Ms. Jones. Good evening, Mrs.
Hello?
Jones. Yes, good evening. Can you please state your name, and you have 3 minutes?
Yes, Helena Jones. I have 2 IB students, one with asthma, who will wanting to know if the Volusia Live is going to be an option for my IB students. I know that's not going to be addressed tonight. Does the district think that the cases will not increase with the return of kids after them being in quarantine for 5 months? I have 5 Volusia County students in all grade levels. What will the cases look like when they return? Tommy decides to wipe a booger on another child or spit water from the water fountain. Other students, like, what is the plan? What do we have in place? Not a thing, because the teachers cannot do a single thing. I am a parent, not a teacher, but at the same time, we have to have a plan in place. Kids think it's funny to wipe boogers and spit water and do all the things. It is what it is. What is the plan for our teachers? The well-being of the teachers who are pregnant, they have underlying health issues. Why not put the money into Volusia Live instead of putting it into PPE? Our school bus is going to be crowded because last year I complained about students sitting on laps, seats being overcrowded. Like, what's the plan? There's definitely not social distancing happening. I know I'm not going to get answers tonight, but I would like answers on all of these things because I did complain to the school board on the school buses being overcrowded and kids sitting on laps and standing. And I don't feel safe sending my children to school, and I don't feel like you guys should feel like it's okay to send our kids back to school, or teachers for that matter, because it's not safe right now. We have 10,000 plus cases on a minimum each day right now. Thank you for your time, and I hope my voice is heard and my children's voices are heard.
Thank you so much, Mrs. Jones.
Thank you, ma'am.
Have a good evening. Next caller.
Next up is Lisa Hutchinson.
Good evening, Mrs. Hutchinson. Good evening, Mrs. Hutchinson.
Hello, can you hear me?
Yes, ma'am, we sure can. Please state your name, and you have 3 minutes.
Hi, my name's Lisa Hutchinson, and I'm a veteran elementary teacher for Volusia County Schools for over 30 years. And I appreciate this opportunity. I know it's been a long night. I've been listening since the beginning, and I appreciate your time. A couple things, just for encouragement. For those of us who've been in teaching for a long time, I just want to encourage people to know that, we've been through HIV and AIDS in the 80s, bird flu in 97, SARS in 2002 to 2004, swine flu in 2009, bird flu in 2013, and of course we have MRSA and other infections. And we have survived all of this, so that's my encouragement. And how did we do it? We did it through common sense guidelines, washing our hands, making sure we don't sneeze on others and cough on others. So I encourage people to realize we will get through this. We're going to survive. With that being said, I understand that this is a serious health matter. But one thing that I didn't hear tonight, I've heard so many people talking about, we want to protect the kids, we want to protect the teachers. But I would like you to join with me for a minute for perspective. Here I am. I am 5 years old, and I'm finally get to go to big girl or big girl school. And I can't wait to start school. And I've been wondering what it's going to be like. So I'm asking you to look at it through the eyes of a child, because we know as adults what the health care situation is. But I'm looking at it through the psychological thought of a child, because I've been with them for so many years. So I'm all excited, and I get in my car, or I'm on the bus, and I'm going to school. But first of all, I arrive, and I've got to go through some kind of thing called a controlled checkpoint. And well, okay, I make it to go to class. Oh, good, I don't have a fever. I get to go. Now I get in my room and I'm so excited because I can't wait to see all the other kids, but yet I can't see all their faces. I can't necessarily see my teacher's face. And oh, what is this thing? I got to sit behind a cubicle. I thought I was going to get to be with some friends. I can't see smiles. I can't see hugs. And we all know, elementary teachers know, they're huggers and they want hugs and love, and we want to give it to them. But imagine, again, you're that child and you're sitting there going, I can't touch others. I'm in my room. I can't share my materials. I can't let them touch my stuff. Now, oh, it's time for recess. Oh, I can't wait to go out and play. How am I going to, what? I can't run and touch and play tag and all these things. How am I going to do that? What? That's not fun. Then, okay, well, we go back in. Okay, it's lunchtime. Oh, I can't wait to see what lunch is like. What? It's in a bag? I can't sit and talk to my friends. Okay, now I'm back to my room, back behind my desk and in a cubicle. It's my first day of kindergarten, and I wonder, is this what school's supposed to be like? I thought it was supposed to be fun. I didn't get to really make friends. I'm not really sure what's going on. Well, it's time to go home. I go back through a checkpoint, and I wonder if tomorrow will be different.
Ms. Hutchinson,
So
I hate to cut you off, but thank you, because you've exceeded your 3 minutes, but thank you so much, and we totally appreciate that.
Well, just consider it through the eyes of a kid. Thank you.
Thank you. Have a good evening.
You too.
Next caller.
We have Mr. Greg Gimbert on the line.
Good evening, Mr. Gimbert. You have, please state your full name, and you have 3 minutes. Mr. Gimbert? Good evening, Mr. Gimbert. Push *6. Mr. Gimbert? Ms. Schultz, can we come back to Mr. Gimbert?
Will do. I'm going to have Miss Christine Patterson. I'm sending her in right now.
Okay.
Here we go.
Good evening, Ms. Patterson. Good evening, Ms. Patterson.
Can you hear me?
Yes, Ms. Patterson, we can hear you. Please state your full name. You have 3 minutes.
Yes, Ms. Patterson. Sorry, let me turn off my computer. My name is Christine Patterson. I am a mom of 2 Volusia School children and former K-12 educator. My specialization is in exceptional student education and intervention. I think it's important that we be data-driven in our decisions, just like we are instructionally, but also with safety. I'd like to thank you for your online options. I'd urge you that the Volusia Online needs to be revamped. It does not include best online instructional practices or instructional design practices. I think that could be vastly improved, and I would like that noted in the plan. That being said, there's so many great things that have already been brought up. COVID rates are up. Somebody noted them at 18%. They were at 11% on Saturday, this past Saturday, and now they are, we have about 3,000 cases in Volusia County right now. I'd agree that we need to not go back to campus until there are 14 days with no new cases would be my standard. I also understand the position that you're in. The ambiguity of the state has left school boards in a precarious position, but this ambiguity does not negate your personal obligation to protect human life. This is a human rights issue. We heard from 3 board members last week who all expressed that schools are not safe to open. Thank you for those logical and compassionate comments. So because there's so much ambiguity, we get to interpret what these mandates are and take a stand like other counties have. In the words of Cedric Ingram, head of FEA, who has launched a lawsuit against the state along with the NAACP Open schools is a slogan, not a comprehensive plan. We cannot be reckless with our schools. We will not be a Petri dish. Thank you so much for your time. I appreciate how late it is and for all of your consideration in my words.
Thank you very much, Ms. Patterson. Have a good evening. Kelly, Ms. Schultz, our next caller.
Next caller is Miss Mary DePadova.
Good evening.
Kelly,
Good evening.
Hi, this is Mary DePadova.
Go ahead, Ms. Kipadova. You have 3 minutes.
Okay, I appreciate that you're tasked with a very important decision, one with many caveats. The later start date gives us time to reevaluate to further postpone face-to-face, as I believe we're in no way ready to go back. I ask that you look at option 2 again and the many implications that stem from asking teachers to teach on 2 platforms simultaneously. While parents see this as an option that looks promising to them, there are many problems, including privacy issues for everyone involved. I sincerely ask that you please revisit option 2 and consider having a dedicated teacher for every grade level, like in K2. It's not a viable option the way it's written. I want to return to school, but I need to know that we will all be safe when we go back. The Department of Health refused to say it's safe to reopen. For option 1, my big ask here is that masks be mandated in the classroom. Not that there is a choice between masks and face shields, because shields are only effective while also wearing a mask. The virus is airborne. Shields do not protect the other person from the droplets coming from the shield wearer. Their droplets will go over or under the face shield depending on the design of the shield. Teachers need mask wearing to be mandatory for us to feel safe. Those of us with compromised health, myself included, need masks and a guarantee of the 6 feet of distance while we're exposed to students and other adults at school sites. We're in the same room with the same students all day in elementary. Scientists say that the more minutes and hours in the same environment, the more virus you breathe in, the more it can build up and establish infection. We're in there for 6 hours. Let's not forget the adjoining rooms that share air ducts. If I choose to have my students wear masks, but my next door classroom does not, then we're exposed to those droplets as well. The previous meeting focused on student choice and parent choice. Educators would like to have a choice also, and not a choice to leave education, but to teach in a safe environment. Since the meeting last week, there's been a lot of teacher bashing on social media. We went very quickly from being put on a pedestal for what we do all day with children to being criticized for not wanting to be face-to-face. On the contrary, we very much want to teach face-to-face. This is why we love what we do. We just need to have safety measures in place for us as well as for our students. Please remember that we're educators. We can teach our students to wear masks. Also keep in mind that young children like to get close to their teacher, and sometimes it happens quickly. We can teach them to keep a safe distance, but if we're all wearing masks, we will be much safer when this happens. All it takes is one sneeze or cough that comes before they're ready to cover it. There's no taking that back. To address the mention about not being able to teach students unless they see our mouths, that is true some of the time, but it's not necessary for most of the day. If we have plexiglass during our small group time, we can wear shields during the moments we need to see mouth movement. Please mandate masks in the classroom. Thank you so much for your time and your consideration.
Thank you so much. Have a good evening.
Thank you too.
Ms. Schultz, we'll take 2 more calls and then we're going to take a break.
Okay, up next we have Ms. Catherine Crane.
Good evening, Mrs. Crane. Good evening, Ms. Crane. Good evening, Ms. Crane. You may have to push *6.
I just pressed it. Can you hear me now?
I can hear you now, Ms. Crane. Please state your full name and you have 3 minutes.
Thank you. My name is Catherine Crane. I'm from DeBerry. I'm speaking today as a Volusia County teacher and as a parent to 2 Volusia County high school students and 1 2020 graduate. Go Titans. As educators, we focus our practice on 2 important areas, and those would be standards and data. The standards we should be using are set by the CDC.
to guide our decision to open our schools. The guidelines are based on community transmission. I don't think I need to reiterate what everyone else has said for where we are. But what's interesting to me is upon reopening, after reduced community spread, the CDC recommends that when there is a single case of COVID, a single case confirmed, be it student or staff, that the school should dismiss students and most staff for 2 to 5 days. Are we prepared to do that for a single case? The disruption to learning would be exponential with each new case. And if we don't dismiss students and staff, we're ignoring the CDC guidelines. The fact that we don't meet the CDC guidelines at this point should be the end of the discussion, but since it isn't, let's look at data, because we love data. Educators love data. The school board loves data. You'll recall the controversial issue of school start times. The board ultimately made the decision based on the data that shifting start times would benefit students. Data drives decision making. The data shows that Florida and Volusia County have substantial community spread. The most recent study shows that teens and tweens have the highest transmission rate. That's our 4th grade students through our seniors. And while children younger than 10 have the lowest rate, researchers caution that that could change once schools reopen. We can look at Israel. Israel reopened schools when their transmission rate dropped, when it lowered only to close them again shortly afterward. Outbreaks occurred despite attempts to maintain social distancing and minimize mixing between students. Attempts to mitigate the virus were ineffective, the report stated, as it was impossible to hermetically seal classrooms from each other. Contact tracing found that infected teachers who taught multiple classes infected students in each class. As a result, hundreds of teachers and thousands of students were exposed to the virus and spread it to family members at home and beyond. This contributed to a resurgence of infections in the general Israeli population. One statistical sample used contact tracing, showed that 1/3 of those infected contracted the virus from an educational institution. Our acting superintendent stated that safety is our #1 priority. Based on the CDC guidelines and the data indicating the reopening of schools will lead to a subsequent increase in community spread, the data indicating high transmission by students aged 10 to 19, Volusia County Schools needs to continue with remote learning, the Volusia Live option for all students until we meet the CDC guidelines. To open brick and mortar schools at this time is inviting the virus into our classroom. Thank you so much for your time.
Thank you. Thank you. Have a good evening.
You too.
Ms. Schultz, next caller.
Okay, we are admitting Mr. Ben Howard into the meeting.
Good evening, Mr. Howard. Good evening, Mr. Howard.
Hello, good evening. My name's Ben Howard.
Thank you. You have 3 minutes. Go right ahead.
I'm a parent and a Volusia County teacher. My mother was a teacher. My mother-in-law is a teacher in Volusia County. Teaching is a part of who I am. Our children can't learn if they don't feel safe. It's Maslow's hierarchy of needs. That's a basic concept that all teachers learned. Students will not feel safe returning to buildings if their parents are worried about sending them. And they're not going to feel safe if their teachers are concerned about being in the classroom with them. And it will not be perceived as a safe environment by the child, which, according to Maslow, will negate any chance of learning gains occurring. Plans have been created, but those plans have not been tested or vetted. I would like to reiterate what my fellow CTE teacher, Scott, asked at about 8:50 p.m. tonight. Every single question he asked needs a verifiable data-backed answer before we implement any in-person options. We should be fully virtual until any of those models can be vetted. We should not be placing our children or our teachers at risk unless we have thoroughly vetted the plans and can provide data to show that it's safe and it's effective. I appreciate the difficult position that each of you are in. I don't envy your position. I just ask that you listen to the overwhelming amount of concern being voiced concerning the brick and mortar reopening. Approve the Volusia Live option and provide training to make it viable as an option for everyone on day one, so that if it's not safe to return, we don't need to. And add a condition to returning based on verifiable numbers, such as the 14 days under 5% that many have mentioned. Thank you.
Thank you, Mr. Howard. Have a good evening. Ms. Schultz, did Mr. Gimbert come back to the line?
Yes, we have him here. Would you like me to send him in now?
Yes, let's do Mr. Gimbert and then we'll go take a break.
Okay, Mr. Gimbert is in the meeting.
Good evening, Mr. Gimbert. Please state your full name and you have 3 minutes to address the board. Mr. Gimbert, push *6.
Can you guys hear me?
I can hear
Good
you now,
evening.
Mr. Gimbert. Yes, I can hear you. Can you state your full name? You have 3 minutes.
Hey, good evening. Greg Gimbert, parent. Thank you for having me. There's 2 obvious contingents: those who want the schools open, those who want to stay at arm's length. I think we wasted a tremendous amount of time trying to please both sides with the other one's choices. I'll ask you to consider that you split the baby. And for those who want to go back to school and those who want to teach back in school, you allow those people to do so without being encumbered by the desires of the other. Same thing for those who want the online option. Let's not have them encumbered by those concerns of those who are going back to brick and mortar. I think this third option with the video cameras, we've missed the time to implement that. What you need to do is you need to maintain the confidence of the parents, and I think that is in tremendous jeopardy. All we've heard is from teachers, and that's how it usually goes. But at this moment, you're realizing that the parents actually have the decision authority. If the parents decide not to invest their children back into your system, all this other stuff is for nothing. So I ask you to, with all due respect to the teachers, start thinking about your core customers while you still have a store. To that end, you need to open the brick and mortars, and you need to extend the offer to those teachers who are physically capable and mentally ready to do so. We cannot have teachers going in with a grudge. We can't have them bringing in the fear that so many have spoken of. Those teachers need to be teaching virtual. Now, how do we give those virtual teachers jobs? You have to have parents with confidence in your virtual offering. And between its short tenure, last year's performance, and its homegrown contents, I think you are lacking a lot of trust. I've asked for months that we focus on reforming, restoring, and improving that online option, and we've been in a quagmire by the teachers union, haven't even been able to address that. I don't want to run out of time, so I'll get right to the point. We're under an emergency situation, and you need to cancel the teachers union contract. You need to offer them all $1,000 a week for the ones that are coming back willing to work a full week's pay. This is an emergency situation. Once it's over, we can go back to the normal order of business. But right now, students' lives will not go on hold, and for all the teachers to feel safe. We need to stop trying to please one side with the other's choices and move on while you still have customers. Thank you for the opportunity to participate.
Thank you, Mr. Gimbert. Have a good evening. Colleagues, we're going to take, it is now 10:15. We will take a 20-minute break and we will reconvene at 10:35. Ms. Cuthbert, Mr. Persis, are you both ready? I can see you. I see you
I'm
mute.
sorry. I was trying to look up the latest results from today, the positive tests from today.
Yeah,
I didn't get a chance to look.
Yeah, we're about 12.2%. I looked that up a little earlier. Okay, I see Mr. Persis. Okay, thank you. We're going to resume our meeting. Ms. Schultz, the next caller, please.
We have Ms. Kelly Cahill, who dropped off earlier.
Okay.
And I'm going to, sorry, she's entering the meeting right now.
Okay. Good evening, Mrs. Cahill. Ms. Cahill? Good evening, Ms. Cahill. You may have to push *6. Ms. Cahill? Ms. Schultz, can we go to the next call and come back to Ms. Cahill?
Okay, we have 3 callers waiting in the lobby who do not have names attached. I'm going to let this one in. The last 4 digits are 6671.
6671.
6771.
Okay. Good evening. Good evening. Good evening. Good evening. You want to go to the, can you push *6, caller?
I have Miss Jane Corlett on the line now. Her call got disconnected earlier.
Yes, I have her down. Okay, thank you.
Okay. Can you guys hear me?
Can you hear me?
Yes, good evening, Ms. Corlett.
Okay.
Yes. Please state your full name and you have 3 minutes.
Sure. Jane Corlett. I'm from DeLand and a teacher. I appreciate the opportunity to speak as well as the calendar change. We as educators have spent our lives doing it for the kids. We've sacrificed pay our families' needs, money from our own pockets, for supplies and our health. This is what people call good teaching. And these same people say that's what we signed up for. Teaching has changed radically from what it was when most of the adults and community members went to school. We now have to face and train as best we can for active shooters who may breach our campuses. And now we're being asked to hope that in-class instruction won't give our students, faculty, staff, and community this deadly virus. That is not what we signed up for. Schools are mostly collaborative than the old days. However, the CDC guidelines would end this. We can't work in groups. We can't have one-on-one for students with paras and teachers. Masks, shields, partitions, 6 feet division, constant cleaning. That's not brick and mortar. It's distance learning. Unfortunately, with the choices at hand, nothing will be perfect and fit for all of our learners. We must select what is the most safe and doable, as our very lives depend on this. It is not the governor or the government that makes this serious decision. It's you, our team Volusia. We beseech you, before you make possibly a disastrous choice, that you believe in the science that's before you. And please do what you signed up for. Thank you.
Thank you. Our next caller.
We have Miss Cindy Rosso, whose call also got dropped earlier. Miss Rosso? Miss Rosso?
Hello, my name is Cindy Rosso, and I live in DeLand and teach at DeLand High School. Thank you, Madam Chair, Superintendent, and school board members for listening to all of us. Thank you for the work you have done on trying to satisfy all the stakeholders with the 3 options. I've heard several of you express your concern of us going back to brick and mortar, and I agree. It is a fearful time. I have taught in the Volusia County school system for 35 years and have never felt more nervous to start back to school. I want to address the safety protocols in place for students and staff that have either been exposed to the virus or tested positive for the virus. I found out July 1st through some pre-op testing that I tested positive for the virus. My surgery was postponed and now has been canceled because of the amount of time it has taken for me to get 2 negative tests. I fortunately had no symptoms the entire 14 days that I self-quarantined. I took a nasal swab test on July 16th and was told that it would take up to 7 days to get results. So I am still quarantined for another 7 days. So had I been in school, I would be out for 21 days so far. But the clinic I went to is not getting results back in 7 days. No, it's more like 14 days. So now I'm up to 28 days of self-quarantine, having no symptoms, but needing and wanting proof that I am negative. So I would have to have a sub for 28 days in my class, or a student would miss 28 days of my class. To me, that is too much. My fear is, as some of you have shared, is that we open brick and mortar and within a month we shut down again due to student and staff population decline. I want to be back with my students. I want to see more than just their eyes over masks. I want to give high fives and knuckle bumps and hugs to those who do well in class or disappointed. I want students to work in groups to grow their socialization skills. I want them to discuss and challenge each other's thoughts and debates. I want to see them laugh and sing with their peers. I want them to be kids. I don't think pushing back the start date will do anything more than delay the inevitable. I believe we need to revisit the remote learning that was done last 9 weeks. I believe we can do it better now. We have gotten the bugs out of the system, and I think that we can deliver safe and rigorous lessons through remote learning. We've had more time to design our own lessons instead of depending on Edgenuity or other programs. I believe remote learning will give us more time to allow the positivity rate to go down so we can safely open schools and never look back. It will allow all stakeholders, parents, students, and staff to feel safe coming to school again. Thank you for your consideration and for your compassion.
Thank you so much. Next caller.
Ms. Wright, we have 2 callers left in the lobby. We don't have names attached to either one.
Okay.
Would you like me to
Yes, ma'am.
send them in? Should I send them in?
Yes, ma'am.
Okay. There we go. This number ends with 2604.
Good evening, caller. Please push *6. State your full name. Good evening. Good evening, caller. Please push *6.
Can you hear me?
Yes, please state your full name. You have 3 minutes.
Hey, I'm sorry. This is Kelly Cahill. I was having trouble getting connected to you guys multiple times. I was calling real quick. One thing, and the last caller just mentioned this. I was talking about the COVID testing. The representative from the healthcare department last week had mentioned that if anybody has to go get tested, that it only requires 3 days to get results back. But I wanted to confirm that my family is going on day 17 tomorrow, that we are still waiting on test results back. And I didn't know, thinking about how that would affect students in school, if they have to go that long without results, how far are they going to fall behind? Or if you have a teacher who is waiting that long to get results, then let's say they get tested positive and have to be out even longer, who's going to pay for all of that time off and who's going to be there to take over their class? So just something to consider, that it's not 3 to 5 days. Like I said, tomorrow we'll be up to day 17 still waiting. In regards, talking about the 3 options that are open, I had a question for the live. Being the distant learning that my children went through, or all of our children went through at the end of last year, I know it was difficult for them to concentrate or learn or follow. And as a parent, we are not taught to teach or how to teach our children. We try our best. I was in constant communication with teachers, having my older child call to speak to the teacher to ask for help, but it's still hard. And so I'm just wondering why with the live, they're only allowing kindergarten through 2nd grade to have that option to have a teacher just for them, compared to 3rd through 12th grade, they will have a live teacher, but that teacher is responsible for each child that's going to be at home along with their regular class. I know there's a lot of teachers who are concerned about going back, and we have options for our children, but not very many options for our teachers. And I feel like it's either they don't return for their safety, or they fear going back and have to be concerned with each and every day what they get or what they could bring home to their family. So why not open up that option to allow teachers to either return to school or open up all grade levels to have the live with an actual teacher there. And then those teachers can be at home teaching safely and comfortably. Our children are at home for those who choose to keep their children home, but they're still having an actual teacher interacting, teaching them, so that they can learn better than what they did with the distant learning, where there was really truly no teacher involvement. It was them teaching themselves, excuse me, or the parent trying to teach them. So if you guys would consider, if these 3 options are the only 3 and live does go through, opening up that for all children so that each of our children get that opportunity to have a teacher face-to-face, no distraction. So just throwing that out there, if you guys could consider that. And
Thank
that's
you so
all I
much.
have to say.
Thank you so much, Ms. Cahill.
And take care.
Thank you. You do the same. Next caller.
Okay, we have Miss Jan Bukowski. She also had a dropped call earlier.
Okay. Good evening, Mrs. Trakowski. Good evening, Mrs.
Oh, goodness gracious. Good evening. This is
Can you
Janet
turn down?
Sokolowski.
Can you turn your background noise down for me, please, ma'am?
I don't have any background noise in the background.
Oh, okay, I was hearing feedback, but that's okay. Okay, go ahead. State your full name, and you have 3 minutes.
All right. Well, thank you again for all of your hard work at this time. I do appreciate it. My name is Jenna Sokolowski. I do reside in DeBarry. I've been a Volusia County teacher for over 23 years. And the reason for my call is I am very, very concerned about returning to a brick and mortar school setting at this time. Currently, the spread of the virus is increasing, and in the current environment, containing the virus in a school will be impossible. Guidelines set by the CDC on how to reopen schools have been completely dismissed. With such large class sizes, social distancing will be impossible. Social distancing, the prime mitigator of an outbreak, will be impossible. There's no way to ensure the safety of the children, to ensure the safety of the staff, to ensure the safety of our loved ones. Reopening will directly cause death. I fear for my own life, and so do countless other teachers. The beginning of this meeting was taken up discussing policy regarding masks. It's been stated that handling masks should not be a discipline issue, but there will be those students that are defiant. There seems to be no clear procedure on how to deal with students who dismiss the severity of the virus. Will there be a location in the school to contain students who do not wear masks? If we can't even come to a solid conclusion regarding masks, a relatively simple measure, how will we handle inevitable outbreaks? Furthermore, there has been no talking of testing or temperature checks or any other fundamental procedures to mitigate the virus. We know individuals who come into contact with others with the virus should be quarantined for 14 days. Has there been any discussion on this measure of protection, or will we ignore this too? Without a doubt, there will be parents who send children to school who have been in contact with the virus. And this assumption, coupled with the lack of safety measures, leads me to conclude that the virus will spread and we will only be able to ignore it for so long. If we reopen with face-to-face instruction, we will eventually be forced to shut down schools, causing even greater disruption to the learning process. What I'm asking is just to please consider implementing online learning for at least the first semester of the school time. And I really appreciate all of your hard work, and hopefully we can come back to some type of normalcy in the future.
Thank you so much. Thank you so much. Have a good evening.
Well, all right. You have a wonderful evening too. Thank you so much. Bye-bye.
Yes, ma'am. Mrs. Schultz, do we have any more callers?
We have one other caller. The last four digits are 6318.
Thank you. Good evening, caller. Good evening, caller. Good
Hi,
evening,
can you
caller.
hear me?
Yes, I can hear you. Thank you.
Hi,
Please
my
state
name
your
is
full
Rachel
name.
Bogdanoff.
Go right ahead.
Okay. My name is Rachel Bogdanoff. I graduated from the IB program at Spruce Creek High School, and I returned to Volusia County, where I've been teaching science for 13 years. I also spent part of this summer becoming a certified COVID contact tracer through Johns Hopkins. So I can actually say that brick and mortar, as proposed, does not meet federal or CDC guidelines, and it will not be possible without massive overhauls of day-to-day operations. So I'll say it. Volusia County schools, our children and adults will be infected. We've already seen it in VPK programs and summer football camps. How will this district, more importantly, how will you respond to serious illness or death in our academic community? Thus far, we haven't seen any concrete details addressing how schools will decide to close and or reopen after exposure, what quarantine protocols will look like, or what grief support will be provided when we're forced to deal with the more devastating but foreseeable outcomes. We all agree that getting back to school is extraordinarily beneficial to the mental health of our students, but the loss of a classmate or a teacher would be far more detrimental to our students' social and emotional development than one extra semester online. And Mrs. Haynes, I listened to you repeat over and over that you don't want to give kids consequences for not wearing a mask. But with all due respect, I think you're missing the point. We wear masks to prevent the ultimate consequence, severe illness or death. This is a pandemic, and without masks, students and teachers will spread the virus just like we've seen in every other aspect of society. Assigning a consequence for noncompliance is a necessary evil. It will help reinforce that this is an essential line of defense. I was recently struck by an account of Winston Churchill's leadership during World War II. It was noted that the German air raids on Great Britain generated a paradox for the British people, and one that resonates as a stark reality for our school board. The odds that any one person or child would die on any one night were extremely slim, but the odds that someone somewhere in Britain would die were 100%. Yes, the risk that any one student or one teacher will get seriously ill or die from COVID are extremely low, but the odds that someone in Volusia County schools will be hospitalized or even die are 100%. For great leaders like Churchill, these odds were not acceptable. So I ask you, are you ready to accept responsibility? And lastly, Dr. Balgobin stated option one, brick and mortar, is a non-negotiable tonight. But we already know that there are districts in the state who refuse to put our community at risk. You have the same opportunity to do so. Stand up for our teachers, our bus drivers, our counselors, our cafeteria workers, and our administrators. Stand up for our students, and stand up for all the parents, grandparents, and family members in this community who will be waiting at home. And if you're not prepared to stand up for us, then start preparing to stand in for us when we can no longer come to school. Thank you.
Thank you. Mrs. Schultz, do we have any more callers?
We have a number, last four digits. We tried earlier and got lost. It's 6771. If you want to try it again, I can let them in.
We'll try it again. Yes, ma'am.
Okay, here we go.
Okay, they're in.
Good evening. Please state your name, and you have 3 minutes to address the board.
Good evening. My name is Cassandra Ashby. I'm a Port Orange teacher, and I'm also a Port Orange mom. I just want to say I am truly honored to be entrusted to not only educate, but to care for my students each and every day. But I will tell you, it can be difficult, not for the reasons that you might assume. It was challenging this year, looking into my students' eyes and telling them that everything was okay when the fire alarm went off. And we didn't know if it was going to be an actual fire or a shooter this time. Luckily, it was neither, and a simple hug seemed to reassure my student. It was difficult this year having to tell my students we can no longer high five or fist bump to congratulate each other. But of course, then my students high fived each other the moment they stepped out of my classroom. It was difficult this year when I had to tell 27 14-year-olds to squeeze together onto a nasty classroom floor in my hard corner when I knew that we should be socially distant. This was just 2 days before the statewide shutdown. It was difficult this year, only getting to wave to my 8th graders from the sidewalk as we sent them off to high school. But I am not even able to mentally prepare myself for teaching this upcoming school year. I know I will not be able to contain my worry every time a classroom seat is empty. I will not be able to reassure my students when one of their classmates tests positive and now we all have to go get swabbed. The math teacher in me should be reassured that I will hopefully never have to at least hear the retort, when am I ever going to use algebra in the real world? We have all had our fair share of exponential functions, R-scores, data displays, and other statistics these past 5 months. Yet, I never thought my beloved subject of mathematics would be used for people to become so cold and unsympathetic. I keep seeing memes all over social media proclaiming kids need to get back to school. This disease has a current survival rate of 99.96 of the population. In fact, if we really look, the survival rate is actually much worse. The death rate is 4% of those who are infected. But let's go with this 1% survival rate, as people have said. Okay? You had a caller call in earlier and said that. So let's say for the sake of this math lesson, we'll use 99.9% of the population. And earlier you said that we have 63,000 students in Volusia County schools. So that means that, yes, 62,975 students will survive. That means that 25 children will not survive. 25 children. I will not mentally prepare myself for that. I cannot believe we're being asked to. I'm sorry, that's all I have to say.
Thank you so much. Have a good evening.
Good evening.
Mrs. Schultz, do we have anyone else?
We do.
We
have Miss Kelly Shahatley. Kelly Shahatley. Not sure if I'm saying your last name right.
Good evening, Mrs. Hatley.
Yes. Hello.
Good evening. Can you state your full name? And you have 3 minutes. Thank you.
Yes, good evening. Thank you so much. My name is Kelly Shahatley, and I just first would like to thank Madam Chair and the entire board for just your patience and hearing everyone's voices this evening. I really appreciate the level of concern that you're taking with this whole situation. I have not heard anyone bring up the upcoming class of 2021, the senior grads. First of all, not only am I a teacher, I teach in an elementary school setting in a gifted combination class. I'll get to that in a minute, but I also am a parent of an upcoming graduating senior for the class of 2021 in the IB program. I'm sorry, I'm super nervous. My concern is that when we're looking at the standards for graduation and the requirements that they need to meet, we're not only looking here at our local school or our state requirements for graduation, we're looking at national for programs like ACE, which I believe this is their very first graduating year of the ACE program coming out of Seabreeze High School, if I'm correct, and as well as IB. these children have international components to their degrees. So we need to be, when we think about the dates, yes, as a teacher, I love more time, but I also, if we're going back to brick and mortar, if we're going to do this, we need to be mindful, or whether we do it in virtual, we need to be mindful of those dates for these graduating seniors of 2021. My other concern then as a classroom teacher, also, the AP exams as well, for the students who are working in AP programs could come into, we had a big problem this year with many of those children having to retake exams and do them online at home. Please be mindful of those upcoming seniors. Then as a classroom teacher, my concern, of course, is the hybrid Volusia virtual, or Volusia Live. Volusia Live. So my concern primarily with that is that there are very big media privacy rights issues that could potentially come up. I know just to take a photograph of the children in a classroom setting, if I go just on a special event or things like this, and I want to even take their photo, I have to have special permission. We could potentially be being recorded. It would put our children, our faculty, even our administrators at risk for privacy and undue criticism. I worry primarily about the children in that setting, because there are many parents out there who don't even want them. They will only allow a yearbook picture, if that. So I think that program needs to be revamped and rethought out so that everyone's protected.
Thank you. You've surpassed your 3 minutes, but thank you. We duly noted your comments.
Thank you so much for you. Thank you.
Thank you. Have a good evening. You too. Mrs. Schultz, do we have any more callers in the waiting room?
No one else in the lobby right now.
All righty. Thank you. The lobby is now closed. So colleagues, we've heard our comments. We've heard the presentation. Dr. Bagum, is there anything you want to say before we start our conversation?
Yes, I do.
Okay.
Madam Chair, board members, I just want to take an opportunity to really say thank you to each and every one of you. You know, prior to even many of our districts considering a delayed start to the upcoming school year, this district here and our chair and our board members had already voiced that concern. It really shows the level of compassion that you have for our community and understanding. And as a professional to professionals, I want you to know that that's greatly appreciated, and I have a tremendous level of respect for that, your eagerness and your proactiveness and really looking at the needs of our community and our teachers and students and staff. That's first and foremost. Second of all, I did mention previously that we have 3 options. 2 of them we do not need to send for approval to DOE because they are approved models, which is our traditional and the Volusia Online. The model that we're seeking for approval tonight is the Volusia Live model. As I've shared before, we will have several orientation sessions starting Thursday, Friday, and Monday in the AM and PM for our parents, for depending on if they have their children at the elementary, middle, or high school, where they can log in to those sessions, ask as many questions as they would like, and we will review all the resources on the website for our parents so that they can make the most informed decisions. Also, in addition to numbers, I want to share this with you because it's important to understand this. As we send the survey out to determine what option or preferential option our parents have for these models, the 3 that we have, what we have been seeing from nearby districts so far is that the numbers have been coming in, and there are approximately about 60% of our parents from nearby districts that are choosing either that innovative model or their online model. and then the rest a brick and traditional setting. What I'm trying to say here is that if in the past we had a traditional school with a capacity of 1,000 students, we have to take into consideration that with having 2 additional models here, that the numbers will be severely reduced for the traditional settings. So I just wanted to kind of point that out. And as I've shared before, there are several action steps that will be taking place if this model is approved tonight for submission to DOE, which will encompass the entire, our leadership teams at the school and our community being involved in the planning for our reopening. So I want to thank everyone again here tonight and for having a great and board that is proactive in their thinking and their approach. Truly appreciate it. Thank you.
Thank you, Dr. Balgobin. And so I just want to reiterate, our vote is for option 2. And I've heard the public as they've been concerned to tell us what our jobs are as looking to options 1, 2, and 3, but our job is to look at option 2. 1 and 3 are already dictated by the state. If they, I know one call alluded to Miami, Broward, and Palm Beach County. All of them too have a brick and mortar, face-to-face, and an innovative model. Due to their numbers and their health departments, they are able to go virtual. Volusia, even if it was our desire, could not go virtual because we do not have the technology. We're not a one-to-one district. Currently, I was asked why, we need to spend our energy, time, and money into that. We've looked at purchasing all of the necessary equipment so that we could be one-to-one this year. And based on what, and I didn't go off just our CIO, Clint's word, just from working in higher education, we cannot get those items, and we're looking at about 35 to 40,000 devices. We cannot receive them before April. And so I know I hear everyone's concern. That was why when we initially started down this road, we talked about a delayed start. And so I'll come back to that because this is really addressing number 1. But let's deal with option number 2, and then we can come back to 1 and 3. But as it relates to what we have to submit to the state, it is option 2. So I would like to open up the floor at this time. Who would like to go first? Go ahead, Mr. Persis.
Yeah, I move approval of option 2, Madam Chair.
Is there a second? He still have a motion on the floor. You can second and you still go into discussion. So is there no second for option 2?
I'll second option 2.
Motion has been properly moved and second, and now we can open this up for discussion. Who would like to go first as far as discussion? Go right ahead.
And so option 2, and I am in favor of submitting this to the state. I think there, as mentioned before, there are a lot of details that need to be worked out. I don't think anybody disagrees with that. As our parents look to option 2, and I've had the pleasure of speaking to a lot of parents because this has been their greatest question. It's not for everybody, even though it sounds really good. I can't personally imagine a first grader spending 6 hours a day, 5 days a week behind a computer screen. That first grader will still require quite a bit of parental involvement despite the best platform that may exist. And so I have concerns with that. I think, as I said the last time, I think that it is more work. And so I am more so in favor to the greatest extent possible if we could bunch the students up so that a teacher preferably may not be doing both. Now, I realize that some folks like the idea of their child being able to go to and from school if they opted to sort of interchangeably. And I think there may be room and there may be teachers who would be willing to take that challenge. However, I truly don't believe that it is everyone who can reach that aha moment in the classroom and on the computer at the same time, to not be able to see when the child, and again, I'm not a teacher, so I'm speaking anecdotally, when a child finally gets it. And so I think that's something we need to consider in the plans of what we bring forth to the state. Again, I think there's a lot of work to be done. Orange County's plan just got approved. They have a similar model. Seminole County's plan was approved. They have a similar model. Orange County's plan was approved, and Osceola was as well. So I think that as we look at all of these wonderful considerations that everybody has brought up, 3 districts ahead of us that we've worked very closely with have submitted a very like plan to the Florida Department of Education and have gotten that approval. Again, there's a lot of work to do with it, and I'm pretty sure that with the help of Miss Albert, our teachers, our staff, district staff, everybody, it's going to take everybody to make it work. And, school as we know it is different, and that's a very hard reality to swallow. The fact that 60% of Orange County's parents have opted for that somewhat blended model, that tells us that this is not the school of last year or earlier this year, arguably. This is a new day. And so we're all being forced to create a new path, and that's all I have. So I'm supportive of this. I just think that there's a lot of work to be done, and I do have a serious concern with the thought that everybody can do it, because I don't think it's everybody who can. So thank you. Your mic's off. So am I referencing teachers? I mean, yes, that's what I mean. So some parents are under the impression that every teacher is going to participate. So if their child, let's say, is part of the STEM Academy at Galaxy, they're imagining that that teacher is going to be automatically teaching both platforms. And that may not be the case. And I think that's what we have to look at is, how do we do that? Again, there's a lot of questions, but is every, like was mentioned with CTE, there is a curriculum frameworks that's brought from the state for that course. And that may require hands-on coursework that can't be accomplished virtually. And so the curriculum framework for that course may not be able to be accomplished without having maybe the opportunity for the student to come to school to do a lab day. That's, because there are things. And so I think there's a lot to be worked out, but, like I said, I'm in favor of submitting it. I just have serious concerns with some of those details, which, Dr. Balgobin has assured us that she will be working on. So that's all I have. Thank you.
I have a question for Mr. Colon. So what would you suggest?
So I think that if I were to look at, for example, Timbercrest, I think Ms. Kuches, who's an amazing teacher, may actually say, you know what, I want to take on the virtual school. And if the enrollment is enough where that is possible, then that is, they still have a teacher. It's not the virtual online, so it's not the total virtual. And, that student may need that teacher to interact with them. And so that's kind of how I can envision it working. I don't think that every teacher is going to be able to keep their camera on, turn the microphone off, stand in front of the camera rather than walk around their room like they're used to. Is there going to be a kid that's going to sit there pointing the camera? How's that all going to work? I don't think a lot of that technology we're going to be able to source in the next 30 days other than what we have right now. And so despite good intention, I think that, there may be parents who want that direct teacher interaction and don't want just the online. but don't want to come to school either. And so then maybe they don't need that seat in that classroom with the teacher who's going to be, maybe they have no intention of sending their kid to school, but they wanted that live teacher. And having kids who have done virtual school, you know, there are some kids that need that redirect. They need that teacher to say, hey, did you get it? Because it's very easy on virtual school to move on to the next topic, whereas you may not have accomplished that or had somebody to say, hey, did you really get it, Ruben? So that's kind of what my thought process is on that.
Okay, so you actually just jumped back to elementary. I was asking because you first gave an example about middle school and CTE.
Right.
So how do you envision seeing that being taught? That's what I'm asking.
So if I am let's say the wood shop teacher at Deltona High, or an ag teacher, let's say it's an FFA student at Deltona High, you know, they have their academy where they do a lot of hands-on work. And so would that translate? I can't tell a parent that will necessarily translate without there being a separate lab where the student can come to school, maybe in a smaller group setting, to accomplish those labs, because that is part of the coursework. And so it may not be able to be accomplished that way because the student is at home. And so unless they have a farm at home that they can do the things with the animals and the food, and because we have the food and agriculture academy, it may not be possible. And so I don't want parents to think, and I think that's where we're challenged. I don't want parents to think that automatically I can pick option 2 and my kid could still participate in that academy when there's a lot of hands-on. And so it may require a lab day. So that's my thought on that.
Okay, I'm just trying to understand what you're saying. So, Dr. Balgobin, you know that I've called you and had several conversations about what Volusia Live would look like. I shared with you from day one, you know, my biggest concern was elementary. Now, keep in mind, I am the one person sitting on the board right now that has taught at all 3 levels. So I have actually been in the classroom. I've taught everything in elementary except for 4th grade. I've always laughed and said, possibly I need to go back and do that before I retire. Including I've taught self-contained pre-K speech and language. I've also taught at the middle school level, and I've also taught at the high school level. So with that being said, we had some great conversations, and I do think that there is some information out there that is not clear. And so if you don't mind, I'd like to make sure, and if I misspeak tonight based on the conversations we've had, I want you to clarify it or correct what I'm saying, all right? Because I do want parents to understand, and even teachers, because I've had a lot of conversations with them where they have called and asked me questions, and only thanks to the conversations we've had do I have a clearer outlook, I think, on this. So for parents that are listening tonight and teachers, for those of you that have children in pre-K through 2nd grade, the intent is to designate a single teacher on campus to teach pre-K through 2nd grade in a virtual live setting. Now, what you need to know is, and I agree with that decision, having taught those grade levels, it's a little hard to manage, especially at the beginning of the school year in the event we open brick and mortar, to manage 5-year-olds in a classroom or 4-year-olds or even 6-year-olds, and at the same time manage an online setting. So their intent is to designate a teacher to do those rooms. Now, that all does hinge on the sheer number of parents that select that choice. If we only have 1 parent or 2 parents at a school, say in kindergarten, that selects that choice, we can't actually designate a teacher. This summer, in our summer programs that are running virtually, for some of our reading and math camps, we have teachers that are teaching children from more than 1 school. There could be a teacher here in DeLand. She may be tied to Blue Lake, but she's teaching kids this summer from Blue Lake, Citrus Grove, Stark, and Woodward. Is that ideal? Absolutely not. So I do appreciate, Dr. Balgobin, that you're wanting to dedicate a teacher for pre-K through 2nd, and I understand that. You had to help me understand 3rd through 5th. because I wanted a designated teacher also to do virtual for 3rd through 5th. And this is what I've shared with teachers that have reached out to me. It's going to come down to the sheer numbers, okay? So and I'm going to do 2 scenarios. We could have, and I'll use one of my schools, we could have at Woodward that 26 4th graders choose to do Volusia Live, all right? Well, 26 is 4 over the class size amendment, which I know we do average now. And so we could designate a full-time 4th grade teacher to do that 22. What I would really want is I'd want them to do the 26, because to take 4 of them and just then hand them off to another teacher doesn't necessarily work. But at the same time, we could have Woodward and only 6 4th graders decide. Well, financially, we can't designate a single teacher for just 6 students for the day. So what I asked you, and if I'm wrong, please correct me, was that at that point, we would ask for which teacher would like to volunteer to take on those 4 4th graders whose parents want Volusia Live. Volusia Live meaning I'm at home, but I could return to brick and mortar at any point in time. I will tell you, if I were on that 4th grade team, I wouldn't have a problem volunteering for it. But even if someone else said that they wanted it and I said, okay, I'm taking the traditional. So ideally at that point, we would need to give that teacher 18 kids in front of him or her. Okay, I'm a team player. I'd say give me 2 extra out of their room, reduce their class, the students sitting in front of them some. And then what happens is, what if I have a kid that's out sick? Let my kid join that virtual piece, because we plan together. We know what our lessons are. We know what the standards are, because that's part of what we do in PLC. And so am I correct in how I'm looking at what 3rd through 5th grade will be? It could be a designated teacher if the numbers are there, but if there's only 4 numbers there, it may not be. And then we're going to ask first for a volunteer. Am I correct?
You are 100% correct, Ms. Haynes. As a matter of fact, that was the same conversation that I had today also with the team. And what I've shared with the team is that as soon as we receive those numbers on Tuesday, which is when we're hoping for the survey results to come back, that we would look at who is choosing what option for what schools. And then once we start having those workshops with our leadership teams for those schools and deciding on for each grade level how many students, how many teachers we have, and those conversations will begin. I know I've shared last week and a little bit this week that it's a very, very fluid model. But you've explained it in great detail, because it's going to take, we will need to look at the numbers, we would need to look at the skill set of the teacher, we would need to look at how many students per class and how we can make those adjustments. And the way you explain it, you're right on target, yes.
Okay, so now I'd like to talk about middle and high for just a moment, is
Yes,
that
ma'am.
okay?
Yes.
All right. So my understanding for middle and high, let's just say I'm teaching middle school and I'm teaching 7th grade math, all right? Or even pre-algebra, it doesn't matter which one. Maybe I have, a full schedule where I only teach 7th grade math for the day. And that does happen occasionally, but not always, all right? Now, if I'm at DeLand Middle and say we have, 57 7th graders that say we're going to stay home and do Volusia Live. And let's just say, it happens to be a group that they're all in 7th grade math. They're not in Algebra 1 yet or any of that. So with that 57, there's a possibility I could designate the teacher or one of the teachers that's teaching 7th grade math to have 2 class periods where they are only teaching virtual through Volusia live streamed with no kids in front of them. Now, once again, if I only have 6 7th graders, then we're going to be looking for a teacher that says, I'm willing to take on that task. It'll be 2nd period every day. And maybe my 2nd period class won't have as many students sitting in front of me, but the other, and that's my understanding of how high school would look also, Now, where we come into, where I think it gets a little interesting When we go into high school, every once in a while you hit a course that's unique. It may be a class for 11th graders, and there may only be one period of that class. And at that point in time, we could be looking at a teacher that has, 12 in front of her, 10 at home doing it. But to me, that is also no different than kind of what we're preparing them for college, and that's what we do even in college at times, is, there are professors that have X number in front of them or X number at home. Now, some of the misconceptions I've also heard is, and I've been reading, I just don't always respond, but I always go back to, if you're not sure what you're talking about, why don't you get your facts straight? So I've been reading and hearing that, we're going to install cameras in the ceilings and things like that. I've had long conversations with Clint and even with Caitlin and referred questions over to them, and they've been great at answering. And so I walked a few teachers through this today and explained to them that part of why we asked to purchase the additional laptops at the last board meeting is because we have teachers that don't have a camera on their laptop. I've referred questions to them to answer when teachers have said, but what if I'm using my laptop for this and all of that? What I need everyone to hear, parents, please listen right now if you're still with us. If your child is sitting in a classroom, the camera's not on them. If your child is at home participating through Volusia Live, the kids in the classroom are not seeing them. The camera is on the teacher. The teacher has control of the camera. Just as tonight, we have control of the camera, and at certain times, some of us turn the camera off for a few minutes. It's the same thing in the classroom. The teacher's going to have control of the camera. The teacher's going to be able to view the students that are at home. And that's even if you're a dedicated teacher and you're teaching an entire, fourth grade virtually and no one in front of you, or you're teaching 7th grade math or an IB class, you have control of the camera. It is on you so that the teachers at home can see you and what you're teaching. Now, is it a perfect world? No. Is it in some ways going steps back from where we have been? Absolutely. But we're going steps back from where we've been because, as even teachers have expressed tonight, cooperative groups are not really in play right now. My concern is, though, that there are some things that will not translate virtually. I have said all along, students need their textbooks in front of them. They need access. These are the questions I have asked, but I just want to cover the safety, because everybody keeps talking about the safety and talking about hacking. We have Microsoft Teams, which we've been using. We purchased the educational Zoom because we approved that. That one has all the enhanced safety features. And, just listening to people tonight, I want to hope that we can have all three options for all of our parents and children and teachers to make a choice. But at some point, if something goes wrong and we have to go virtually, everyone needs to know this is how we're going to do it. We're not going to do what we did last spring. Parents, I need you to hear me that what was put together last spring was a very short 1.5 week turnaround. It was not truly educational. We know we did not meet the needs of our children, although I have to give credit to some teachers out there that did. There were some kindergarten teachers from Reed Patillo Elementary that set up a schedule and they drove to their students' houses every day and taught them in the driveway. Hats off to those women, okay? I've heard you parents, I've heard grandparents, and I've heard community members when you reached out and you said to me, I've sent emails and I've never connected once with my teacher or my child's teachers. I've heard you. That's not going to happen ever again. All right? So we need an option like Volusia Live, because if we have to go back to virtual like we did last spring, we need to meet children's needs. Children need a teacher connecting with them, and teaching high quality lessons. Will it be to the level that we've had necessarily in the past? No, because I don't see a way to do it. I can't put science experiments in front of kids' hands or animals, as Mr. Cologne said. But I'm wanting everybody to have a clearer picture of that piece, because if you're choosing it though as a parent, you are going to be responsible for your child following the same daily schedule, whether they're at elementary, middle, or high. They have to sign in, that will be noted, attendance will be taken, and they have to do the work. That's part of what the state requires in the plan. So kids, especially my high schoolers that may still be up listening out there, there is no, if I don't do my work, I just continue to get the last grade that I received. You're going to have to do the work. And so that's part of why I'm in support of Volusia Live, because we need to have a plan in place to deliver high quality instruction, not what we did last spring. Am I correct?
Ms. Haynes, if I was grading you right now, you will get 100%. 100%.
I'm sure I left out some details of what people have asked me, but
your description clearly defines what we will be doing and what the plans entail and the fluidity of the model with Volusia Live. Yes.
Thank you, Mrs. Wright, for allowing me to have that time, and I will turn it over to whoever would like to go next.
Okay, I'm gonna come to Linda or Carl, but I have to ask a question, because how can we honestly tonight say if we have to go to a virtual model, we can do that? I just need somebody to tell me that. Because you said we can, but you said if we had to switch, we would. Please tell me how.
I'm not in support that we
No,
can't.
No, it's not about a supporting issue. I'm just saying when we make that statement and the expectation, if the governor said tomorrow, you can go fully virtual for the first 9 weeks, tell everybody that's listening how Volusia County is going to do that, because I want to know.
We can't. I have areas that have no internet access. And so I have watched on social media where people have said, well, even tonight, some of our speakers said, you just need to give them the technology and give them internet access. Here's the thing. I have an entire area in my district that it's not a matter of me purchasing internet access for them. Internet services do not exist. Now, the teachers in that area wrote me a beautiful letter earlier today and said to me, we are ready to go back. We know what the needs of our students are, and we know that their needs were not met last spring.
I get it, but that's still not the question, Ms. Haynes. I get that. My question is, if the governor said today, we go virtual, colleagues, can we tell our parents, our teachers, and our students, we have the capability of doing that? That's a yes or no answer.
No.
No.
Thank you.
No.
Okay. All right. So I don't want us to keep saying that, because we do not have the capability. That is our goal to get there.
Yes.
But even for the first 9 weeks, we as Volusia County do not have that capability.
Not right now. You're absolutely right.
And I don't care how much we would love to do it, how we try to do it, children would be greatly impacted because we cannot provide the service. Am I correct?
Yes.
If we're looking at our total number of students that we currently have enrolled in this district at this point in time, we do not have the technological capability at this point in time. We are planning for it, but we're not there yet.
And can I ask one other question? As we have our parents look at the various options, can we find out how many really do have technology?
Yes, ma'am. As a matter of fact, in the survey that will be going out, that will be one of the questions that we will be asking.
Thank you. Mr. Persis or Ms. Cuthbert?
I yield my time to Ms. Cuthbert right now, Madam Chair.
Thank you. Ms. Cuthbert?
Hi. I think everybody understands the education piece. And we all know, all educators know what their role is in the classroom, whether it's virtual or anything. But everything is what we're so used to, the normal classroom. So a lot of our questions would be, how do we go about the logistics of it? In reality, in the 50 minutes that we have in a secondary classroom, or even all day in an elementary classroom, how is it going to work? And so it's, for example, you have a high school teacher who teaches AP Calculus, might teach AP Stats, might teach geometry, might have 4 different preps that nobody else teaches, especially AP and IB classes, just like what Mrs. Haynes said, specialty classes. Their classes are going to be really stacked unless they're taking it Volusia online. So I'm a proponent of having another person in those classrooms. I don't think one teacher is going to survive teaching students in the classroom as well as addressing the needs of the students online, because they're going to ask questions. How will their questions be answered when the teacher is not really looking at the camera? I mean, it's hard enough for me to see my camera in front of me. I mean, I see all the little dots on the bottom and all the pictures. So I have to get up real close to see who's who and look at the little hand that might be coming up at that point. So the visuality of, or the visuals of it, the privacy issues, and the cleaning in between classes. There are a lot of practical things that we have to do, and we know what we need to do teaching, and I don't think anybody minds that whatsoever. It's how do we manage the intricacies of doing all the extra, and usually in a normal day that is so overloaded with things to do. I mean, I would sit at my computer and eat my lunch and answer emails. How do we address what the office is sending us, or taking attendance when we have spent the last 5, and how do we even go to the bathroom when we have to clean those desks by the next class that comes in? So these are all the issues, I think, that a lot of the concerns were tonight. So if we have people dedicated and assigned, that whether it's a para, whether it's a bus driver that's reassigned because there aren't as many kids riding the bus, we need to really look, and this is very hard to do, but we have to look at who we have employed and redeploy them where they're needed. And that's why we have to do all of this together, because looking at it from a distance, looking at it in the future, it seems insurmountable, because we already know how difficult it is to teach in a classroom. And it's and it's exhausting and it's tiring. And then you add the coronavirus on top of it, you add keeping an eye on the masks, and there's still going to be kids messing with each other. I can't use the B word, the bullying, but they're going to still mess with each other. They're still going to taunt each other. They're still going to want to look at each other's papers. They're still going to think it's silly. So I think it's the actual doing it. So the trainings you're talking about, those issues have to be addressed. How do we change our mindset and add all this more to the classroom? The cleaning, the privacy, worried who's watching them. The 6 hours of a student sitting and just watching what's going on, they're going to fall asleep. If we have 2 in a classroom, we can get things rolling. The cleaning in between and the asking of questions. These are all very practical, realistic, logistical questions that definitely need to be addressed. Now, do those questions have to be answered when we send when we send this to the state? Or do we work this out afterwards? Are they feasible to be worked out? I can't hear you.
No,
Oh, there
I'm
you
sorry. I was on mute.
Oh, it's
No,
okay.
those logistical questions do not need to be answered as the plan is submitted to the state. There are 7 assurances that we have to ensure that are in place as the plan is submitted to the state. And basically, they're more on the instructional side of the house. So those logistical questions, as you shared, you're right. You know, those are the items that we need to work out, and that is why we will be scheduling several workshops, several of them, with our school-based team and our district folks to be there with them and work out the schedules for the transition, the arrival, the dismissal, looking at the numbers of students that will be in band, looking at the numbers of students that will be at a particular grade level, dividing that up by teachers, looking at the teachers' roster, looking at their needs, what their needs are. So all those logistical questions, we just did not want to be one of those districts to give the plan to the administrators and say, work it out. We want to be hand in hand with them in those workshops, working out all the details of the plan. The first step, obviously, will be to get those numbers from the survey so that we can start planning accordingly. But the details of the plan will be worked out with our district folks working side by side with our school-based teams.
Okay, can you assure us as board members that if a teacher needs an extra person in the classroom, because that person may have 4 online and then 12 in a classroom, hopefully it's not more than 10, but 10 in the classroom, or even 5 and 10, or 10 and 10, that's an awful lot to handle, plus the subject area. And somebody brought up tonight, what about the testing? How do you, I mean, it's to me, as an old school teacher, it's very difficult to picture a lot of this. So I strongly suggest we do some role playing, that we, during that training, teachers go in and say, okay, this is what I'm going to do, and do a play act. I mean, Jill Cicerelli is a drama teacher at Spruce Creek High School, bless her heart. She'd be great in orchestrating role playing to see if it's going to work, so you can work out the kinks before the kids come in the classroom. Because I think that's where the fear is. It's where the mistakes we're going to be making in front of everybody. And especially if parents are watching online too. That's difficult, especially when you do something for the very first time.
I agree with you, Ms. Cuthbert. That would be one of the items, one of the many items that we'll be looking at. Additionally, at the school level, we will have support personnel at each school level. And with decreased numbers that we're anticipating of students that will be attending the traditional setting, we will still have those support personnel. So as you've stated before, we'll be looking to see how those support personnel can assist with the endeavor that we will have to ensure that's taking place in the traditional setting, along with district folks.
Yeah, and you know, it's, and I think if we network with, like with Timbercrest, with Spruce Creek Elementary, and Chisholm with Pearson Elementary, Creekside Middle with Deltona Middle, we can all network what worked at your school that didn't work at my school, because we have Pine Ridge and Atlantic designed very similarly. Deltona High School and middle school are a lot like New Smyrna Middle. So we have a lot of those skills, those schools built in the same way. So if those principals, administration, or teachers get together based on similar facilities, that would be a big help as well. And let's not, we talked about our bus drivers and we talked about our schoolway cafe. Let's not forget our paras, because they too have to work very closely with their students, and I'm concerned about their welfare as well. But yes, I think, and that's the only thing about option 2, about making sure our teachers have assistance, the privacy issues, and all the extra, the cleaning, the masks, the discipline. That's why if they have to break down a class and have to deal with someone who's throwing a fit because of a mask, even though the person is gifted or whatever. I know my husband just came in and did that to me too, Carl Persis. It's important that we address those issues ahead of time. How do we handle it? That way we go to that particular way to handle it and not have to dwell on it. Get it done and get it out of the way so we can get back to what we know.
Point well taken.
Okay, thank you, Madam Chair.
Thank you. I'm not going to belabor because most of my colleagues, that was my concern. I shared that with you because many of our teachers are really novice. They have not taught in this environment. I will say this again, the more they become comfortable, it is very easy. There's really no more risk dealing with privacy in this environment. But again, if you don't know, then you don't know. And so that's your assumption. But even in a virtual environment, when they taught on Teams, or if they teach on Zoom, any of them can be hacked. It don't have to be a person in your home. It could be somebody in a whole nother state. Hacking is something we have to deal with. So as it relates to privacy issues, there are really no privacy issues other than if somebody externally hack into our system or hack into the Teams system, Microsoft system, or Zoom, and Zoom has been hacked. All of them have been hacked over the last couple of months because of the amount of people using them. But I do have a concern having teachers teach on both levels, both platforms, because they're not comfortable and they haven't done that. And so we do have to find a way to resolve that issue. I'm not sure if assistance would be good in that, because again, if we're using pairs and we're talking about instructional, that's something totally different. So again, once we get the numbers, then we can make some informed decisions. But I think for tonight, our discussion is, do we want to move forward with this? I know we have a motion on the floor and a second. Any more discussion? Because I think we do need to touch topic, both 1 and 3. Any more discussion on this item, colleagues? Hearing none, I'll call for the vote. Mr. Ruben Colon.
Yay.
Miss Jamie Haynes.
Yay.
Mr. Carl Persis.
It's a reluctant yay.
Miss Linda Cuthbert.
Can I ask a question? Because I think if I want to go back to the point where we can, I know I'm listening, we have astronomical numbers today. Our positivity rate is going up. Can we come back and revisit our whole thing? I mean, can we talk about that now, or do you want to wait till after this vote?
That's part 2.
So let's just talk about this one
first.
now.
Okay, because
yes.
I just don't want the vote and then say, oh, we already voted on it, too bad.
Well, no, we don't vote on 1 and 3, period.
Okay,
but 2. But I'm saying, do you have some concern about 2 that you want to make sure that it's clear or directed that we want to give to Dr. Bagabin?
No, I've expressed my concerns. I am concerned about a lot of issues. And I think Mr. Colon is right. It's not for everybody.
Okay.
So thank you. A reluctant yes.
Okay. And Ida, yes. So the vote is unanimous. I think you understand what our concerns are, Dr. Bagabin, as a board. So please make sure that moving forward, I know you have to meet with Ms. Elizabeth Albert and her staff, and we work through some logistics, but can you, if not by probably not by the 28th, but by the 4th, can you make sure that you come and bring us some clear pictures of what this will look like and address some of those issues? Because we should have our numbers in by then, am I correct?
Yes, ma'am.
Okay, thank you. Let's move to the brick and mortar. Again, I know they said, I know many callers felt that we had the choice as relate, but we had to offer a brick and mortar. How that's implemented, when we start, our start time is one of the caveats we have as it relates to brick and mortar. And again, that was one of the reasons when I had the conversation about this, our last meeting, and challenging our calendar committee to look at various iteration of when we start. So if we started, we know we had to start by the 31st. That was a plan that we need to submit. But I know Orange County is submitting a waiver. And so my question is, what is our backup plan? what do we consider reasonable numbers? What is it that we would need for, if you as a board would like for our calendar committee to come back and bring back some other recommendations, that again, if it's something we want to address, I'd rather tell the state now what our backup plan is, if we have one. So I'd like to hear from all of you.
So I can start if that's okay.
Sure.
Go ahead, Carl.
Well, I'm just going to repeat what I've been saying for 3 weeks. When the positivity rate is under 5% for 14 consecutive days, then we'll open up brick and mortar. And that doesn't coincide with Labor Day, Halloween, the first grading period, Thanksgiving. That may not happen till January. But if you really want to do the safe thing, the absolutely safe thing backed by science, unless the CDC comes out with a different guideline, which they're supposed to do by the end of this month, I'm going to go on what the scientists say would be the safe way to open up schools, and not before then. Brick and mortar schools. That's what I would say. Anything else, I think, is just arbitrary. I mean, say the day after Labor Day, September 30th, you're just picking a date, but you don't have any basis for it. So if we're going to pick a date other than what the governor says you have to do, and he's saying you have to do it, but in the month of August, we as Volusia County School Board, we've taken the boldest action. We've taken the boldest action of any district. We've extended it to the limit, the last day of August. Now, other than that date, then we don't just pick a date. Pick it based on science. Pick it on whatever the CDC guidelines are when they come out. That's what we're going to do.
Okay, and so if we do that, then when will we reconvene to make that decision? Because then we got to go back with the calendar committee, know when people are going to start. It will impact the lives of our entire district financially. So we got to be able to give some honest answers, because we're going to be asked these questions. So if that is the case, say we go with this plan, when will we make this determination?
Well, if the CDC guidelines come out on July 27th, then we could know that on July 28th. However, if they don't come out till July 31st, then we could announce this on August the 4th.
Okay.
But you know what I'm saying?
No, that's fine. I just want to
we sort of have our hands tied by the CDC, and I think they are the most nationally recognized body now of scientists guiding the safe opening of public schools.
Okay. All right. Thank you. Who would like to go next?
I will, Madam Chair, if that's okay.
Yes.
I agree with Mr. Persis, because without your health, you've got nothing. And I think, and I've listened, I've read a lot of the emails, the emotional toll that it would happen to students who would not be able to come back and hug their teachers. I understand that. But the worst trauma is the trauma when you don't remember. I was a junior in high school when the seat next to me was empty. And I'll never forget, I was 16 years old and Alan King sat next to me in Spanish 4. He didn't show up one day because he was hit by a bus on the way to school. That was the first time that, you lost somebody you just talked to just a little while ago. I don't want that to happen to any of our students. I don't want our teachers to lose anyone, and we have that possibility. I mean, it's real. It's not like we do have an intruder that might happen once in a blue moon. Does it happen? Yes, it does, and it shouldn't. But the coronavirus is invisible. and it's here. And our positivity rate is steadily climbing. It's today, I think it was during our break, I looked it up. We are, let's see, I think we're at like
12.2%.
yeah,
12.2.
and somebody's even saying it's closer to 13. And then it was on MSNBC tonight. I got a note that there were 20 in Florida. There has been 23,170 cases of children under 18, 246 hospitalizations, and 4 deaths. To me, that's too much of a risk. And all the other things that we have, we don't have the funding to, even if we had the funding, it's scarcity. First of all, it was cement that's so scarce, and our tracks, rebuilding our tracks have quadrupled, but we don't have the funding, I mean, to buy the computers or the broadband or the internet access or the cell towers, even if we could get it. There's the lack of given for PPE. We have little to no advice beyond the CDC guidelines. We're not getting much from the Department of Health. The cleanliness issues, the high positivity rate that I've already mentioned, the faction, I mean, here we're talking about the problem of non-compliance, not just from students, but from parents as well, and teachers. We have potential behavioral issues, the lack of physical space in our facilities. The U.S. Surgeon General gave advice not to open schools. The American Academy of Pediatrics, he suggests that it has to be under 5% before we open. The hospitalizations, I don't think our hospitals can handle the cases. Once our kids start walking in, they're not going to be able to handle the cases that we're going to be giving them. And there are contradictions. This was in the newspaper yesterday. This is a contradiction from our state leadership. Restaurants right now are limited to 50% capacity. The Department of Business and Professional Regulation secretary named Mr. Halsey Bashirs, he has said that no timeline is set to let people return to the bars or the nightclubs because the state has added so many thousands of coronaviruses a day. Quote, these numbers have to stop climbing. It has to flatten. And then there has to be a decrease in that positivity number before they open the bars. Now, if a state leader can say that about our bars and nightclubs, they've got it. Mr. Richard Corcoran can say that about our schools. And so there's too much contradiction. There's too much hypocrisy going on. We are not only in that position, our parents are in the same difficult position. Grandparents, guardians, Dr. Balgobin and her staff, everybody is in the exact same position. And who has put us there? People who tend to ignore what's going on. We cannot afford to ignore what's going on. And so we should, I do not want us to return to brick and mortar. It is much, much too dangerous at this time. When we can flatten the curve, when we can have 14 days of 5% positivity or lower, when we can at least have some kind of testing and contact tracing, then I'll agree. But until then, I don't care how marvelous our plans are, how much we want to go back into the classroom. We all want it so badly because that's what we do. And we've weathered every storm, like that one young lady said, all the different diseases. And this time last year, they wanted us to pack arms on our hips to protect the kids. There comes a time we have to take a stand. And what is it? We just can't take it anymore. So I've let it out a little bit tonight.
No,
so
that's fine. I just have a question. So you're saying that under 5%, 14 days of no cases, and so we will officially not have any school take place until we get that. Brick, mortar, online, Volusia Live. No.
We can do Volusia Live.
You can't. You can't. If you cannot offer it to all 63,000 students, then we are saying, as a district, we will not do anything until we get under 5%, 14 days. Correct? Because now you finna pick and choose what kids go educated, and I'm gonna have a problem with that.
Mhm. I understand, but if they're ill,
I'm just saying. So
I know.
we're
I
saying for
understand.
anybody, correct?
I understand. Yes.
Okay. All right. Mr. Cologne?
Well, as the clock strikes midnight, it's okay, Carl. I want to go through some things really quick. So this.
Hey, I'm at home. You're the one over there.
Oh, I am good. So this is a little bit less emotional for me as much as it is data driven. Harvard just put out they put out a COVID risk assessment, and it talks about a red, orange, yellow, and green. Red being greater than 25 daily new cases per 100,000. They're looking at hospitalizations in their index. They're looking at all of the several factors, not just the daily numbers. Volusia County is currently at 35.7, putting us in the red, which arguably, according to their, would have a stay-at-home order. As I look at the president's plan for opening up America again with the CDC, and this was a plan put out to not belabor the point that phase 1, phase 2, and phase 3 all require a downward trajectory or near zero incidence of documented cases over a 14-day period, none of which right now it has happened. We are quite the opposite of that right now. So going by our own president's plan as well as the CDC's plan, as far as the decrease in number of COVID cases, we are not there. I'm going to go really quick here. As we look at guidance, it talks about a step-by-step plan, which again, clearly we are nowhere near that plan. Today it was reported that Volusia County hit a record at 233 new cases. I reached out to our friends at the Florida Department of Health, and they provided us the data, or they provided the data for today as it relates. And once again, it really is no decline there. I will share with you all, I asked Ms. Boswell, because Chancellor Oliva suggested maybe Pearson, let's say, and he said Pearson because I learned that his wife went to Taylor, so I was wondering how he knew Pearson was there. And, I reached out to Ms. Boswell and said, can you give us a breakdown by community? Maybe Pearson has a less incident and can open, and maybe Deltona can't. And so again, it's not a one size fits all, at which point she did say to me, which is sort of contrary to what we heard last week, that they don't get reports on all the negatives. And what I know is that independent labs have an obligation to report the positives, but not the negatives. And so she really would not commit to giving me that information by community because the numbers are slightly off. Now, again, there's a lot of folks going back and forth on the numbers and whether or not we are there or not. Ms. Cuthbert mentioned something that I look at because I see it every day in my profession, and it is the ICU bed. So currently Volusia County has 547,000 residents in Volusia County. However, there are only 62 ICU beds available today for those patients, of the which my hospital where I serve at has absolutely none. When we look at the reopening of schools, there was a theory of action. This is the document put out by the Department of Health that says, by the Commissioner Cochran, and his quote said, throughout this two constants remain, keeping our educational community safe and ensuring our students receive first-class education in Florida. And I found irony in the order in which that statement was shown. And it talked about a theory of action. Presume the reopening of school campuses, safely. Okay, then it goes on to speak of the moral purpose of school, etc. But one thing it does say, to ensure the safety, take a dimmer switch step-by-step approach rather than flipping the light switch approach. And so for everybody who has said, you all are sending us back to school, let me tell you something. This school board has not voted once to send anybody back to school. This has been a decision by the governor. It's been a decision by the Commissioner of Education. Okay, it was a mandate that was handed down, if you ask me, was an overreach. However, we are all questioning whether or not there's a constitutional ability for them to have that overreach. And so, but nobody on this board has ever voted for anybody to either be out of school or to come back to school. We have not taken that vote. As far as indicators of success, again, this is the Florida Department of Education's plan for reopening, and it starts off with keep Florida's entire educational family safe and healthy. That's the very first point of that slide. It goes through and talks about guidance and it talks about it being a locally driven decision. And so just like Orange County, I think that I have no problem owning a bad decision. But the thought that these decisions are being made, that our constituents think that we are making these decisions, we are not making these decisions. On the contrary, there's a question if we even have the right to make these decisions, because under the state of emergency, the commissioner is given the ability to decide when schools can open. And so again, we can go back and forth. The other part of it is establish supports, partnerships, and communities to make local decisions. And so we've already established that the Florida Department of Health, despite their best efforts, do not have the bandwidth or the ability to do that. And so one of the things that was mentioned in a neighboring county was creating our own medical board. I can't tell you that 5% is a good number. I know Miami-Dade County, for everybody who says Miami-Dade County, they're not opening. Well, guess what? Their number is 10%. They're going to open brick and mortar when they get to 10%. Why? Because they're at 30% right now. And so I don't think, some of our communities are even near 10%, much less to be sustainably under 10%. So I don't know that 5% is attainable. It will never be zero. And I know that that is a very, very hard concept. Coronavirus didn't just get here, and it's not going away tomorrow. And so zero is not an option. And I know that's a very, very hard thing for folks to hear, but there is always going to be some inherent risk. We are never going to get to zero. So the question is, what is that? And I don't know that we're prepared to answer that question. I'm not a medical expert. The Florida Academy of Pediatrics is only one group. And so I suggest that we do put together a group that can come in a board decision. In other words, everybody has a voice and a vote to decide when Volusia County Schools, our community, needs to come. Now, as far as the cloth face coverings, again, I read that earlier. That is guidance coming from the state. And as you guys see, we don't get a whole lot of that. Talks about social distancing. I'm not going to belabor the masks. And so the Florida Academy of Pediatrics issued that letter, and I value what they have to say. I don't know that 5% is the magic number. In fact, they say 3 to 5%. I don't honestly think we'll reach 3 to 5%. But here's my parting message, and it's 12:08, so it didn't even take 10 minutes. We're going to have to decide as a community that we want to change this tide. Our schools are dependent on the community doing something that matters, wearing your mask, doing these things. Guys, we cannot safely, Ruben cannot safely support opening schools when we're not changing what we're doing as a society. I don't see the end in sight. And so if we could, I get it. Some people don't want to wear a mask. Some people think it's dumb. Some people think the numbers aren't right. We can't open until these numbers start to go down. Okay, we can't tell you your kids are going to be safe in school until we do something different as a society. And so it's going to require everyone to do their part between now and August 31st to get us there. And with that being said, just like Orange County, I support asking for that waiver, that it be a local decision and that we be able to make that decision in the same way. Going back to your question, Madam Chair, can we do it? Did we do it well? No, we didn't. Did we do it? Yes, we did. So if not given the choice, my guess is if we get back to school, it'll be 3 weeks before we're going to be facing the music. We're going to be facing the music by schools. we're going to have a whole school that, it's going to be so rampant, the spread within 3 to 4 weeks, that we're going to have to figure it out. And I've said this to Dr. Fritz, and I said it to Dr. Balgobin. I know there's a lot of hands that have been working really, really hard at all of this, but there has to be one person, and again, rainbows and unicorns, there has to be one person who does nothing more than work on how do we flip the switch if we need to flip the switch, whether it's a classroom, whether it's an entire school, whether it's the entire district, and come up and work on that game plan. Has no other responsibility other than to bring the stakeholders. And again, I'm not saying how to do your job, but this is the reality that all of the models are saying, that if we are made to return to brick and mortar, then the chances that we are going to have an outbreak in our community is very, very high. And so that's something that we're going to have to prepare for in joint with everything that we're doing, we're trying our very, very best at doing. So thank you so much. And that's how I feel. I think we should definitely exercise our constitutional authority over our districts. And seeing as we're not getting the guidance that, and I shared this with Chancellor Oliva, there's a big hole in that order, and it's the cooperation of the Department of Health. So thank you.
Thank you, Mr. Colon. Ms. Haynes?
Okay, so I just want to make sure that I clearly understand what Mr. Persis, Mrs. Cuthbert, and Mr. Colon have said tonight. So at the moment we voted to push the starting date back to August 31st, but what my colleagues have said is they do not want us to open and offer any educational services to students until we have 14 days with a 5% or less positivity rate. Is that correct?
That's not what I said.
No, that's not what I said.
Okay, then what did you say?
Well, I said we're going to open on August 31st. And at the same time, that's our plan. We're moving forward to open on August 31st. We're going to submit a waiver to the state for them to consider not forcing us to open up brick and mortar schools until such time as we have that positivity rate under 5% for 14 consecutive days. And if I just may add, I think if we alert our district staff now that if in fact that was a possibility, that I believe our district staff could come up with a plan where they could identify the students that were unable to engage in virtual learning because of lack of hardware or maybe lack of internet access. If we could alert them now, 30 days from now, to give them plenty of notice, to come up with a plan, what could we do so that we could ensure all 63,000 students or more of our students could engage in a virtual platform? What would it take for that to happen? What would it take? Because it's not like we have to issue out 63,000 laptops. Most of our students have them. It would be putting out laptops for those students who do not have them, and then getting with our internet providers and getting them on board to make sure that the internet access, the hotspots are there, so that they could engage. And if that didn't work, perhaps in our waiver, we could have some sort of option where we would provide a virtual online platform for all students, and with the exception of those students for which it was not possible, that we could provide a brick and mortar option for those students and for those students only, and then we could go about addressing how we would do that. And if we had enough time, I'm confident in this district staff, they can make anything happen. All they need is an ample amount of time and the resources. They will make it happen. So I am confident, I'm fully confident in our district staff being able to do that. I believe that if they could do what they did in the month of March last year with basically 5 days notice and come up with everything that they did, and for the teachers to do what they did, and while it wasn't perfect and while mistakes were made, some of those situations turned out to be very good. And you and I, all of us on the board, have heard from parents who have complimented our district about what they did with such short notice. So I think we have learned from that, and I think we can carry over from that. I think we could do it, Ms. Haynes, but I'm trying to answer your question. I think we are sending the message right now that we're going to open on August 31st with the 3 options, and we're sending option 2 to the state, and we're hoping the state will approve our option, which I think they will, because they have approved similar options in all the other districts. But I still think at the same time, it would be a good thing for us to submit a waiver.
No, Mr. Colon, what is it you're proposing?
So in being able to ask for that waiver, maybe for Pearson, let's say, we continue to stay hot, it would give our board the ability to say, you know what, maybe some of the kids go to school. Right now, what they're telling us is you will go to school 5 days a week.
Exactly.
And so if we realize that our community spread is not there, and we could do a Monday, Tuesday, Thursday, Friday situation, it should be up to us versus them telling. See, my issue is the 5 day a week. And there were counties that came up with innovative plans. Example, Monroe County, they have a school with 600 students. They said, we're going to do AB. And so those kids were able to get an education, but not having that flexibility is killing me. And so do I think that, once we know the numbers, it'll be better? Do I think it's going to be balanced out? I can tell you a lot of the parents in my community are going to send their kids to school. And so if we could find a way to do that successfully, but right now we're not giving any latitude. And I honestly believe that our constituents truly feel like we're making these decisions, and we're not. And so I'm okay if I come here and say, you know what, I think schools are safe to open at 10%, let's say. Okay, let's just throw that. We've been less than 10% for 14 days. Then I'm okay with owning that decision. But not having the flexibility or the option to be able to exercise what we've been tasked to do, that's where I have a challenge with it. And I think that's something we'll have to look at. And like I said, I like what Chancellor Oliva said, because he really, in our conversation, he really made it sound like, guys, you have a choice. And so I think that's part of their backpedaling a little bit, but realizing that, we are the decision makers constitutionally wise. I guess that's not a word, but it's after midnight.
But that's okay. I think if we really had a decision, then they wouldn't be getting sued, and they could put it in writing. They really could tell us, hey, you know what? We're going to let you do that. They have yet to do that. So I think that's a little disingenuous on his behalf, honestly, because if that was the case, they could say that. But go ahead, Ms. Haynes, I'm going to be quiet.
I'm still a little confused. So what I'm hearing is, at this moment, we voted on August 31st, and we are planning on sending out or having Dr. Balgobin send out a link for parents to register which choice they want right now for each of their children out of the 3 options, with the thought that we're starting on August 31st. But what the 3 of you have said, though, is if we're going to submit a waiver at the same time, that if on August 31st we are not, I heard 5% or less for 14 days, then we're not going to, we're asking to not open brick and mortar. And if we're not opening brick and mortar, are we opening Volusia Online Learning and Volusia Live? Or we're not opening anything?
Volusia Virtual. That's what I'm thinking.
How are we opening it?
How are we opening it?
Yes.
Well, first of all, it would depend on so many things. First of all, you have to have this 14 days track record. And so you're going to know that ahead of time. I mean, it's not going to happen just one day. So you're going to have notice of the trend. Secondly, we're going to have the state approve the waiver. State may say no. I mean, so that's why we have to go forward with our plan of August 31st with the 3 options. That's what we're saying tonight. What our hope would be is that the state would enforce us into that situation, and that they would allow us to open up at some point other than that, and that's what we would go forward with.
Ted's got his hand up.
I'd like to hear what Ted has to say.
Go ahead, Mr. Doran.
Okay, so I don't think we can speak with any degree of absolute definitiveness literally tonight on this, because I didn't see this coming really. But I tried to allude to this when Mr. Colon asked me about the ramifications of not following the order. There are many escape hatches in that order. And the main one is the one that Mr. Colon has made reference to, which is the, and I don't have the order sitting here in front of me, but it's referenced. We've mentioned it many times. It's, you know, we're making this decision based on, you know, the information provided to us by the health departments of either the state or local, and you work with them and whatever. And since even that conversation, that meeting, I've seen a couple of articles come out where I'm seeing quotes out of the Department of Education where they're backpedaling. You know, that word was used a minute ago, and that's the reality of it. You know, they know they want it both ways. They want to be able to say they ordered us to open, but they also want to be able to walk away from this if it goes bad. And I hear, you know, a lot of very specific information, health related, maybe not coming directly from the local health department, but you guys, man, you're amazing. I mean, you've really done your homework. I mean, to listen to you guys, I'm sitting here thinking, oh my God. So, you know, there's a lot to work with here. I mean, if you're going to make a decision not to open brick and mortar, you've laid out in the last hour or so all the reasons not to do it. And whether it came from the health department or not, it's pretty clear that that order has that caveat. And maybe you need a waiver. I don't want to render an opinion on that as I'm sitting here literally right now. You know, ask me tomorrow afternoon, maybe. Just give me a little bit of time to look at it.
Tomorrow afternoon or this afternoon?
Well, this afternoon. Yeah, this afternoon. But maybe you need the waiver. Maybe you don't. You know, maybe I can give you an opinion that says you don't need a waiver because of all the things that we've been discussing. So, and maybe you take the position that you don't need the waiver, but you'll ask for it anyway. I mean, there's a number of various options here. But you know, I'm hearing pretty clearly, at least a majority, if not all of you, providing some pretty specific opinions about what it's going to take to open this brick and mortar, and I think there's a path. If you want to do that, I think there's a path to getting there. So, but I don't want to be pressed to give you exactly what that path would be as I'm talking to you. That's all I've got, unless you have a question.
Okay,
I mean,
thank you.
The constitutional stuff, and that's the argument that's being raised in the litigation. I only know what I've read in the paper. I haven't pulled the lawsuit to see exactly what they said, but it's Article 9, Section 1, and that very specific. It's hanging over Ruben's head up on the wall somewhere there. The exact language of that constitutional provision, right? And so it's the same. It's the same provision that we sued under when we sued the House and the Senate on the CDC litigation, and for different reasons. It wasn't a safety issue, but that word "safe" is in there, and I think it's a very, very legitimate question that they've raised, and they could easily be successful on that. But I don't think we have to go there. I think that the order that is presently in place has enough escape hatches in it that we can point to them if we create a record, which you've basically already done, and set the groundwork for a decision down the road, meaning in 2 weeks from now, if things haven't gotten better. I think there's a path to getting to under the orders, letting the department know that pursuant to their order, we have elected not to open the brick and mortar option, if you want to go there. That's all I have, Madam Chairman, unless there's a question.
Thank you. Go ahead, Ms. Haynes.
Okay, so I just want to say this, that if we don't open up, we go down this path and we don't open up brick and mortar, do you all clearly understand how many employees we are going to lay off?
And so,
Yeah.
to answer that, Ms. Hayne, I think that's a decision that we will make as a board. That's not and everything Ms. Wright has said today, that's valid. That's something that we will have to consider. Everything you've said about Pearson, I have an area in Osteen that doesn't get Wi-Fi. These are all things that we're going to have to consider. And again, I have no problem making a bad decision for whatever reason I decide that is the right decision. However, all I am saying is it should be up to us as a board to make that decision as time progresses. And I know our community is going to go out and start doing the right thing tomorrow or today. But if it's not safe, it's not safe. And all of the information I've brought today is the same guidelines that were put from our president to guide us on how to open schools. They laid this out. Our CDC, this was the president's plan for opening. This was objective. It had numbers in it. It said, these are the things that we're going to look for to safely do it. So the fact that we are being asked to flip a switch, which is ultimately what we're being asked to do, maybe we dim. Maybe, and that's exactly the language that was in there. Maybe we dim it. Maybe we start smaller classes, but it's having the ability to do that because we know we don't have the technology. Maybe it's taking high schoolers and giving them the laptops and bringing half the students from West Side over to the high school to go to school. These are things we can do and still provide that social distancing and do all of that. But to just simply be told we're going to flip a switch and you guys are going to open up and everything we've said all along that was objective goes out the window, that's a hard pill to swallow. And it's what the same people who are telling us you're going to open are the same ones that came up with that guide. You know, they came up with the language that said 14 days of declining cases. And so I just think we should, as a board, have the flexibility to decide. And trust me, it's not black and white for me. I can tell you 5%, to be honest with you, is way low. I don't think we may reach 5% by June. I really, truly don't. And so again, we have to look at what the medical professionals in our community put together, say, because, you know, that was CDC. That's not us. That's not partisan. This is the president's plan. And so anybody who, you know, I mean, I didn't come up with this. And so I just think we should have the flexibility. I personally did not mean the waiver to tie us down to 5% and make that decision tonight. I don't think we are the right ones to make that decision. But I think we do have a community of folks that are willing to help us.
And that is not an actionable item we could take tonight. Actually, it was for discussion purposes, because I've heard a lot, and I'm like you, Mr. Cologne, we have not voted on a brick and mortar. That's what we were told. We worked within those guidelines. The 31st, again, I'm the first person to say I was hoping that the committee actually looked for September, but they went to the 31st because we understood the implications if we did not go to the 31st. And that was our very last day as it relates to submitting our plan. I just kind of want to be clear too, as we have this discussion, opening schools for one group of people. And that is exactly what would happen if we went virtual. You would not be providing services for all students. And I'm sorry, that is our reality. And I hear what you're saying, Carl. We can't come up with that many computers. We just can't. And there are families that have 2 or 3 children in the family. That's part of the reason. And they may have you're right, they may have a device at home, but they have a device. And we heard a parent today who's working from home. So she had to share her computer. I have an email from a parent, and the reason why this is really tough, I have a parent from Publix, and I don't want to go into the full email, but she and her husband both work. One work at Publix, one work in the construction business. And the question they asked, so it's okay for them to go die, but we don't want to have any skin in the game. It's okay to say, put my kids virtual. She wished if every store in America could close today, every gas station, every store. How many of you would sit then and yell and scream because you cannot get your basic needs met? And that just kind of hit home with me, because all of us, I'm sure, go to the grocery store or go somewhere. But when she sent that really struck a chord with me, because that's how she felt about her children. Her children's basic needs are not being met. And we should be just as essential as the person who works in the grocery store, her husband who's a construction worker. That's what we say we do. And so I get that. And so I'm not gonna say we're between a rock and a hard place. We just gotta take all of this and be mindful of the decision we make. Everybody won't be happy, but we gotta do the very best for everybody. And that's true, everybody won't be happy. And so that is why I'm asking, if we say delay, then we delay for everybody. We're not gonna say, that's my personal opinion. Well, we'll do virtual live and we'll do no, because if I'm hearing part of the issue with virtual live, because some people still don't want to come to the campus. We're saying, okay, they'll come to campus, nobody's there, they'll teach to the students. You're gonna have some people who still don't want to do that. But then we're gonna have some kids who still won't have access to the technology. So I'm just saying, I agree, we gotta find a way. You said something, Mr. Cologne, we've had a discussion. I'm not even sure if we have enough computers for all of our seniors, because that is something I did talk to Clint about. Do we have enough laptops? That if we had to have our senior high school students who need to start getting acclimated to the virtual environment, to service them. And I don't believe we do right now. Am I correct, Dr. Bagobin? And so that was an issue, because I thought of that. You know, is it a population that we could give all of the technology to help with some of our concerns? So we're still at a deficit. We'll still leave some people behind. And so if our goal is to make sure everyone is safe, everyone is provided with a good quality education, that means everybody's got to have access to something to receive that good quality education. So any more comments? Because it's something, you know, we can chew on and we can talk about in our next meeting, or even on the 4th, because we have an early meeting. But as we work through option 2, as we look at the numbers, we probably need to talk about this a little bit, because I think if we have to submit the waiver before the 31st. So again, if it's something we're saying, and again, I think the hard truth is, if we decide to move in the direction of asking for a waiver, or if our school board attorney say, well, you really don't have to, you can just do it. Again, we got to go back to a calendar committee. We got to look at the starting dates for teachers. We got to look at the starting date for everybody, because it will impact everyone in the district. Okay.
Yeah, I think that's great. Madam Chair?
Yes, sir.
Yeah, I just want to say, you know, I think we've already proven that if the governor would just say, or county would just say, like we proved in April, when we shut everything down, whenever we did, you know, cases went down. And we've proven that we are in control. But we're not in control. We don't seem to be we don't seem to have the voluntary spirit right now to want to do it. Many of us do, but many of us don't. And we need to be directed by a higher authority, be it our governor, by our president, by our county manager, whoever that may be, but someone just to tell us, you know, we got to shut down again. We got to all wear masks. We got to all do this. And if we can just do that, maybe our dilemma about opening schools safely, we won't have that problem, because the positivity rate will go down. But if we continue to do what we've been doing, and Mr. Colon and Ms. Haynes, Ms. Cuthbert, we've all said, we don't have any confidence that this rate is going to go down. It may continue to go up. And then we're going to be all so fearful. It's going to make it so much harder for us to open up schools, particularly hard for those parents to send their children to school, and particularly hard for teachers to want to come to school. I mean, what if school was starting tomorrow? How safe would any of us be about sending our children there, about teaching there? I mean, it's not good. And we just gotta, somebody has to have a plan. Someone's got to do something differently to get us all to control this spread. And Mr. Colon, I don't know. I mean, I think there's a lot of people understanding that, and they are doing it, but there are a lot of people that are not. And we're not all on the same page now. And that's unfortunate. But Madam Chair, I just want to say, I thought tonight was a great meeting. We did accomplish our goal. We did approve option 2. We are sending it to the state, and we do have a new start date of August 31st. And at least we can leave knowing that. And if new information comes before us, perhaps Ted can research a little bit more. If we know more by our next meeting on July 28th, that's only a week away. I think we've done very, very well tonight. Very well. And everyone's been very patient.
Yeah.
Very patient. I
Well,
mean, it is almost 1 a.m., right? So.
But I think we all knew that. We knew this was going to be an extremely long night. We want to hear from our public.
Yeah.
So we kind of.
And I want to compliment you personally, Madam Chair. You handled all those callers very nicely tonight. Showed a lot of patience, a lot of graciousness, and that was very nice. That reflected well on all of us. So thank you, Madam Chair.
Because
and,
we are
and for the 10 people who are still watching us right now.
And it's
My husband
probably,
said it's about 1,000 people still watching us.
yes, they are.
And so we are concerned. We're generally concerned. And again, we want to hear from everyone. And like you said, we average about 200 emails a day, and we're hearing from both sides, those who want to, and teachers who say, I volunteer, I want to go back to the classroom, I will volunteer, versus those who said because of issues they cannot. So we want to be respectful. This is not an easy decision. It's a decision we have to make, but we do have to look at everybody. So we got to look at our teachers, our paraprofessionals, our staff, our faculty, our students, and our parents, and our communities. Because, most of our community leaders saying, what, we are slowly opening up. The expectation is for our people to go to work. They need their children. And I don't want us to look at us as babysitters, because that is not the truth. The truth is that they're taxpayers and they pay for their children to be in school. So they do pay. And so, so we do. We just a lot. Anything before we close? Anything, Ms. Cuthbert, Ms. Haynes, Mr. Cologne?
I have
Go
my
ahead.
hand up.
Oh, I didn't see your hand up. Sorry.
Yeah, thank you. We all want to go back to school. We really, really, really do. Because it's in our blood to do that. We want to go, but it has to be safe for us to go to work. And it's our kids. Our kids are going to work too. They're just not getting paid. And they do a heck of a lot of work. We are different from other businesses because we interact on a personal basis in a public setting, subject to public scrutiny and public laws. So we're different. I've used the highway. I follow the traffic laws. And the county or the state or the federal government has paid for those highways. I go to a car dealership. My car's in the shop. And they're all wearing, there's a sign on the door that says, stop, wear a mask before you walk in. I saw my dermatologist. I had to call from the car. Everybody has their regulations. We deserve those regulations too, to protect the people who walk in our doors. I'm very grateful. That's why I asked the question each time we voted, is do we now discuss talking about either opening or not opening? I'm grateful we have delayed it to the 31st. It's a smart move. We do want to offer the options for our parents because we're educators. That's what we do. And our district did a great job setting out the plan. There's still lots of details to be made, but this is the first time they've ever been created. There's a lot to work through. We cannot come up with this right off the bat. We need to work with Volusia County Council. They are a county-wide entity. Our beaches are still open. Our movie theaters are closed. The bars are closed. The restaurants are at 50%, but everything else is open. So if we're going to let you said there are 547,000. Of those residents, are those registered voters or those residents? And I just wondered because 63,000.
I think they're residents.
Okay, 63,000. Okay, 63,000 of those people are children. They have a right to go to work in a safe environment. So I think we need to come back and revisit this. If not next week, definitely by the 4th of August. And it was kind of canceled, but I think we need to come back the 4th to see where we are. It's 2 more weeks. Are we still climbing? Are we starting to flatten? Are we still starting to show a decline? We need cooperation from Volusia County. Now there's some communities who have stood up. New Smyrna is pleading with Mr. Kelly right now to restrict the beaches on the weekend. There's been, I haven't heard lately, but I don't think there's a whole lot of cooperation there. Daytona, I think it was, who were the other, Orange City, all had different mask mandates. It's the people who've had to take control because people above are going this hands-off business. We do well in our business, and that's education. When it comes into the law, like when they wanted us to arm our teachers, when it comes into medical issues, the coronavirus, that's where we need help and we need additional leadership. We can't do it all ourselves. So I think we need to contact the county to say, you're a county entity and so are we. We cannot do this alone. The majority of your workers go work for Volusia County Schools. If you don't control the virus, the majority of your employees in this county are going to be laid off. 63,000 of your youngest, most treasured, precious people are vulnerable, along with their teachers, along with those families. We could have, if we go back, we could have a really huge problem by the end of September. And I don't think the Volusia County Council wants that. We need to work together to find some kind of agreement to help contain this virus in our county so we can go back to school safely. So that I know it's very late. I apologize for making everybody stay later, but I think that's a good thing we need to do. So thank you very much, Dr. Balgobin. Thank you. Another meeting in your notch in your belt. So congratulations. Colleagues, thank you. We have been so unique. We get to share so much with each other, and we still like each other. I think we do.
We do.
Jamie has thrown a thing or two across the room here a few times. I've had to duck a little bit here.
And we've had some of the most fabulous interaction from our constituents, our employees, our bus drivers, our students, and terrific Seabreeze High School student who called us personally and online as well. So thank you for everyone's cooperation, and for all those people who are still hanging on to listening to us. Thank you very much. We're trying to do the best we can for all of you. Thank you.
Thank you.
Thank you, Madam Chair.
You're welcome. Any more comments, guys?
Yeah, I just want to send a shout out to all of our district staff who is up in their offices still. I know Patty Core's still here, and I'm sure when we walk out, we'll see everybody, but a lot of the folks don't realize that a lot of the district staff is sitting in their office, prepared that if we had a question, they would be prepared to answer that question and know they're not sitting at home. So again, I want to send a shout out to all our district staff, and I just want to close with, I would rather always err on the side of caution and first do no harm. And maybe that's the healthcare side of me, but that's what plays in my head. So thank you. And again, thank you, everyone. And one last comment. I know a lot of folks are saying, oh my God, their meetings are so long. Let me tell you something. You all are seeing real discussion. There are no backroom deals. That's why this all takes place right here in front of everybody, because this is not a rubber stamp board, and we do have questions, and we want you all to hear the questions and the answers. So thank you. And I have nothing else. As if I haven't spoken enough.
You have.
I know.
Anything else, Ms. Haynes or Mr. Persis?
So do we say good night or good morning? I'm just.
It is.
Good morning.
I will see you later. Have a great day.
You have a great day.
We thank God for a new day. So you have a great day. But bye, everyone. And next week, Linda and Carl, you will drive to DeLand.
I'll be here.
I don't want to do that.
Have a good evening, everyone.
Bye.
Bye-bye.